It means hours. Yes. I'll text you. I won't email you. I'll text you. I'm sorry. I was tempted though. Socially distant. My husband, we've changed the name. We're not calling it socially distant. I'm writing a test. Upside.
Steve?
Yes.
From that perspective, yes, but other receipts.
Okay, good morning, everybody. The meeting's now called to order at 9. We'll begin with a moment of silence, silent reflection, or silent prayer. Let's all keep in mind all of our frontline healthcare workers and first responders who are quite literally putting themselves in harm's way every day for all the people of San Joaquin County. Thank you. Supervisor Elliott, will you lead us in the pledge, please?
Please rise. I pledge allegiance.
Thank you. For the record, this is the San Joaquin County Board of Supervisors meeting of Tuesday, April 7th, 2020. Will the clerk please call the roll?
Supervisor Villa-Prueba,
Present.
Supervisor Patty, Supervisor Wynn,
Here.
Supervisor Elliott,
Here.
and Chair Miller.
Here. Thank you. We have a couple of recognitions. First, we are proclaiming the month of April 2020 as Child Abuse Prevention Month in San Joaquin County. We typically do this every year, but most years we are able to enjoy several rows full of children from the Child Abuse Prevention Council's preschool who come with their pinwheels and usually serenade us. Unfortunately, they're not coming in today. They're staying safe, and we will miss them. But if the clerk would please read the proclamation.
Okay. Whereas child abuse and neglect continue to pose a serious threat to our community's children, and whereas child abuse and neglect is a community problem and finding solutions depends on the involvement of people throughout the community. And whereas all victims of child abuse, whether physical, sexual, emotional, gross neglect, or exposure to domestic violence, should have access to a safe place to live, appropriate medical care, and counseling or mental health services. And whereas parents, guardians, family members, foster care providers, child care providers, educators, law enforcement personnel, medical professionals, mental health professionals, social service providers, and the public all play an important role in working collaboratively to prevent child abuse and neglect. And whereas the state of California has proclaimed April as Child Abuse Prevention Month, now therefore be it resolved that this San Joaquin County Board of Supervisors does hereby proclaim the month of April 2020 as Child Abuse Prevention Month in San Joaquin County and encourages citizens to work together to support youth serving child abuse prevention activities in their communities and schools during this month and throughout the year. Presented the 7th day of April 2020.
Thank you. I'm going to ask if any of the supervisors would like to make any comments. Supervisor Villa-Prueba?
Yes, I just want to thank all the providers who take care of all the children, and I know that child abuse is a huge thing in the world, and I want to thank everybody who takes time out to take care of kids, and nothing best but for our children. Thank you.
Thank you. Supervisor Patty?
Thank you, Madam Chair. I had the distinct privilege of being on the Child Abuse Prevention Council board for several years and helping them, and we usually do a duck derby every year, raising funds for their efforts. The staff, the action that they take, the engagement, the impact is exceptionally meaningful and of magnitude, incredible magnitude. Lindy Hardy-Turner is doing an amazing job, and back when I was on the board, there was no project or vision that was too big for what she wanted to do and how she would expand and increase and take on more on behalf of our local kids and families. I'm disturbed recently. I was reading that in the newspaper during this coronavirus that there's up to a 50% increase in domestic violence, and of course kids are the most vulnerable. So all of the work that's done at our local agencies and the caretakers and the providers is very meaningful, and we are grateful for that. Thank you.
Supervisor Wynn?
Thank you, Madam Chair. I would kind of reiterate what Supervisor Patty says. There's always a concern during times of depression or recession and economic downturn that, as he says, domestic violence and certainly child abuse can be component of that. So certainly appreciation for those who actually get out there and help with the problem in regards to, protecting these youth, and hopefully that this crisis we're going through will end quickly, and those who, for example, lost their job or whatever and causing stress, which leads to other abuses such as alcohol and drugs and those things, would come to a halt and we can get back to normal again.
Thank you. Supervisor Elliott?
Thank you. The prevention of child abuse is certainly a very important issue for us all, and it's certainly appropriate that we take this time to recognize that and recognize all those who help to bring this issue to the forefront and keep us mindful that that's something that we need to be mindful of and prevent on as wide a scale as we can. since the children are our future, we definitely need to keep them foremost at a time when the entire community is going through a crisis.
Thank you. And I just want to echo my colleagues' sentiments. The folks that work so hard every day, often for not very much pay, to take care of our youngest and most vulnerable residents. Our hats are off to all of them. They have our gratitude. As someone who lived through many years of domestic violence, I understand how really important they are to the safety net for our kids here in San Joaquin County. So all our very best admiration and gratitude for all the folks who take care of our children in San Joaquin County. Clerk, our next proclamation.
The next proclamation is proclaiming April 2020 as Sexual Assault Awareness Month in San Joaquin County. And the proclamation reads, whereas sexual assault is an intolerable violent crime with public health implications for every person in San Joaquin County as a victim, survivor, or as a family member, significant other, neighbor, or coworker of a victim survivor. And whereas no one person, organization, agency, or community can eliminate sexual assault on their own, we must work together to educate our entire population about what can be done to prevent sexual assault, support victims, survivors, and their significant others, and increase support for agencies providing services to victims, survivors. And whereas Women's Center Youth and Family Services has led the way in San Joaquin County in addressing sexual assault by offering crisis intervention and supportive services to victims and survivors and their significant others, operating 24-hour helplines, responding to emergency calls, and providing forensic medical exams, providing accompaniment to court and/or criminal proceedings, and empowering those impacted by sexual assault to chart their own course for healing. And whereas ending sexual assault in San Joaquin County must include active public and private efforts to end sexual violence in collaboration with Women's Center Youth and Family Services, including conversation about what sexual violence is, how to prevent it, how to help survivors connect with crucial counseling and other support services, and how every segment of our society can work together to better address sexual violence. And whereas staff and volunteers of sexual assault programs in San Joaquin County work year-round to empower survivors and encourage every person in San Joaquin County to end sexual violence and support services by providing prevention education and information to schools, churches, civic organizations, as well as medical, mental health, law enforcement, education, and criminal justice personnel regarding sexual assault issues. And whereas Women's Center Youth and Family Services requests community support and assistance as it continues its efforts to bring real hope for eliminating the tragedy of sexual violence in San Joaquin County, to create a future where all women, men, and children can live free from violence and exploitation. Now, therefore, be it resolved that the San Joaquin County Board of Supervisors does hereby proclaim the month of April as Sexual Assault Awareness Month in the County of San Joaquin and commend this observance to all citizens. Presented the 7th day of April 2020.
Thank you. Supervisor Elliott, would you like to make a few comments? We'll start at this end this time.
All right, thank you. Prevention of sexual assault is another major issue that we need to face in our community. So it's certainly appropriate here to recognize both of these efforts that are ongoing now, the prevention of child abuse, the prevention of sexual assault. And I'd like to commend the Women's Center Youth and Family Services as well for their efforts to keep this issue in the front of the public awareness. So thank you for all you do.
Supervisor Wynn?
Thank you, Madam Chair. Sexual assault is really an abhorrent crime and it should not be tolerated in any way, shape, or form. I would comment in regards to the Women's Center, seeing what they've done in other similar shelters. They are literally lifesavers in regards to not just women, but children, et cetera. And I think what they do is and having seen firsthand the violence and also on top of that, the care that they've given women is phenomenal, and certainly they should be recognized and congratulated for their efforts.
Thank you. Supervisor Patty?
Thank you again, Madam Chair. Yeah, I mean, this is a profound problem and a concern that those on the front line that are helping and working and fighting on behalf of our citizens and against this violent assault that's unfathomable, but unfortunately a reality. It's important that we're working hard to stop it as much as possible. I know that our district attorney is here, Ms. Tori Verber, but she's a very strong advocate and a proponent and an activist in stopping and fighting human trafficking going on in our region. In fact, Madam Chair, you might want to even call her up if she wants to share a little information on the efforts on human trafficking. But we're glad that there are people on the front line fighting and protecting our citizens as much as possible. And education and prevention and awareness is very important and impacting as well. Thank you.
Thank you. Supervisor Villapudua?
Thank you, Madam Chair. Just like to also recognize the Women's Center and all the hard work they do to prevent prevent this, and all the people who, all the counselors and law enforcement who have to deal with this, and I want to recognize all those people. Thank you.
Thank you, and I will add my thanks. It's a privilege for the board to proclaim April as both the Child Abuse Prevention Month and also Sexual Assault Awareness Month, in recognition of all the hard work and really dedicated people that apply themselves to these problems in our county every single day. So thank you very much. Now is the time for public comment. Comments are limited to 250 words or less and may be submitted by sending an email to cobrecords@sjgov.org. Please, no personal attacks. Every effort will be made to read all the comments received into the record, but some comments may not be read due to time limitations. Comments received after an agenda item will be made part of the official record on file with the clerk of the board if received prior to the end of the meeting. Comments made on YouTube are not considered part of the official record and will not be shared with the board. First up, I have a request from our county assessor, recorder, county clerk, Mr. Steve Beslarides, to address the board.
Thank you, Chair Miller. Before I start here, let me get ready. My wife makes me wear the mask at home so I can refrain from eating when I'm in the house. So I've gotten used to wearing it indoors. I'm here just for a matter of record. I exchanged some emails with Ms. Nino, Chairman Miller, Vice Chair Patty, Supervisors, Mr. Miles, Ms. Nino, Steve Beslarides, County Assessor, Recorder, County Clerk. A series of emails have been exchanged and a lot of miscommunication. I know that these are sensitive times. I received an email last night that I looked at 6:30 that informed me that my employees would not be bound by the permission that I gave them, and I wanted to not hit accruals and to allow for the HR 6201 directive. In our exchange of emails, I requested to come and speak before the board as a matter of record. I don't know what's going to come of this. I just want to speak from the heart, and I will tell you, in an emotional way, I've probably cried more in the last 3 weeks than I've cried in the last 27 years. This pandemic is affected all of us, and I'm going to finish with a poignant story about how it's affected the assessor's office. On March 24th, before this board, County Council, Human Resources advised that HR 6201 was effective, by the Department of Labor was effective immediately. It was said 3 times during the meeting. We moved pretty quickly. Sometimes that works with us and sometimes it works against us. I spoke to all my staff the following day and informed them that based on the information that was provided to us in the public setting, that they could take 80 hours of sick leave and the affected employees could begin on March 26th. And I think as the department head, with the information that I had, it was within my rights and I'm not going to cite any legal authority, but it was within my rights to do so. Subsequently, on March 31st, the board did act and did report erroneously that pursuant to March 24th meeting that HR 6201 was effective immediately, and subsequently found out that it was effective April 1st. So I send employees out, giving them my word that they're entitled to get these benefits. They left, and then a week later, it gets changed. I received a phone call from Ms. Nino after an email was sent where she instructed the ACO to adjust payroll codes for my employees. And I did recall the conversation I had with Mr. Becker as well, and the Director of Human Resources. And so, you know, for me, it's the credibility that we have with our employees and the integrity that we have, and it's the discussions that I had. And with all due respect to the Director of Human Resources, said she made the same mistake that we did, and that she was going to roll it back and tell her employees that they were going to have to use accruals. And I told her I'm unable to do that, as I gave my word, and my employees, based on me being their department head, relied on what I told them. I had a conversation with Mr. Becker regarding the accounting of the accruals subsequent to the March 31st meeting, and I said my choice is to falsify time records and say that they were working here when they were not, and he said, no, that's not a good thing. I remember that was said, and so we documented the time pursuant to the March 24th meeting. So let me strike an emotional chord now. I wrote a letter to the assistant assessor, recorder clerk, that I want to read into the record. It was Friday, March 20th. Karen, I wish to send you this for the record, since our decision has brought upon undue criticism that has to be defended on April 7th. That meeting was moved up to the March 31st meeting. I believe the curve for the virus under the best circumstances will last another 30 to 45 days from the date of our decision. On March 18th is when we decided. I'm grateful for a management team which demonstrated the fortitude, put the health and safety of our employees over political correctness or monetary motivation. The investment in our culture over the past 4 years has begun to blossom. I expect that it will continue to grow. As I always say, our true character emerges in the face of adversity, and I am very proud of our team. Your leadership has and will continue to drive operations so that we may fulfill our constitutional responsibilities. Putting others before self is a rarity these days and can only come from the heart of compassion for others. This is the spirit and new light that guides our department, that will illuminate our future. You and Wakar are the keepers of the future for the auditor, for the assessor, recorder, county clerks. I hope and pray for the health of our entire department, their family and friends. Keep up the good fight and prepare for the long haul, as this too shall pass. With the greatest admiration, respect, and love, I have been a public servant for many years and have a competent track record for doing the right thing. And for this very purpose of calling is to listen to the people and serve the people. And I have sacrificed time to this mission as well as my own family time, especially in this time we need unification and support. So we respond and react to avoid any potential consequences of what may happen. And I want to share with you something that came to my attention yesterday. And out of the privacy issues, I want to be really careful what I say here. When people go to the doctor, there's 4 questions that are asked. You have international travel in the last 14 days. Have you had any exposure to COVID-19 in the last 14 days? Do you have an immune system compromise or chronic lung disease? Do you have any vulnerable family members? 2 of the 4 were answered no. About a week ago, this employee was seen in urgent care and was given erythromycin and albuterol. She did not feel much better the night, complained of having more chest pains. Her assessment was upper respiratory infection and viral, cannot rule out COVID-19. suggested staying home for 2 weeks, sleeping with head elevated. The following symptoms worsen or persist longer than a week to come back. So the billing thing was upper acute respiratory infection, unspecified, in contact with exposure on bacterial communicable diseases. This person was in our office when we sent people out. Okay? Ms. Nino in her email said that I was superseding the authority of the Board of Supervisors to make policy, and in no way would I ever do that. We have to take action as department heads and make the decisions that we think is best. And in this case, it protected a lot of the employees that were around this person. And this was just, I just found this out and talked to her. Her symptoms are continuing, and I asked her to please go to the doctor and try to get tested. So I don't want to argue and I don't want to fight. We make decisions. Now, this is Holy Week, and we need to be more compassionate. I look at our employees as we do our families. We're all brothers and sisters. We have children. We have grandchildren. This is unprecedented. To the extent that I've offended any of the board members in the appearance that I've circumvented policy, I apologize for that. I gave my word to my employees that they were going to get paid as I understood immediately and took action based on what I saw. And now the conundrum is I have to come and plead before the board to say, please let me honor my word. And if not, I know that my employees recognize that I stood up and tried to advocate for them. The other departments withdrew their request, and I don't know what arrangements were made, but I think it's safe to say that the other departments predominantly reported to the CAO. It's much easier when you have that chain of command to make decisions than when you're independent and have to make decisions with what we feel at the time was the best interest. So that's it. Thank you.
Thank you, Mr. Pesolarides. Will the clerk now read the additional public comments that have been received?
Yes, ma'am. Okay, our first comment is from Eli. It says, Dear Board of Supervisors, we have read the shelter-in-place orders, guidelines from the state of California, and do not see any reference to golf courses. We believe that the San Joaquin County public health official indicated that he will not allow golf courses to open until the state directs so. Obviously, there will not be any such direction from the state because they never directed courses to close. Bay Area public health officials directed public courses to close because these courses require going inside the clubhouse, paying fees, and renting golf carts that are often used by others. All of those factors are risks that private courses can avoid. We also believe it is easier for private clubs to mandate certain behavior, social distancing from their members. Attached is an article from the Sacramento Bee regarding this issue. We, ages 69 and 71, could travel 28 miles from our home in Woodbridge to play at Bartley Kavanaugh. We would rather stay close to home, play 2 miles from our home at a facility where we trust their efforts to provide adequate measures for sanitizing and social distancing. Sincerely, Bruce Hentz and Eli Egleben. I apologize for mispronouncing that name. And there is a link to a news article attached to that email. The next comment reads, Today was a beautiful day to do my normal walk, almost every Thursday for the last 30 years, golfing 9 holes. Unfortunately, the course was closed. It is very easy to stay away from people. Even on the greens, 15 to 20 feet away is easy, even further. Please reconsider opening private club courses for golf. I even think public courses could open with an online tee times, further apart, payment online, people walking instead of carts, and still stress staying a good distance away from people with no congregating before or after. Please allow private golf courses to open for play. We have lots of space, not congested cities with lots of people. Thank you, Arlene Mataga. The next comment reads, Dear Board of Supervisors, I find it ironic how the homeless population in San Joaquin County are allowed to be on the streets while the state of California and the county is forcing martial law to healthy, tax-paying San Joaquin residents who are forced to close their businesses and be at home. The state and county should have first gotten every homeless person into a camp for medical quarantine, health services, drug detox, therapy, work training, welfare, etc., etc. Homeless defecate on streets, light illegal fires, trash cities, roads, highways, steal, and practice no hygiene. Where is the hypocrisy? Also, the county needs to examine all bridges in the county because homeless are setting fires and drilling holes into bridges around the county. I have proof of one bridge with pictures to give. Alex Alaferis of Lodi, California. The next comment reads, as a certified member of a private golf and country club, I'm wondering how the board has the authority to not allow me to access my property and play golf. Before we were shut down, our club had at least 50 safety procedures in place, along with the recommendations of social distancing. Let's remember you are elected officials who work for the people. At least give us the respect we deserve with a vote on this issue. Thank you, Jennifer Mitchell. The next comment reads, I am writing this email because, to be honest, I am scared to keep returning to work. I am a NICU nurse. I've been a NICU nurse for almost 8 years at San Joaquin General Hospital. Yesterday, I was assigned to float to be a spotter in our designated COVID-19 ICU. As I walked into the ICU wearing a proper duckbill N95 mask that was my own personal belonging, I was told to remove it and swap it with a standard yellow mask. The reason being, quote, there is just not enough and only people who absolutely need them can wear them, end quote. If not, it looks bad because nurses are having to wear the same N95 mask all day long, even for multiple patients. Looking back, I wish I would have kept my mask on and allowed them to fire me on the spot if it really was that big of an issue to protect myself. When I applied to be in the NICU, I never signed up to be floated to ICU. I have put myself and my family at risk and am concerned moving forward, especially now that I have to go back to my dedicated population of sick babies. And the person who wrote this comment also included a letter, which exceeds the 250 words, so it'll be included with her comments for the record.
Was there a name for that last one?
The name on the email is Sabrina Medina. And the next comment is from Melanie Jacks, and she writes, will employees working remotely from home receive the 5% pay increase? The next comment asked to be anonymous and states, will there be any safety measures to be put in place for HSA? The board continues to make changes, but none of them are for the protection of the employees or their families. The board offered 4 days a week, working 10 hours a day. Now there are more people in the office. When will the board make changes that help to improve the situation? Will Governor Newsom be made aware that there is currently nothing in place to help employees not potentially infect other employees? Currently, there are no safety measures in place to protect employees from other employees. It would be great if the employees could work all 5 days from home, if they choose. There will be plenty of people in office to cover any clients who come in. Several employees are high risk or have high risk individuals in their household. Nothing is being done to protect employees from other employees. And the next comment reads, Sweden's strategy. It is possible that the fastest and safest way to flatten the curve is to allow young people to mix normally while requiring only the frail and sick to remain isolated. And this comment includes a link to a news article, and she goes on to say, we now have several remedies for COVID-19. We have learned that Advil and ibuprofen make it much worse. Now that we know more about the virus, we have some remedies. Let's get back to our normal lives. Our normal lives in the past have subjected us to whatever flu is around. We should take precautions, especially if our health is compromised. Sweden isolates the vulnerable, not everyone. Signed, Nancy Cochran of Stockton, California. The next comment reads, Dear board members, Have any of the supervisors used their personal contacts with businesses or manufacturers to help Public Health Service and the county administrator acquire more PPE for frontline responders in the community? Who is reaching out to the private sector to help acquire equipment to protect essential workers who work for the county, for area hospitals, first responders, and grocery, food, farm workers? What is the plan for PPE increases for the response for these categories of essential employees? Thank you. Signed, Barbara Berringen Perea. The next comment may be in regards to clinics. That is the subject. However, the comment reads, way to embarrass the county more. Golf courses, question mark, so tone deaf. The next comment reads, the COVID-19 outbreak has had a significant impact on all Californians, with the long-term effects on the economy having yet to be estimated or realized. Construction is one of the most vital components of continuing to move the state forward. In order to do so, I assure you that the Builders Exchange of Stockton is committed to keeping our members informed of the importance of the health, safety, and welfare of our workforce and the public. I would like to take a moment and commend Director Balaji and his staff for working so hard to keep contractors in San Joaquin County operational by putting projects out to bid. These projects are essential in the recovery of our economy. Thank you, Renee Pugh-Hink, Executive Director of the Builders Exchange of Stockton. The next comment does exceed the 250 words. However, I'll read the first half of it, and then she asks several questions. And the comment reads, Board of Supervisors, I want to address the lack of transparency, effective communication, and leadership from BHS by informing BOS of the following issue. On 4/2, BHS management informed staff that there would be a loss of hours and that the agency was unsure if they would receive paid leave for time lost. They told us that if we didn't receive pay, our option was to utilize our accruals, and they expressed not knowing if they could qualify for HR 6021. Our meeting provided no reassurance or answers at the time. Then after a couple of hours, received an email stating that we heard wrong and there would be no loss in wages, hours, or benefits. However, none of those statements seemed to be true because BHS employees received an email on Friday, 4/3 at 3 p.m. stating that our hours were being cut and there was no plan for payment at this time. Their order went into effect as of 4/6/20 with the schedule for the week. The late notice did not allow for any trainings to occur for those who had to telework as of Monday. Many full-time BHS employees are now working under 30 hours with no additional information or resources. This lack of effective communication has been causing emotional and mental stress. We are unaware if we will be able to provide basic needs for ourselves or for our families by the end of the month. We are unsure if we will receive enough to cover rent, mortgage payments. Please answer these questions. Number 1, if our salaries are included in the yearly budget, why can't we receive payment like other departments are currently receiving? Number 2, if we are not paid, what is BHS utilizing that money for? Number 3, why are part-time workers not receiving additional hours if CAP was increased last week? Sent from a concerned BHS staff. And the next comment reads, Dear board members, my name is Matthew Schaefer, and I am the CNA representative for the nurses of San Joaquin County. On behalf of all nurses of San Joaquin County and California Nurses Association, I write today to inform the board that the information you have received during your COVID-19 briefings has been misleading. Nurses and CNA alike understand the dangers frontline staff face in this pandemic crisis. Nurses see every day the effects this virus has on their patients. Unfortunately, nurses and caregivers of San Joaquin County are not being given or allowed to use the maximum protective equipment they need to ensure they are safe, to ensure they do not transmit the virus to coworkers, other patients, the community, or their families. The county must do better. The county must procure, provide, and allow caregivers the proper and maximum personal protective equipment these people on the front lines needs to stay safe. If the county does not protect those fighting this fight on the front lines, they will end up with no caretakers to provide care to your community. Nurses, caretakers not protected can contract the virus and take it out into the community and home to their families. The county must protect its most vital resource in this fight, these employees caring for your community and constituents. From Matthew Schaefer, Labor Representative of the California Nurses Association. And the next comment reads, this is from Anonymous. I am currently employed by the county as a RN for BHS, and I'm writing this to ask for direction regarding my leave and EFMLEA, if applicable. I have written several emails and made several phone calls requesting answers and direction on how to keep my job secure while I am out of work. I have used all of my time as of 4/3/2020. I have 3 kids at home with their dad in the Air Force. My 9-year-old has chronic issues due to brain abnormalities, and my other kids are 3 and 6 years old. I am asking to be included in the benefits of HR 6201 based on my circumstances as a single mom. I have worked for the county for 10 months and have had very positive employment reviews. I don't want to have to pick between my children's safety and my job. I love my job, and especially my field in behavioral health. I will lose insurance, take a leave of absence, and get unemployment if that means keeping my job. I just need answers. I won't have a paycheck at this point and need to know what's available to me instead of just applying for unemployment without answers. Thanks for any information you have at this critical time. And the next comment reads, over half of the cases of COVID are falling within Stockton, and unlike worldwide numbers, 60% are women. Locally, this is because so many of our essential workers are women. All supervisors need to remember when voting on policies and advocating positions during the pandemic that their votes, efforts don't just impact their personal constituents, but in particular the most vulnerable people within the county and people serving on the front lines. As we know, nationally, communities of color are being hit harder by the virus. I wish this board displayed as much passion and concern for our marginalized population's wellness. Here we are, just 1 week after your tone-deaf response to golf courses. You have a chance to redeem yourselves. Think of what message you will be sending to our public. With all their raw fear and concern caused by COVID on full display, your job is not just to balance a budget, but also care for the well-being of our public, and not just those that look like you. What a great opportunity for you to make that point by keeping these clinics open. Defiantly submitted, Nicholas Haddon. The next comment reads, hello board. I am a public health nurse for San Joaquin County, and I am very concerned that our nurses at San Joaquin General Hospital are not getting enough personal protective equipment. These nurses are working at the core of the COVID-19 pandemic, and they need the proper protection. Without PPEs, they are being exposed to this deadly virus and putting themselves, their family, and the community at risk. If our nurses get sick, who will take care of our patients? These are the nurses that know our hospital and our community well. They cannot simply be replaced if they are sick. These nurses have dedicated themselves to our patients, and we need to protect them. Our nurses are reusing masks and other equipment that are meant for one-time use. They are forced to ration gloves because they do not have enough of it. While the community is able to social distance and stay at home to stop the spread of the virus, our nurses cannot. Our nurses are at the front line caring for our patients and comforting those who are dying without family by their side. Our nurses need support. Please provide them with proper PPEs to protect themselves and the community. And that is sent from Ursula Foying. The next comment reads, hello, Kimberly Wormsley, LCSW, here from BOS 1 in Stockton, California. So far, the death rate in San Joaquin County for COVID is higher than it is in the rest of the state, percentage-wise, and in the nation. This speaks to the history of poor environmental and health outcomes tied to redlining and lack of public investment. Will the board direct public health to release for review at the end of the pandemic an analysis of the infection rate and the death rate by zip code and census tract so it can be compared to Cal EnviroScreen analysis for public and environmental health for this region? In the wake of COVID-19 and the high needs for access to medical care and intervention, why on earth are we closing medical prevention and intervention clinics? As a public health champion, I find this to be disturbing and neglectful. Anything remotely close to a closure of a healthy facility would be callous and incompetent, to say the least. Thank you for your time. And the last comment that I have reads, I am writing this email to be honest. I am scared to keep returning to work. I am a NICU nurse. I have been a NICU nurse for almost 8 years at San Joaquin General Hospital. And I apologize, actually, this is a duplicate email sent from Sabrina, who previously wrote in before. And while a couple of those comments were dedicated to clinics, we do have additional comments regarding clinics that I would read during the public hearing portion, but that's all of the comments that we have now.
Thank you very much. Okay. Next up, we have some minutes to approve from the meeting of February 25th. So I am looking for a motion and a second, or if we need to make any changes.
I'll make a motion to approve the minutes.
Second.
Okay, we have a motion and a second. Please cast your votes. And the minutes are approved 5-0. There are no appointments for approval today, and so we will move on to the consent calendar. I am looking for a motion and a second to approve consent. We're not pulling items from consent.
We're not pulling items for the consent.
No, we've said without the public comment, we are not pulling items from consent, and all the supervisors have been asked to submit their questions in advance. And if it's an item that you wish to highlight something, then you'll be able to do that during your comments at the end.
In the past, Madam Chair, when we've pulled up items for consent, I don't remember there being a protocol where the public then has a counter or a question followed up by any question we have of the director.
Not necessarily just related to that, but the memo went out several times actually from the clerk of the board reminding all of our offices that if we have any questions to please submit them to staff, get your answers in advance, but that because we have such packed agendas that we're not going to be pulling items from consent during this time.
Very well.
Thank you. So I'm looking for a motion and a second to approve consent.
I'll make a motion to approve the consent calendar.
We have a second?
Second.
We have a motion and a second. Please cast your votes. And consent is approved 4-0. Okay, now we're going to move on to our public hearings for the morning. And the first up is a public hearing to consider closure of the San Joaquin County outpatient clinics on Hazelton Avenue and Spreckles Avenue in Manteca. And first I'm going to ask Mr. Culberson to provide a staff report.
Good morning, Madam Chair, members of the board. David Culberson, Chief Executive Officer, San Joaquin General Hospital, responsible also for San Joaquin County clinics. Here before you this morning to conduct a public hearing to consider the closure of the San Joaquin County outpatient clinics on Hazelton Avenue in Stockton and also Spreckles Avenue in Manteca. This has been considered for quite some time here, working with county administrator's office, as well as our external consultants and my finance and operational team, and we have some recommendations and some background here for you this morning. We wanted to first let you know that San Joaquin County Clinics operates 8 sites as FQHC. Those are federally qualified health center look-alike clinics, primary medicine, family medicine, Healthy Beginnings, that's our OBGYN in French Camp, also family practice, California, Children's Health Services, and Healthy Beginnings in Stockton, that's on California Street. Also then we have a site in Manteca in the Spreckles area that is primary medicine and also a small clinic in Hazleton in the public health site. The services provided at these clinics include adult primary care, pediatric, prenatal care, women's health, integrated behavioral health, where we're bringing behavioral health providers into those clinic settings, and also a strong emphasis on chronic disease management. For our San Joaquin County clinics, these are going to be the FQHC clinics in total, all 8. We had around 124,000 visits. Specifically then and we have approximately 33,000 members who are assigned to our clinics. Primarily, it's probably about 93 to 95% of those are going to be assigned through the health plan of San Joaquin. A smaller percentage would be through HealthNet, Centene. And then we also do see in Medi-Cal, straight Medi-Cal, those folks that have not yet been enrolled in managed Medi-Cal. The allocations for our Manteca site, 3,700, and Hazleton site, 2,500, are very, very small relative to the entire population of the assigned patients we serve. We've done a fairly extensive analysis over the really last year, working with Ms. Nino's staff and our external consultants, and have found that we continue to operate, to have substantial operating losses. For example, in Manteca and Hazleton, for example, for the first 6 months, Manteca site had about a $1.4 million loss. And then Hazleton site, which is quite a bit smaller, still continues to operate at around a $700,000 loss. Those trends are similar to what we've seen in prior years. Despite efforts really trying to increase volume, we've increased advertising. We've had push outreaches through cell phones and through our call center. We really have tried to ramp up the provider hours. We've extended to late evenings, and yet the utilization of these 2 sites continues to be disappointing. We expect that these losses will continue for the next several years. And one of the things about the FQHC funding, as these are initial starting centers, we won't get our final rate established for perhaps 3 to 4, maybe even 5 years from now. So we expect that the losses will continue and really no quick turnaround here. And once we get our rates established sometime, I think that's going to be not really going to help us anytime soon. We do want to share with you the current staffing centers at both sites. Again, the Hazleton site is really 1 to 1.5 providers, and the rest are going to be at Manteca. So we have 9 total physicians, family medicine, OB, and pediatrics. The addition of the OB and pediatrics, something that we've done to Manteca over the last 6 months to increase volume here. We really have pulled those providers from either the pediatricians or new providers, and one came out from California Street, and the obstetricians are coming from French Camp or from the California Street site. We do have 4 nurses that are performing triage and guidance leadership that are essential at the 2 staff, and then we have 22 other staffs, including outpatient clinic assistants, office worker, and senior office assistants. We do believe that some of the positions that were mentioned here can be reassigned to the remaining sites. However, some positions will be deleted. All non-physician deletions are part-time, except for one civil service position, which is currently vacant. As we've evolved this plan here, I've made sure that we've not replaced the part-time staff and the full-time staff as necessary in an effort to make sure that essentially through attrition, as much as possible, we would eliminate staff. So we're recommending here total deletions of 10 outpatient clinic assistants, 3 office workers, 1 senior office assistant, 1 RN, and 2 physicians. Again, just to give you an idea on our projected operating costs for these 2 sites, it's about $4.3 million. We expect to be able then to have substantial labor and non-labor savings as a result of these actions. We do have a long-term lease that continues on through 2027. There really is no way to get out of the lease. We are working with General Services and Council to explore sublease options. The site is very attractive. It's of all the sites we have, it really is the most spacious, plenty of parking, but it's just due to the competition and I think just our need to focus on other things. We're recommending that we do close that. Hopefully we'll have a sublease option here sometime, and if we do, we'll report back to your board on that development. The access for the 6,000 affected patients, we want to make sure that your board is aware of the plans here. Really, we think that we can absorb many of those patients at the remaining 6 San Joaquin County Clinic sites. As I mentioned earlier, many of these patients that migrated to Manteca and Hazleton received their care either in French Camp or on California Street before the sites were opened in 2017. We do have some administrative guidelines that we have to work with the Health Plan of San Joaquin and HealthNet to formally reassign them within their networks. That network would include us, as well as our other larger competitor but very successful federally qualified health centers, community medical centers, and Golden Valley Health Centers. I think it's important to note that about the same time that we initiated our Manteca clinic, actually initiated construction of it, Golden Valley and community medical centers increased their capacity by adding additional sites. And as we know, both and community medical centers continues to grow its sites throughout Stockton. So we believe there is adequate community clinic capacity to absorb either in our clinics or in community medical or Golden Valley Health Center systems. We did bring to your board an action on March 10th. That included further restructuring of the San Joaquin County clinics, total deletion of 59 positions equating to $5.84 million in savings. And then we recommend that you hold a Bielenson hearing today, California Health and Safety Code. Just to let you know here, I wanted to share with you some of the things that are going on with our clinic system since we've gone to the more restrictive shelter-in-place activities. Our FQ clinics, before we had our actions in early March, were seeing between 10 and 11,000 patients per month. During the month of March, we were able to only see 6,500 patients. And again, it's the overall action that we're recommending today, like what we recommended on March 10th, was to get our overall cost structure for the clinics and the hospital back in line with the current demand. So we do have a proposed action for you here today that we conduct the Bielenson hearing that would recommend authorization of closure of the clinics in Manteca and Hazleton, and authorize 17 staffing deletions as previously described. Upon your approval, the SJCC management, including myself, Dr. Fadu, and his team, will initiate the operational steps to close both sites effective May 29th, 2020. With that, I would ask if you have any questions, and then I would defer to your board for a recommendation that we open the Bielenson hearing to consider closure of the San Joaquin County outpatient clinics on Hazleton Avenue in Stockton and Spreckles Avenue in Manteca. Here to answer any questions you may have.
Thank you. We have some questions. Supervisor Elliott?
Thank you. First question is just kind of an obvious common sense one here during this COVID-19 pandemic. Will these closures have any adverse effect on our ability to provide appropriate care during this COVID pandemic?
Supervisor Elliott, through the chair, certainly the access that we're primarily providing is going to be at the hospital and the emergency department and in the inpatient side of things. So I don't believe this closure in effect would really affect the inpatient, the most acute needs. We will continue on through May 29th having access primarily through internet. We have an awful lot of FaceTime-like access that we have through our Cerner system and through some of the other things. So we'll continue to have access through for patients through these clinics through May 29th, as mentioned to you. I think we do have, quite honestly, with the economy going the way it's going, I would anticipate statewide we'll have, and probably nationwide, we'll have an increased demand for the Medicaid and Medi-Cal in our state population needing to see additional providers. We'll do the best that we can in French Camp and in California Street. Again, one of the things we are seeing is that the video access is actually helping to speed up the turnaround time on a lot of our routine visits. But and finally, one of the things we have done, we'll be starting tomorrow, opening up a much more expanded testing site in French Camp at our clinic system through a partnership we have with Verily. That's going to be the Google-based app and provider system. So I think we're offsetting some of the reduction in access, supervisor, with continued effort at growing the testing and making sure that we continue through May 29th on access to these clinics, and then continuing on with our other clinics in French Camp and California Street.
Okay, so it's your assessment that closing these at the end of May won't have any effect on our ability to provide appropriate care during this pandemic?
Supervisor, the loss of any providers are going to be a challenge during these times here. I'm not able to project that. We meet weekly with Dr. Park on when exactly the COVID-19 pandemic goes away. I think we'll be able to handle in our system access to the patients that are providing, again, roughly the 6,000 patients that we're providing access to, sir. I believe we'll have adequate capacity. Yes.
Okay, and then if there were a future pandemic, I mean, we're of course dealing in hypotheticals here, but do we think our ability to respond would be degraded?
I'm going to have to defer to Dr. Park about what the future may look like. I think she would say the future is uncertain. Supervisor, we're going to do our best to make sure we have adequate personnel both at the hospital and our clinics to meet the demand. I guess that's one thing that we do have. We're not abandoning either site, and if push came to shove, much like we've expanded our access to future ICU capacity, we could reconsider opening these clinics for the short run back up. Again, I would defer to really Ms. Nino and her team and then our ability to re-implement. But I think there's adequate outpatient capacity right now, sir.
Right. And would it make sense to delay the closure date on these until we're sure that this pandemic is on the decline?
I think in light of really some of the challenges that we're having at the hospital here, we really need to move forward with some of the right sizing of our operation. Again, mentioned to you that it's almost about a 50%. I didn't mention the inpatient or the specialty volume, but our specialty clinics are about half the volume that we used to see, and our primary care clinics look like they're about off by about a third to 40%. So I think we have to be prudent today and change our operations so that we make it in the long run, sir. If indeed there is a second wave coming, we'll be able to revisit that with public health, with the other community providers. And again, with the change in the Medi-Cal enrollment here, I think that's going to be a dramatic position that we have not seen since the Affordable Care Act expanded several years ago.
Okay, and this expansion in the Medi-Cal population, then you think that will be handled by other health services?
Yes, sir. Yes, we have indeed, through the chair, we have indeed seen some of the FQHCs actually growing over the last several weeks in their volume. And predominantly, they've been using the video access, and we've copied a lot of their model.
Okay. Now, on these 17 positions that are being deleted, I understand at least some of them are vacant. Are most of them vacant positions now that just won't be filled, or are we actually letting some go?
Yes, we'll be letting some go here. The physicians I was reviewing yesterday evening, some have been, we've had cut, I think, 2, and we'll have an additional throughout I was looking at the overall outpatient side of things. So we have had 2 deletions that will be planned, but we've also had, as part of your order back in March, we've actually had some other deletions. As we mentioned to you here, the one, there is going to be one full-time outpatient clinic assistant. I think one of the things that is may occur here in light of the need that we'll have for inpatient nurses is reconsideration of this one nurse. But I don't know her skill set, if she'd be able to work inside the hospital. But that's something we're going to keep our eyes on as well.
Right. I think if we proceed according to the schedule here, I think we should certainly look at maximizing the ability to use these people that are currently working at these clinics, so that we have the maximum number of qualified people on the job that we possibly can here.
Yes.
All right, thank you. That's it for now.
Supervisor Wynn?
Thank you, Madam Chair. Supervisor, I'd like to answer one of the questions in regards to transition of the current employees to other positions, et cetera, so I think that's taken care of. In regards to this closing, one of the things I think was expressed in one of the comments from the public is the care for the certain segment of our population. I guess one of the things that we've seen in other areas in regards to changes, are we providing the patients that are being seen at these 2 particular facilities with the information as to where they can go? And I assume some of them have been to the French camp or other locations previously before these 2 facilities open. But to make sure that they understand that they're not losing care, they just have to go to a different location.
Supervisor Wynn, through the chair. Yes, that's correct. That's something that, again, physicians have done for many, many years. Whether they retire, move out of the area, they provide continuity, and we're doing the same thing. Now that we are working with, as mentioned, Golden Valley and community medical centers, it's also something that is required, and we work closely with the enrollment team, the network team at both Health Plan of San Joaquin and HealthNet.
The second part is are they being provided with awareness of their transportation options to go to some of these other locations for treatment?
Supervisor Wynn, I'm not certain that that information's been specifically provided to them. We do know that transportation is a required benefit for the Medi-Cal managed care that all health plans, Health Plan of San Joaquin and HealthNet would have to provide. I'll make sure that we provide outreach in our communication to them that is available.
And the last question is through this pandemic, I think we've seen some creativity, so to speak, and I know it's been in the forefront for several years, telemedicine. In other words, as opposed to having to physically visit a clinic or a hospital or emergency room or whatever, that individuals can call in and talk to a nurse, a doctor, whatever, and be pre-screened in regards to what they actually need as opposed to overloading our current facilities. Do you see that as an improvement or an option for the care of these individuals who will no longer be able to facilities otherwise have to physically travel to other locations.
Supervisor Wynn, that's been precisely where we've been working over the last 2 to 3 weeks here, standing up a video platform that works with yourself, with your smartphones or with your home computer. The state and Medicare, so both Medi-Cal and Medicare, have provided guidance on how to complete those exams from a video perspective, as well as they have now billing rules and are providing reimbursement for such visits, particularly in light of this public health emergency.
Well, thank you. Appreciate it.
Supervisor Patty?
Thank you, Madam Chair. Mr. Culberson, question for, would you think that the problems at those clinics are primarily related to volume, or would it also be related to our billing process?
Supervisor Patty, I think there's really a volume as it relates to, clearly as it relates to the number of patients we're seeing, and as such, the unit cost is higher than it could be, it should be, it would be really reasonably reimbursed. And yes, sir, we have indeed had some billing issues at both sites here for really since they started here. We've really seen some good things as we've changed over. Your board approved effective January 1st, outsourcing of the billing for the clinics to EMMI, the local billing company here, and I think we're seeing better completed, more timely activities. But yes, indeed, some of the billing processes, including timely billing, which results in, if it's not billed in a timely manner, there's a series of reductions in reimbursement that we would experience from both Medi-Cal and, so fee-for-service Medi-Cal and for Medicaid, Medi-Cal managed care.
Thank you for the answer. Would you say, just for clarity, was EMMI handling billing at those 2 locations that we are targeting?
They have not until January 1st, but they have after January 1st of this year, yes.
Was there any turnaround or anything notable that would make any difference prior?
I think the scope of the staff, the volume of activity, the turnover of staff were very, very instrumental in making get to where we were. We were not able to collect all of our money in a timely manner. So yes, we staffed up, we lost staff, and then the volume just continues on. And of course, we continue to have some operational pieces with our Cerner billing system. It's getting better, but this was about 500 claims a day that we would send out. Really took an army that we just weren't able to get in place in a timely manner. So EMMI has been able to do that for us.
Understood. In comparison to, we have other clinics, and we're targeting 2 that are losing money and aren't feasible to maintain due to competition and lack of volume, as you're noting. What would be a comparison of some of the clinics that are performing well? What would be the comparisons in how many people they're seeing per day versus what these clinics were seeing, due to the fact that there were 2 other neighborhood clinics?
Supervisor, through the chair, the one clinic that stands out very, very well for us is our pediatric clinic on California Street. High volume, quick turnaround. It is a lot of child care and immunizations, and so that enables us to turn the patients around in a very quick manner. I don't know the numbers. I pulled them up this morning, but I apologize. I was concentrating on the total volume of clinics. But clearly, pediatrics on California Street is a high-performing clinic. Some of our other ones are primary medicine because of the complexity of the patients we're seeing, and just the logistics. Sometimes those become ones that we're going to have to concentrate on to have quicker throughput. But it is a challenge for so many of the folks that we're taking care of with their multiple comorbid, sometimes communication issues. But what I'm hoping is that by redirecting some of these patients of the 6,000 back to French Camp, where we have primary medicine, family medicine, and then back to California Street, where we have adult medicine, that will be able to increase those volumes and get closer to a break even on those clinics.
What's the additional distance between the French Camp and the 2 clinics, if you were to travel to the French Camp from either of these clinics? Do you ballpark idea?
Supervisor, I think the Manteca is around somewhere between 7 and 9 miles, and Hazelton must be about 5 miles, I would think.
So it's striking distance, and they could get continued service there.
Yes.
And all the locations, I imagine, with the stay-at-home policy, all the locations are seeing a lower volume of people coming in the door. So if somebody does need that type of service and does need to go to the clinic, they should be able to get services at those locations.
Yes, Supervisor, yes. And again, we're really stressing the FaceTime approach, and because it is the model we use is secure, so it meets HIPAA requirement. It is across all platforms, smartphones and laptops and desktops.
This obviously is a very difficult decision. You've looked at it from different angles. I know working with our CAO, this is a final conclusion that is best in practice of how we are serving San Joaquin County effectively and efficiently.
Yes, sir. In light of the operational needs of that we have at the hospital to right-size the entire operation, make sure that we get back on solid footing, it's a difficult but necessary step, sir. Yes.
So, and lastly, would there be any identified shift in services we provide at either of these locations that would make them viable?
Supervisor Patty, I think in the short run, it would be very, very difficult for us. Quite honestly, I don't see anything, sir. We've really analyzed this over the last year, and I don't see anything quickly.
Okay, thank you.
Thank you. I have a couple of questions for you, Mr. Culberson. We talked a little bit here about that one of our primary concerns is making sure that the folks that are utilizing these clinics continue to have access to the medical care that they need. And I know that providing transportation is one of the things that is required. My concern is during this time is that most of the public transportation hours and services have been drastically reduced. And so I think it's important that we don't just let patients know, oh, you have access to public transit and it will be paid for. I think we need to work with folks to make sure that there are transit routes available to these people, because many of them are dependent on public transit. And I know RTD had gone to us at one point a Sunday only routes. These are longer distances for public transit, and that's going to have an impact on the folks who have shifted. And so from my standpoint, while I understand it might be good for the other clinics to drive some of this business back there, especially during these difficult times until public transit is fully restored, I think we may need to work more closely with community medical centers and Golden Valley, who are closer perhaps to our sites, to make sure that people have access and they are connected quickly. So I know we're not closing until the end of May, so that buys us all some time to help everybody make the transition. So I would just really like to stress, let's not waste this time, and let's make sure that the highest priority during this time is to make sure that all of these patients make the transition that they and their families need.
Chair Miller, yes, we will do that. We have every reason to make sure that we maintain the hospital relationship with these patients, regardless of where their primary care clinic is, and that's about most important to us. I did want to anecdotally comment, not on public transportation, but on our use of some of the private transportation companies, whether they are for our dialysis patients or they're for some of our discharge patients. We have seen quite a reduction in the willingness of private sector to actually transport our patients, whether they, and most of whom have not been identified at COVID-19 positive. Just overall concern that we don't want to be anywhere close to transporting or being in touch with someone that might remotely be ill, and that's something that we've had to work with. We do have a limited number of transport providers now, quite a bit smaller than it was a month ago. But we certainly will do our best, and as you mentioned, don't waste the time between now and May to make sure that transition continues to be maintained.
Thank you. And my last question, you've alluded to this, but I want to make sure that it's really clear. The current losses on the clinics, how are those covered? Where does that money come from? How is that absorbed?
Chair Miller, the losses that the hospital experience are covered by the other
Clinics experience.
I'm sorry, the clinical experiences are covered by the other operations of the hospital enterprise fund. Predominantly, that it's fading out, Prime, Public Hospital Redesign Incentive in Medi-Cal. There is talk of 2 waivers that have been submitted and are being worked on by our Public Hospital Association, California Hospital Association, CMS, to continue on those waivers. But certainly the substantial funding that we use for Prime has a sunset date actually of this July. So yes, that is of concern, and where that answers, I think, one of the other supervisors' question is now at the time, and I believe it is, yes.
So I just want to make sure that it's clear to the public listening and also to all of us that a part of this decision has been to make sure that we have the resources that we need to keep our hospital operation running, not just these clinics.
Chair Miller, that's correct. We really are concentrating on the things that we do best here. I think we gave a valiant effort to operate these 2 clinics. The competition stepped in here, and we're going to do all we can to make sure the inpatient, the emergency department, and the remaining clinic sites remain viable for the community, yes.
Great, thank you. I know these are very difficult decisions, but unfortunately, prioritizations do have to be made. And right now, acute care hospitals and the services that support them are being identified as the primary resources that are desperately needed by all of our communities. So I appreciate how difficult the decisions are that have to be made. And I also appreciate you making sure that we're able to continue delivering those highest priority services. Supervisor Patty, you have some more questions?
Thank you, Madam Chair. Quick follow-up. I think in your presentation you had mentioned that patients at the county clinic would be able to transfer to one of the Golden Valley or doctors in Manteca, correct?
Supervisor Patty, through the chair, the Medi-Cal guidelines managed care guidelines allow members to change providers every month. And so if they stay with us, they'll have a choice, and they can continue on at a different location. If one of their providers is no longer with us, they could choose one of ours, or they could choose any other provider in the community, whether it's community medical centers or Golden Valley, or a private office.
Understood. Thank you. And lastly, I would just maybe suggest that the county consider and maybe look at this and bring it to the board, maybe repurposing, if you have a couple of doctors, I understand, that are going to be laid off, but perhaps we repurpose them. And one of the main primary concerns and issues that need to be addressed is our homeless shelters. We don't have medical staff available to screen several hundred people that are coming and going from the shelters in the afternoons on a daily basis. So in order to keep this virus from spreading, and this is an environment and a situation where it's very close proximities, so we might want to utilize, I think the county would be very well served if we utilize some medical and some staff that, instead of laying them off, maybe we utilize them for the next couple of months, however long needed, and repurpose them at we've got Gospel Rescue Center, we have Stockton Homeless Shelter in particular, where there's large volume of people coming in daily.
Supervisor Patty, we do have the service of some of the remaining physicians through June 10th, and I'll make sure that we put them to proper use. We've had a lot of volunteering, the folks that have reflected back on their residencies and their medical school, and they're able to say that we'll do whatever we can to help out. So I'll make sure we continue with that. The actual efforts, I know the whole person care program and some of the homeless program that Greg Niederich and his team are working on with the county and city leaders, or something there, and we'll work with Dr. Park to see what we can do on that effort.
Would you complete that and come back with me once you review and let me know, and I'm sure the other supervisors would equally be interested to see what we actually could dedicate on a regular basis to this effort?
Sure, I'd be happy to, Chair Patty, or Supervisor Patty. I think one of the things that's going on is we can be part of Adam Cheshire's report. I think he'll have regular reports over the next several months on how the homeless activities, not just in finding a place of residence, but also healthcare, access to other activities. So I'll make sure we circle in with Adam's report. That's okay, Ms. Nino?
Yeah, and this just for awareness, again, Supervisor Villapudua and I both participate, his office and mine, with phone calls in United Way and speaking with Jolene over at the Stockton Homeless Shelter. Mm-hmm. There's a definitive need. You know, their staff isn't qualified, and they've got a big concern because these are oftentimes people that are not able to self-shelter and stay away, so they are out in the public and they have a high risk of exposure, and then they're coming into a close, tight proximity of several hundred people. And so we could see our numbers climb exponentially just in that population alone, which would be quite problematic. So if we can maybe expedite this and see what we can do to utilize. This is a ongoing concern on a daily basis, and they feel it's critical and needs urgent attention.
Okay.
Thank you.
I'd also like to piggyback. I know we're trying to and will be standing up this expanded testing with Verily tomorrow. Mm-hmm. If any of these staff people can be utilized there, that's another really good place to slide them over, because I know we were looking at how best to staff that. So I think you and I know you're already participating with Mr. Birch and also Mr. Diedrich on that testing site. So great. Supervisor Elliott?
Thank you. Yes, just one follow-up question here. You mentioned the private transporters had become fewer in number. Were you talking about just transporting from the hospital to other hospitals, or what were you?
Supervisor Elliott, through the chair. Basically, these are going to be where we've seen the effort has been on the service to the outpatient dialysis center, as well as discharge from the hospital and the emergency department. So I'm an inpatient, I'm cleared of my medical condition, and I'm able to go home, and I don't have a ride. And some of the transporters that would have done this in the past are saying, sorry, we're not picking up right now. We did find a group, I think last week, that we said, how about if we supply the sandy wipes and gloves and other PPE, a limited amount, saving those for our nursing staff. As you heard this morning, that's really a concern of mine. The nurses get the first dibs on our PPE, but a limited number of PPE has been provided to the remaining groups that are able to service us, Supervisor Elliott.
All right, but that sounds like a separate issue from this, the closure issue on these two clinics.
That's correct. Yes, it is.
Thank you.
Thank you. Okay, if there are no other questions, I'm going to open the public hearing. And I'm going to ask the clerk of the board to read any public comments we've received.
Okay, our first comment is from Mitchell Marubayashi, family medicine physician with San Joaquin General Hospital. And the comment reads, regarding the possible closures of Hazelton and Manteca clinics, these clinics fulfill a vital role in the community of increasing access to healthcare services to the most valuable populations with the least resources. Closing these clinics will create more barriers to care for an already at-risk population facing overwhelming barriers to care. Decreasing access to care increases disease and suffering and increases costs associated with untreated medical problems. Our local government needs to prioritize keeping these clinics open for the health and well-being of our community. And the next comment is from Megan Escudero, a concerned citizen, who writes, in light of COVID-19, I hope that the board decides not to carry through with the closure of the 2 public health clinics at this time. However, the reason for these clinics is to help those without the means to get to San Joaquin General Hospital to be able to be seen where they live. They are important to the health and well-being of our community, and their closure would be very detrimental to those communities. Quote, greatness grows here, end quote, could not happen in these communities if there were no public health clinics to help those living in poverty to grow. I desperately urge all of you to reconsider the closure and keep the clinics open for good. The next comment is from William R. Patron, Regional Director, SEIU Local 1021. And his comment reads, "It is a travesty that San Joaquin County, during the height of a pandemic, would take steps to close to critically needed medical clinics, denying access to over 5,000 patients in San Joaquin County. While this does not reach the level of keeping open golf courses, medical clinics and the access provided should be maintained, despite the cost, for the betterment of the communities in which they serve. San Joaquin County, under the leadership of their current CAO, runs the safety net programs as if they are part of a Fortune 500 company, putting profits and costs above community health and safety. Please postpone this closure of these clinics and reconsider after the pandemic passes." Desiree Nice writes, "Leave the clinics open. The people of San Joaquin need them, especially now. In this crisis, we need to band together and not close." The next comment is from Brandon, and he writes, "With this epidemic in full swing, it is not only foolhardy, but unjust to not only the people, but the workers in San Joaquin County to shut down public clinics. This is outrageous. If Monica Nino can give herself repeated bonuses that total over $30K every quarter and makes over $250K a year, we can keep these clinics open. They are a front line in our prevention, treatment, and safety for many, many people. The corruption must stop, starting with Monica Nino and continuing through the rest of the board." The next comment is from Christopher Bush, and it reads, "The patients need this service. If not, all of those patients will go to the ER, and that is worse. Thanks." Kathy McCooley writes, "When the public is afraid of what they are supposed to do when they are ill, is not a good time to close clinics. We do not want the clinics to be crowded, and our population deserves to feel assured that they will be cared for as close to their homes as possible. By having smaller, less crowded clinics, we can reassure them that they will be taken care of with the lowest risks of contamination as possible. We need to offer more services, not less." Virginia King writes, "More than ever, we need the healthcare facilities to remain open. The coronavirus is on a rampant move. We need them. Are you trying to assist the virus? We need you. We appreciate you. Please remain open. God bless you." R.M. writes, "I am trying to comprehend and understand where your heads are in wanting to close these 2 health clinics. I do not understand why you are thinking in such a manner. This is not rocket science. This is common sense stuff. These sick people need medical help and to get off the streets. Why do you insist on doing Stockton so bad for you? You need to let go of your greed and get some peace in your soul. Please just do what is right. You will be happier and healthier too. Thank you." Benny Magdale writes, "Board of Supervisors, closing the 2 health clinics wouldn't be beneficial to your constituents nor the already overburdened staff at the county hospital. Please vote humanely and wisely." Aquante Minor writes, "We need our clinics to remain open." Jay Iala writes, "Why would the BOS even think of closing medical clinics during this pandemic? Actually following through with this will tell the residents of San Joaquin County that their health and safety isn't important. You have already shown that your essential employees' health and safety isn't important. Do you really want to add San Joaquin County residents? Stop thinking about your own political agenda and do what you were elected to do, represent your constituents." Franciella Barajas writes, "Attention Board of Supervisors. I just wanted to let you know that I oppose the clinics closing. We are in need of these clinics right now. Please keep them open." Naomi Van Stein writes, "Please don't close clinics." Victoria Lopez writes, "Of all times to consider closing clinics during the COVID-19 pandemic, this is utterly preposterous. What idiots would even contemplate such a drastic, irresponsible move?" Kathleen Brewer writes, I know that I speak for many when I say that closing the clinic in Manteca and the Hazelton Clinic would be a huge mistake. The County Hospital Family Clinic is overburdened already with huge waits for appointments. Finding a primary care physician that is accepting new patients is very difficult, and these closures mean that many will not be able to get the care they really need. In addition, now is not the time to be taking work from the people working at the clinics. There is no good that could come from these closures. Please reconsider. Tasha Robinson writes, why would the board close vital clinics in disenfranchised areas during a pandemic? Last week, a couple members of your board were upset about golf courses being closed. I hope they will be just as outraged about clinics closing in communities that need them during this critical time in our country as they are about whether they can go and play a round of golf. Annie Rose writes, all medical clinics should stay open as long as they can do telemedicine. The healthier our population is, the less severe the COVID-19 disease will be. Matthew Schaefer writes, Dear board members, my name is Matthew Schaefer and I am the CNA representative for all nurses of San Joaquin County. On behalf of all nurses of San Joaquin County and California Nurses Association, I write to you to inform the board that we are adamantly opposed to the proposed closure of the public health clinics in Manteca and Hazelton Avenue in Stockton. The United States is currently facing the most severe public health crisis of our lifetime. As you are well aware, San Joaquin County is not immune to this crisis, and closing these clinics would be irresponsible, dangerous, and have far-reaching community impacts. The closure of these clinics would inevitably create more pressure on the inpatient hospitals in the area and the other San Joaquin County clinics. Even without facing this crisis, the county patient population is the most vulnerable of the community. Oftentimes, these patients already face barriers to care due to availability and access to clinic sites. Closing these clinics would only create further access restrictions for this vulnerable population. Combined, these two clinics serve on around 5,000 patients per year. The county's plan to have these patients transferred to the other clinics will only cause further delays and barriers to care for all county clinic patients. The health of your community and constituents is literally in your hands. DM writes, What are you doing to take care of your constituents in your area? You can spend valuable time arguing to reopen golf courses, but have no compassion to keep clinics open during this pandemic. Our homeless population are still walking around with no place to shelter or practice social distancing, so when they do get sick, there are less places to help them. Your priority should be our county and not the bottom line. Close them after the state is on the other side of the pandemic. Sam Allen writes, The health and safety of San Joaquin residents are the utmost important in this surging pandemic. Need we, the citizens, remind you of this? Keep all clinics open and triage those who need the most care. Let residents go to clinics instead of needlessly filling our hospitals. It just makes sense. Lives are at stake. Katia Evanho writes, Dear San Joaquin County Board of Supervisors, I am writing to protest your plan to close health clinics in San Joaquin County. Please explain why we would block over 5,000 people access to needed health care clinics. In the same vein, one of your members is justifying keeping county golf courses open. What gives? Money, of course, comes to mind immediately. Get your priorities straight and consider the impact such closures could have on so many vulnerable people, particularly in this time of COVID-19. Especially consider where you might be if you did not have your family doctor. Not everyone has fancy health insurance. Think outside the box here. Think with your intellect and your heart. Sincerely, Katya Evanho, Stockton resident. Amanda Greenmeyer writes, To whom it may concern, I am writing this to inform you the great disservice to the community that will be done by closing the Manteca Clinic. Not only are the providers at the Manteca Clinic thorough and in-depth, but they are also amazing, kind, compassionate, and above all else, they sincerely care for their patients. I personally have followed from French Camp to Manteca to ensure I stay with the same primary care physician. I am an immune-compromised patient, and maintaining consistent care with the provider that knows me as a person, along with my file, is extremely important in daily treatment. In order to maintain excellent care and success in my health and the communities, I plead with you to please keep our trusted Manteca clinic up and running. Thank you. Barbara Berrigan Perea writes, Dear Supervisors, even if the health clinics you are considering for closure are money losers, they need to stay open presently. Closing clinics during a pandemic is bad governance, bad medicine, and bad care for all residents. Instead, the board could temporarily transform them into testing sites or keep one COVID-free to deal with other health needs for patients. Please postpone this decision until the pandemic is resolved. Jeremy Terhune writes, I am submitting this email and CCing the Puentes Board to share my utter dismay that the San Joaquin County Board of Supervisors is even considering closing county clinics in the midst of the COVID-19 pandemic. At the very least, such decision should be postponed until this crisis has subsided. David Cotarta writes, during this pandemic, we the citizens of San Joaquin County deserve all available medical resources to be on the ready to handle the expected rise in demand for facilities that can handle the various needs of the increasing COVID-19 cases, as well as facilities that can help the many needs that the citizens depend on every day without the fear of being unwittingly infected with the COVID virus. Please keep these clinics open. Thank you. Mandana Matamina writes, Dear Sir, Ma'am, recently Manteca Clinic got rid of OBGYN staff, including midwives, and left family medicine providers there. I would like to emphasize that our patients love to see midwives for their care, since midwives are female and can offer many OBGYN services, including but not limited to annual birth control and managing the laboring patients. Closing Manteca Clinic and not allowing midwives there is a negative message to our community. Midwives' salary is almost 1/3 of the family medicine doctors, and they bring in the same revenue. Family medicine doctors are not specialized and can never fully satisfy the patient's needs. Midwives need to stay at all clinics related to San Joaquin General Hospital, including Manteca Clinic, to make sure our OBGYN patients will continue coming to San Joaquin General Hospital and use our services. Midwife services is very essential part of other organizations like Kaiser Permanente, which is a true testimony of our value in the system. Please support your midwives. Karen Rhodes writes, I write today to demand the Board of Supervisors stop their consideration of or processing in the closing of 2 of the county health clinics in the midst of the coronavirus health crisis. This board is powered with making decisions affecting the well-being of its residents, all districts, yet you can boldly consider closing health-related assistance to the community. Whom do you serve by closing them? What is there to be gained? Sit up straight and pay attention, BOS. Your citizens are dying. This is a time to be proactive, not stupid. Make decisions that will benefit the community, not damn them. Put your energy in the right topics such as health and well-being, not the golf courses. Mariana writes, hello. With the surge of coronavirus incidents all over the county, all over the country, we need to make sure that all medical locations are open to provide support during these uncertain and scary times. Closing clinics would be detrimental to the health of members in our community. Do the right thing. Marian Wheats writes, why would we close health clinics in the midst of a public health crisis? The optics are definitely bad, as both seem to be in low-income neighborhoods. While a lot of board meeting time has been dedicated to keeping golf courses open, on the surface, it appears the recreation of the wealthy is a priority over the health and safety of the poor. Please explain your reasoning on this to the public. And this is written by an individual that cares for her family and community. And she writes, Dear Board of Supervisors, I understand that some things during this COVID-19 are out of your control. However, this is not one of them. As our COVID-19 numbers in San Joaquin County rise, do you really deem it necessary and responsible to close 2 public health clinics, one of which our Director of Public Health works out of? Do the constituents of San Joaquin County matter to you? Or are you only worried about the ones complaining about golf course closures? Andrea Colavita Pinkham from SEIU 1021 writes, My name is Andrea Colavita Pinkham. I'm a field representative for SEIU 1021 and a voter in District 3. I am urging you to postpone your vote to close the Manteca and public health clinics and lay off healthcare workers. What may have seemed like a good idea and sound fiscal decision a month ago is no longer the case. As we all know, the world has changed. These communities need these resources to keep them healthy. Please have the courage to make the decision to postpone the closure. Right now, healthcare workers and health clinics are what we need. Anisha Thomas RN writes, It is really sad to see the decision of considering the clinic closure in Manteca. I have been working since the start, and as a nurse, it hurts to see it affects more than 3,700 patients that the clinic serves. Most of those patients does not want to go to French Camp or Stockton as they are Manteca residents, and those clinics are already so crowded and can't accommodate many patients. Especially during this period of pandemic, please reconsider to at least have the clinics open for the next year. It also affects the job and lives of so many medical assistants who work so hard to take care of the patients. Manteca is growing really fast, with the Wolf Lodge coming and many more new businesses, and really started seeing a lot of patients since last year. It will be really bad for the county to lose this patients to other facilities like Kaiser and CMC. Most of the patients are so hurt to hear this news, and they all wanted to support, but not able to come today to the board meeting due to the COVID-19 really affected. Please support Manteca Clinic to remain open to serve these patients who are really underprivileged with no insurance, VFC vaccines to kids who deserve that. Thanks. And Cassandra Burdick writes, It makes no sense why you would elect to close clinics that are located in underserved areas in the middle of a health crisis. I do understand that the clinics may be costing the county money, but I disagree that it would be the best interest of the county to shut doors while hundreds of people are getting sick. This closure would cost people jobs at a time when unemployment is at the highest rate since the Great Depression. This item would be better tabled at a time when the county's population isn't impacted by the national disaster. And next I have a letter from Congressman Jerry McNerney, who writes, I am writing regarding the public hearing to consider closure of San Joaquin County outpatient clinics on Hazelton Avenue in Stockton and Spreckles Avenue in Manteca. The Hazelton Avenue Clinic, which is in my congressional district, provides comprehensive and affordable primary medical, pediatrics, maternity, and women's health services that are critical to thousands of patients in our community. These services are even more important now as the battle against the global COVID-19 pandemic ramps up in San Joaquin County. I urge the San Joaquin County Board of Supervisors to delay its final decision on this matter. And Madam Chair, that concludes the comments that we've received.
Thank you. I am now close the public hearing, and then I'm going to bring it back to the board to ask if you have any additional questions or final comments. Supervisor Wynn?
Just a quick question for Mr. Culberson. I think obviously that the clinics need to be closed, obviously because of the lack of or substandard performance that was expected in the beginning. However, on the other side of it, and I understand that the concern in regards to the crisis that we're undergoing with the pandemic, would there be a problem if we extended the closure by a month or two to make sure that those who are seeking medical evaluation had that opportunity. I understand that there's other options available. We talked about Golden Valley and community medical centers, but we are in a unique period, so that's just a question for your response.
Supervisor Wynn, through the chair. I'm not able to project really the demand for primary medicine, over the next 3 months here. I think that's something that I don't even know if Dr. Park could. The demand that we're seeing, quite honestly, at the hospital has been tremendous for testing, and we're expanding for that, and then for very acute care services, whether it's emergency department or whether it's inpatient and ICU care. These two clinics are losing about $500,000 a month, I believe, is the number combined. I think we can do a good job transitioning so that care will continue on. Again, I know Dr. Fadu has talked extensively with Dr. Morrison of Community Medical Centers, as well as the CEO at Golden Valley. They're prepared to take these patients and are ready to. And I think Dr. Fadu has even mentioned that maybe some of the physicians that would be affected would be interested in coming on board with either CMC or Golden Valley. So outside of the financial loss, we continue to operate here, but I think it's just inevitable here that this type of losses are going to continue on, sir.
Okay. Thank you. That answers my question.
Supervisor Elliott.
Thank you. Supervisor Wynn just asked one of the primary questions that I wanted to ask as well. But have you had any, have the comments that we heard from the public here changed your recommendation in any way?
Supervisor Elliott, no, they have not. I understand the public health nature I understand the concern about the public health crisis we're having right now. We're going to do our best to concentrate. We're putting tremendous resources into the hospital right now that I think absent some type of change in the clinic system, we will not be able to afford here. Some patients are requiring 1-to-1 care. We've heard this morning from some concerned nurses that they are having to. What a spotter is a nurse who is watching another nurse put on and take off the appropriate PPE. And so the costs that we're experiencing, let alone just of the labor, and our volumes are down. We've cut back our elective surgeries almost 3 weeks ago. So some of the revenue that we've been seeing are down. And then the cost of it, whether it's just the PPE, whether the N95 masks, the gloves, shoe covers here, much more expensive operations on the hospital side just over the last 3 weeks. And so I think this is painful, yes. Is it limiting us? To some extent, we're going to make sure we continue on with telemedicine, but in light of the other expenses we're experiencing, I think it's something we're going to have to do, sir.
Well, I agree that that just looking at the long-term viability and survivability of the county hospital, and I think it is appropriate that we look at ways to keep the hospital running in the black and keep that afloat, because that is a much larger issue for the community than just the clinics themselves. I mean, we need to keep the county hospital operating to serve for the public health of the entire community and the region. So what we're looking at here really today is a matter of providing for that long-term survivability of the hospital, I think. So I do support the plan to close down these 2 clinics. However, I do think that in this particular time where we've got this coronavirus pandemic ongoing, and at our last meeting, I believe Dr. Park was telling us that she expected the real peak of the crisis in terms of hospitalization day to in May now, as opposed to in April. Nobody knows whether those models will turn out to be correct or not. But just looking at the information that we have, I really think that we should delay these closings at least until the end of June, because I think that will get us through the primary focus or the primary intensity of this current crisis here. So I have to agree with some of those who have provided comments that this is not the best time to actually proceed with the closings while the ongoing here with the coronavirus. I agree that we need to close it, but I think we should extend the closing date at least until the end of June. Thank you.
Thank you. Supervisor Villapudua.
Thank you, Chair Miller. Supervisor Elliott took the words out of my mouth. I think that it's very necessary we stay open at least until this pandemic is over. I think people rely on that, rely on both of these clinics, and I'd like to see them stay open until at least July 1st, the end of June. That could be possible. I think that'd be the best thing for all of us.
Thank you. Supervisor Patty.
Thank you, Madam Chair. Mr. Culberson, since, as we heard, there's great concern, and as expressed by the supervisors that have spoken and by the public, that's unanimously felt that obviously we're in unprecedented times and there's great concerns, and as we're discussing, could we refocus and put a primary level of, and as you mentioned, the hospital's overwhelmed with people coming in and testing and some of the situations that we're dealing with due to this coronavirus. Is there an opportunity to repurpose these clinics so that the primary focus is health and well-being as it relates to perhaps health concerns with the COVID-19?
Supervisor Patty, through the chair, I'm going to hate to defer to Dr. Park, but again, our efforts at the hospital have really been doing two things, and now we're on to our third thing. First of all is immediate response for folks that are having difficulty typically breathing. This is a respiratory virus predominantly, although it is affecting other things, of course, my diabetes and congestive heart failure. So the emergent response is the thing that we're concentrating on right now. Secondly, then, is if you do require hospitalization, and I think we continue to grow each and every day 1 or 2 more admissions a day. So these are folks that are severely compromised. We either put them in a medical surgical or in the ICU. So that's the second function that we've been offering. Third, then, we've been testing, and we will continue on with our current program. I had some news from when I reported last week. So very surprisingly, our vendor Cephia delivered our in-house testing modules, and we are actually able to test in-house now beginning, I think, yesterday morning, and we're having around a 4-hour turnaround time, so that's making quite a bit of difference. So the third thing we're doing then is making sure that we're providing testing in addition to what is being provided by public health and also by then the Verily program with Quest. So for us to turn around then and say, well, we would like to continue even more outreach for COVID patients that don't require emergency department visits. I don't know what kind of visits we would have. We are continuing that through the video, and if indeed are very severe, some of our clinics are open, a limited number remain open. I've not asked if we would keep these open or other ones open up, because we really, per Dr. Park's order, really trying to avoid the face-to-face contact wherever we can. I guess I'm not really answering your question, Supervisor. I'd be happy to work with Dr. Park to see what other, and Dr. Fadu, how we might be able to focus in the short run. Again, but what we've been really concentrating is the very, very severely ill. We've expanded the number of beds that are available to inpatients. We've added additional respirators, additional testing options.
Understood, and great points. I appreciate that analysis of the current situation, and obviously we are anticipating a swell. So the question is, if that I do have, and through the chair, I'd like to call up Dr. Park. that we can maybe ask her, since you've deferred to what you believe might be, some of her concerns and maybe how she might advise this. But my question is there a way to defer traffic from the general hospital to a couple of the clinics to lighten the load of what you're experiencing at the hospital, as that might be overwhelming at some point, and we can create a gateway through the clinics that would assist with the services that are going on at the hospital when necessary?
Supervisor Patty, we're really trying that right now, really through the video access here. If you have the symptoms, then we do send you to our current clinics. And again, some of the unique natures of this disease, really you're going to be compromised and then get in a very, very rapid decline, almost in just a matter of hours. That's what's having watched the medical response at the hospital here and listened to the internist, the pulmonologist here, someone that is on a little bit of air, oxygen, suddenly is in the ICU ventilated in very, very quick fashion. So I'm not sure I know enough about the ability to have these clinics be feeders to the emergency department that the current video model isn't able to accomplish.
But I would imagine not everybody's doing video. I don't have video.
Yes, that's correct. Yes. And
so if in some way maybe we scale back and we're not seeing as many people coming in the door, but you would bring in people that are calling and they're not available to come in by video and meet somebody remotely, but this could be a gateway to keeping traffic out of where else it might be swelling and where else it might be overwhelmed. And as the supervisor pointing out, and as mentioned by the public, I mean, this is a concern at this stage in relation to the COVID-19.
Well, certainly the creativity of Dr. Fadu, our Chief Medical Officer for the clinics, has been really adopting some of these alternative pathways, and I bet he would be able to help us try to resurface or redirect Supervisor Patty.
We could repurpose, perhaps.
To a limited extent, I would think. I didn't bring him here today with me, but again, he's been very creative in coming up with alternate methods to get into the clinics during this time of public health problem.
And I know, as discussed, you had a plan to assimilate some of the staff into other areas of healthcare services in San Joaquin County. So you still might do that if you're making a hybrid at the clinics, making sure you're available to the public for the needs and meeting the demand, those that aren't able to come in by video and do a video meeting, but that need to come in person. So you might be able to scale back some of the staff and keep the doors open and maximize the services that are available to those that do need to come in.
Yes, Supervisor Patty, just again, another anecdote here. We have had on occasion our own testing is out in front of Health Center East and Health Center North, kind of the main entrance to the clinic system. And we've had a couple of patients while they're coming in for their testing that are very symptomatic and having breathing difficulty. We'll bring them right into the clinic at that point. So in that sense, we're already doing that to a smaller extent than I think you had intimated, but that's certainly something we can take a look at with Dr. Fadu.
Understood. Well, I would just, in conclusion, I would just say that maybe we could modify what the staffing level is at the clinic and staff that can be assimilated elsewhere that may not be necessary, so that we're not overstaffed and underperforming, but still keeping those clinics open. I think, as Supervisor Elliott pointed out, until perhaps into a June date to be determined, and keep services available to the public as they are voicing the concern and the interest.
Okay.
Thank you.
Thank you.
Thank you. I also have some concerns. I had them before, and I brought them up in terms of continuity of care for the patients at these clinics. And what I had hoped to see was a little more concrete plan in terms of we have these commitments from community medical centers and Golden Valley with a statement of their capacity, of their willingness to provide family physicians that are available to accept these patients. What a lot of folks are indicating is that These other clinics in Manteca are already very crowded. It's very difficult to get another physician to take you on. And then again, the transportation. We're seeing a reduction in private transport. We're seeing a reduction at this time in public transportation. I'm not comfortable closing them and without seeing very specifically what the plan is for how these folks will be migrated, where they will go, that it's already been approved. They've already worked with Health Plan of San Joaquin or HealthNet. So I'm going to agree with my colleagues. I think we need to delay this at this point until June 30th. I appreciate very much the fact that this is an additional loss that at a time of extreme crisis that the hospital will be absorbing. And I also appreciate the fact that that means that this board may be looking at making some budget adjustments later on. But I do think that until we can be really assured that the most intensive part, the apex of this crisis has been reached, and that we have a very clear plan in place for the patients at these two clinics. I'm just not comfortable closing them at this point. So I don't want to throw the entire process out because I know there's a lot of timing that goes into this. So I would be comfortable at this point with a 30-day, pushing out the date 30 days. And I would like to see the plan come back to the board with an update so that we will know if that June 30th date is going to be appropriate or if it needs to be pushed further out. So that's where I'm landing on this. Thank you. Is any other comments from the board? Then I am looking for a motion and a second.
The motion be to... We'll start. Go ahead, Bob.
Okay. I move that we approve the closure of the federally qualified health center lookalike outpatient clinics on Hazelton Avenue in Stockton and Spreckles Avenue in Manteca, effective June 30th, 2020.
I'll second the motion.
Right. We have a motion and a second, and I want to make sure that it's clear that we will get a plan before, and if this date needs to be adjusted, that will come back to the board. That's in the form of direction as opposed to part of the motion.
Yes, Chair Miller, we can provide that, yes.
Thank you. So we have a motion and a second. Everyone please cast your votes.
Madam Chair, just for clarity, also, I had made a suggestion. I'm not sure if it needs to be included in the motion, but will you be looking at modifying the operation at the clinics before we approve extension? As we discussed, I mean, your staffing levels may fluctuate. There may be different needs or demands.
Supervisor Thaddeus, through the chair, that's something that we're doing right now. As I mentioned to you, the volumes are off dramatically, and we have been able to grab some staff from the clinics and redeploy them elsewhere. We keep anticipating a huge demand of inpatient services here, and a lot of the staff in the clinics have volunteered already and are ready and willing to assist with those changes. So that is ongoing right now. I think it will anticipate it grows over the next month or so.
Okay, so upon approval today, you will also still be addressing and modifying needs and the demands at that clinic so that we're not approving for it to keep operating as is.
Supervisor Pad, yes, that's correct. Independent of your vote this morning, that's what we are doing, yes.
Okay, thank you very much.
Okay. Your vote? Then that motion is approved 5-0. Thank you all.
Thank you.
Okay, next up is a discussion item to receive this week's update on COVID-19 on the pandemic in San Joaquin County and to provide direction to staff or adopt orders as necessary. Ms. Nino, do you want to introduce this, or?
I'm sorry, excuse me, Madam Chair.
Yes.
First up is a consent item from Public Works for the temporary closure of the...
Oh, I apologize. Thank you very much. Next up is a consent item. It's a COVID-related item, but it is to retroactively approve the Department of Public Works temporary close to the public Lovelace Road Material Recovery Facility and Transfer Station, North County Recycle Center and Landfill, and the Household Hazard Waste Facility in response to the coronavirus. So we're looking for a motion and a second on that. It's on consent.
Madam Chair, I just want to make one comment real quick. I'm sure other supervisors received similar calls in regards to illegal dumping, et cetera, so I would ask again Public Works to make sure that we have an accurate report of what's actually happening, because there's great fear, especially in the ag community, that because of this there's going to be more dumping in orchards, et cetera. And so I know Director Belangi has assured me that they're working on it and looking at it, but I think that the last thing is that if there is an increase, which there may or may not be, that we would look to maybe revisiting this at some time in the future.
Absolutely. So we'll look for regular updates on this in terms, specifically how it's impacting any illegal dumping.
Chair Miller, if I may, real quick, Chris Belangi, Director of Public Works. As part of your regular update, this is your first update, actually. Mr. Stone, Deputy Director of Operations, has been tracking that on a daily basis. And as you know that, we're fine, Michelle. Yeah. So we're seeing not an anomaly in that illegal dumping stuff in there. As a matter of fact, he was giving kudos to our community folks to be sensitive. That during the springtime we would see a little bit heightened activity of this type of unlawful dumping, but we're seeing a little bit less actually in there. And also to just give you a quick update, we've also either the folks got the message due to our extended outreach or because of the stay-at-home order for non-essential things that they are complying to that. We're seeing a lot less self-haul disposal at our Foothill landfill as well. So we're doing good. We're keeping up with activities that are happening in there. So we'll keep you posted.
Great. Thank you very much. So we're looking for a motion and a second.
Make a motion to approve.
Second.
We have a motion and a second. Please cast your votes. That is approved 4-1.
Just a second. My display didn't appropriately show, so I wanted to vote yes.
Oh, okay. Then that is approved 5-0. Thank you.
No, I'm sorry, Madam Chair.
I voted no.
Yeah. Elliott voted yes. Supervisor Patty voted no.
Okay. So it is approved 4-1. Thank you. Okay, so next up is a discussion to discuss and receive an update. I'm going to ask County Council to kick this off. There were a number of items from our last meeting that you were asked to follow up on, and so I'd like to give you a chance to report out on that first.
Thank you, Madam Chair. Here's the microphone. Have been following up on the discussion at the last meeting regarding golf and any change or redirection that was coming from the state. I have followed up on that. I am aware that Assembly members Eggman and Flora have both asked the state for clarification on the issue of the closure of the golf courses. I've not received any or been made aware of any change from the state on that issue to date. According to information published over the weekend on golfadvisor.com, 85% of the courses in California are closed. Counties that have specifically banned golf in their orders include Stanislaus, Alameda, Contra Costa, Santa Clara, San Mateo, Marin, Yolo, San Francisco, Butte, Riverside, Ventura, Monterey, Placer, Merced, Tulare, Los Angeles, and Santa Cruz. I believe there are some others that I just. If we do become aware of any additional information, of course, we'll provide that to both Dr. Park.
Okay, thank you. So then at this point in time, is your opinion that the current order for San Joaquin County as it exists is compliant with your understanding of the state's order?
Yes. So the county is allowed to be more restrictive than the state's orders are. The state has not mentioned the topic of golf, either for or against. And Dr. Park's order did specifically close the golf courses.
And your earlier opinion that Dr. Park is the sole authority to make that determination, as are all the public health chief medical officers for their respective counties. Is your opinion, does that still hold?
Yes, it does. Dr. Park's orders are based upon her determination of what's necessary to address the emergency health situation and does not require ratification by the board.
Thank you. And to your knowledge, has Dr. Park changed her determination?
She has not.
Okay, thank you very much.
Madam Chair, just a quick question. Go ahead, Bob.
Hang on here. Let's see. First up, Supervisor Elliott, you're first in the queue.
All right, thank you. I'd just like to follow up for further clarification on the state's position. You mentioned that they had not specifically mentioned golf courses one way or the other, but is it your interpretation of their order that since they did not include golf courses and golf activities as essential activities that should be allowed, then therefore they are appropriately not considered as places that should be kept open?
That's a very good question, Supervisor Elliott. Thank you for that, because really the golf courses address, there's two issues involved with the golf courses. On one side is the recreation aspect, the ability of people to get out into the environment, get some fresh air, walk through their neighborhoods, or walk on a golf course or walk through a park. So that's one side, and it's true there that the state has not addressed golf courses in that regard one way or the other. The other aspect of the golf courses is the business aspect and the employee aspect. And golf course operations are not included in the list of essential critical infrastructure workers. And so, yes, it is my opinion that in looking at that list, that golf courses, as their operations go, should be closed, and their employees should abide by the fundamental order or the baseline order, which is to remain home.
Thank you.
Supervisor Wynn.
That was basically my question, because there's two components to this issue, and we had talked about, and I think Dr. Park had even mentioned, we talked about landscapers, landscape gardeners, and I know one of the comments was, well, if they go out, they ride in pickups or whatever together. Golf courses are a little bit different in that normally employees come to the location, the parking lot or wherever. They usually work independently on a lawnmower or whatever they're doing, and, considering the size of most golf courses, there's, especially if the rules were simply that you had to maintain that social distance, which we talk about, repeatedly. And I guess, I know there's a lot of complaints or criticism that, somehow we're championing, golfers, et cetera. It's just a question of reasonableness in regards to the business side. Forget the golfer side. I mean, that's we have no control over that. But from the business side, the question arises, golf courses have a tremendous investment in their grass and their trees and all the greens, et cetera. So to say that they're absolutely closed for possibly 30, maybe 60 days, the question is, how much will it cost them to recover from that? And that's the issue, understanding the health side for the workers, but more importantly, the business side. And I know, some people think, well, you shouldn't be talking about the economics, but the economics is going to come back, and hopefully, our decisions, I say government in general, will be reasonable enough to allow that return to be as least expensive as possible. So that's just a question.
This progresses, and as we get over the apex and we start seeing throughout the state whether curves are flattening or not, that there will be that some of these issues will be addressed by the government and by the state, and they will start addressing businesses and their ability to conduct minimum basic operations. I know that in the past week, several counties have issued revised orders. The Bay Area counties, for instance, all issued revised orders that locked some things down a lot tighter. I know that I believe it's Santa Clara included in their order that people aren't supposed to travel more than 5 miles away from their home to try and keep them within a particular environment so they're not moving out where they might encounter or where they might spread the virus further. I know that also the Bay Area locked down construction efforts much tighter, limiting them to COVID-related construction or to construction related to homelessness. I've analyzed some of that information, and I provided a document to Dr. Park yesterday. We haven't had an opportunity to follow back up on that.
The other follow-up on that is I know you got an email from a constituent in regards to realtors. I don't know if you're going to cover that, but that's another area that, again, the question arises is, and I understand, that sometimes it's a individual experience as opposed to a blanket profession, but I think one of the things that we need to do is at least address these as far as the compatibility in regards to our ordinance as to how we enforce them. You can pass 100 laws and regulations, but then the question arises, how do you enforce it? Or even do you enforce it? So I just hope that what we're doing is, and I think we're doing the appropriate thing. Obviously, you look at the results of California compared to other states. Governor Newsom was wise in his implementation early on the stay-at-home rule. So anyway, again, I'll defer to you in regards to the realtor whenever you get to it.
I'm happy to speak to the realtor issue because there was additional confusion, I think, that was injected into this environment. And so let me lay out the timeline on that. Back on March, I believe it was March 17th, the Department of Homeland Security, through their, I'm going to forget the meaning of the acronym, but the CISA, C-I-S-A, issued a COVID-19 list of critical infrastructure sectors. I believe there's 16 sectors, and within those sectors, they identified certain work categories that the federal government thought appropriate, needed to continue. That was issued as an advisory. It's not regulatory. It's not mandatory that any state or municipality abide by that. On March 19th, the governor issued his stay-at-home order, which referenced the CISA list. On March 22nd, the state public health officer then issued a revised CISA list. That was issued as part of an order. Or part of her order. And so it included most of the categories. I would dare say it probably included all of the categories that were on the federal list, but then added some additional categories and some clarification. On March 28th, the federal government, the Department of Homeland Security, issued a CISA 2.0 list. And the CISA 2.0 list of note included additional categories such as retail firearm sales and real estate sales in their revised list. Again, that list, if you look on the CISA website, clearly states that that list is advisory and is not regulatory and is not directive from the federal government that any agency adopt or abide by that. They expect that municipalities and jurisdictions will look at that and modify it as appropriate to fit their needs. To date, the state public health officer has not amended her list of critical infrastructure workers, and so it's my opinion that that list is still controlling and that the county as an entity of the state is required to enforce and abide by those orders and regulations, just as we're required to abide by all general laws.
So in this case, or these cases, is it our position, or at least process, that we would contact the state to determine if they've had any discussions in regards to these particular expansions of the list?
That's a possible venue. I would venture the guess that, at least as far as the state public health officer, that they're pretty busy these days. I do know that other people are making requests and other people are asking. I know that CSAC is asking for clarification on a variety of issues from both the governor's office and the public health officer. And so I think as that is an appropriate venue to ask for that clarification. We don't know whether they'll respond or not.
Well, I know with the realtors, even their guidelines, no open houses, virtual tours, things like that. It's almost, no contact, so to speak, with exception maybe the signing documents, et cetera, which most banks these days do things electronically. You don't even have to ever meet with a person unless it has to be notarized. And the only reason I bring that up is I understand everybody's busy, I get it, but I think, in all fairness, that we should probably get at least in line on some of these, questions, because at some point in time you can't. I don't want to return, a response back to my constituents is that, well, the state hasn't done anything. The expectation is every government, local, state, federal, is doing the best they can to accommodate their constituents. And so all I'm saying is that at least we submit these requests or questions so that at some point in time somebody can say, yeah, we've been looking at it, we've got several other requests, or no, absolutely not. And I think that's probably, what most people want to hear. At least we're working on it.
And I think that's appropriate. Yes, Supervisor.
Thank you.
Thank you, Supervisor Patty.
Thank you, Madam Chair. I think Supervisor Wynn and both and Supervisor Elliott both bring up really good points. In particular, as Supervisor Wynn pointed out, addressing and looking at compatibility and looking at the different segments of our economy. And it's, I believe that we should be aligned with what's happening regionally. While Stanislaus, as you pointed out, and by the way, my numbers on golf course closures are 60-40. 60% closed in the state and 40% open. That may have changed or modified. Stanislaus did something that I'm going to propose we do here in San Joaquin County, but they created an economic advisory committee, and they sat down, they looked at it and holistically reviewed, and they're coming back to the board, as they are today, with some suggestions, and one of them is to reopen their golf courses. Where that goes, I don't know, but this is something that they're looking to address and identify. And I do believe that we should align ourselves regionally with what's happening. While everybody's thinking that we're talking about golf, and we're being accused of pandering to a certain sect. This is about jobs. This is economic viability and sustainability. Every single job that's taken away, every single person that doesn't have a safety net, every single person that has a family, has rent, has mortgages, has children to feed, are affected by the decisions that are being made. And it's a tremendous burden that's on Dr. Park's shoulders. It's also a burden on the staff. It's a burden on this county to make decisions that are going to be very difficult to make. So I do propose that we come up with and populate, I mentioned it to Supervisor earlier to join me, but I'd like to create an ad hoc committee, bring in John Solis. He's working with the mayor tomorrow and doing a teletown hall for small businesses. So obviously businesses are going to hopefully weigh in on it and discuss their issues and concerns. We have a medical and a health situation that even if our apex is at the end of May or mid-May, however it may be, that doesn't mean come June 1st, this is all over. And in July, we may still be dealing with this, and we cannot shut down businesses and our economy sustained for months out. Dr. Fauci says yesterday that he doesn't know that we will ever go back to what was normal prior. So do we say that there will never be sit-down dining in a restaurant ever again? There won't be golf played on a golf course. You cannot play tennis. You cannot do anything in your economy because it's all changed. Is that where we're going? I don't know. But we need to look at this, and I think that we've put together a little economic advisory committee. We might be able to look at this at piecemeal, one section at a time. I'm a little bit concerned as County Council is talking about real estate. There are dozens of counties that are allowing real estate, not only transactions, but open houses. Now, I'm sorry, let me rephrase that. The showing of a house. Somebody sees a house virtually and they want to purchase it. Well, they've put in criteria. You cannot go in and view the house if it's habitated, because you don't want somebody going in, sneezing and spreading germs, and then a family comes back in hours later. So what they've done is, okay, if you're going to show a house, it cannot be habitated, and there's going to be certain criteria. Maybe it's wearing gloves, might be wearing masks, whatever it may be, and this is something we should discover and utilize as recommendations to the board and to Dr. Park so that we don't cripple an industry. If somebody wants to buy a house, and I know, Ms. Dino, you've talked about, buying houses, and we've looked at it, and we're all live in houses. Well, you can see it virtually, but before you sign papers, you're going to say, I want to walk in that door. I want to walk in the bathroom. I want to walk in the bedroom. I've seen it virtually. I want to take a view of this. Do we shut that down for the next 2 months, 5 months, 7 months, 8 months, 10 months? While we might wait for the state to come up with some revisions, can we afford what may or may not be coming down the road? So I think it would be wise for us to look at these holistically. If there's other counties doing it, if other counties are allowing certain things to happen that we aren't, let's come back and maybe bring to this board some recommendations, and for Dr. Park and for our staff, for the administration that works on behalf of the residents in San Joaquin County, let's take a look at this. And what recommendations could we make that would be wise and considerate of jobs? This is about jobs. This is about our economy. While everybody here in this room, I'm rather certain, receives a paycheck, a government paycheck, there are thousands, tens of thousands of people that are affected by us, by the decisions that are made. And they're going to lose their houses. They're going to lose their apartments. They're going to lose the ability to take care of their children. And you're going to talk about civil unrest. You want to talk about issues that can become even more damaging and detrimental to our public safety. These are things we need to consider here in San Joaquin County. This is not about playing golf. This is about jobs. And I would wholeheartedly believe that while County Council has said that, staff and people working at a golf course would not be essential jobs. And I agree with Supervisor Wynn. You cannot have a golf course. If somebody's riding a lawnmower by themselves, not 5 people deep, you're riding a lawnmower by yourself, there's not somebody within 50 or 500 yards of you, you're going to tell me that's a detriment to public safety and that person's well-being? So let's fire that person. Let's make sure he's at home or going to Costco during the day and probably getting far more greater risk of exposure at a Costco than he would have if he's maintaining his job and the grounds that he's in charge of. We have to be, we have to be prudent. We have to be careful, but we also have to be considerate of the impacts of that person losing their job. These are very, very serious decisions being made. And while we shut down our golf courses, there's people traveling up to Sacramento playing golf, riding 2 or 4 people in a car. Golfers are going to golf. San Diego shut down their beaches. Surfers are driving north or driving south, and they're surfing. So you can shut down everything you want, but you're opening up more exposure when you can get people traveling outside of your region to do an activity that they're going to do. So I believe we should really take a holistic view of this. Again, we'll finish with the suggestion, and I would like to form a committee and come back with some recommendations. I think John Solis would be a great person to have on the committee, somebody from the CAO's office, somebody from County Council's office. I mentioned it to Supervisor Elliott if he wants to participate, or anybody else, but let's look at these decisions and come back with some recommendations of good practices of what other counties are doing for jobs. This is our economy, local jobs.
Madam Chair, Supervisor Patty, I know there is now a regional valley call in regards to COVID. Is there any opportunities? Has there been any central information receiver as a result? Supervisor Patty, you talk about regionally. I assume somewhat along the 99 is that when you talk about regionally, you're talking along the 99, correct?
That is correct.
Okay. So I know they started calls last week, Friday, and possibly some of you may have been on them with our lobbyist, Shaw Yoder, because they represent a number. Were there any discussions about maybe getting some kind of regional approach there?
I did not participate in that conversation.
Okay.
I reached out to UCC to see what the big counties are doing for clarity on some of these, which of course is going to go through CSAC and there's a lot of questions. Obviously, this isn't all San Joaquin County. The economy is statewide. We brag about we're the 5th largest economy in the world. Well, I got news for you. That's going to change dramatically real soon. So, we need to be in consideration of local jobs and the people that live outside of these doors.
Just a thought. I know they're doing every Friday calls with our lobbyist, and they do represent a number of the 99 counties that are represented on those calls. So I have no problem reaching out to them and see if they're collecting some data, because what I'm hearing is to get some level of continuity is what I'm hearing regionally, and not just do our job view, given we recognize the expertise that Dr. Park brings as part of her order, and also the expertise our county council provides. But I would have no problem at least starting there, so at least this board could see from a regional approach what other counties are doing, as Mr. Miles has done with a number of any augmentations or recommendations from the order, and how that reflects to the state of California and what they're coming down, and to have some input from this board, and whether or not it's part of an ad hoc committee. But I do know there is a valley approach that is they are meeting, I think it's like 1:30 on Fridays. So if that would be helpful to the start, if the board takes next steps in establishing this committee, I'd be happy to at least reach out from that regional approach, Madam Chair.
I'm wondering if, and I'm going to address this to Supervisor Wynn, through the COG, there has been a Valley COG effort to collaborate on a number of issues, and I know economic development is one of those issues. Has that been activated as part of this effort?
No, but as Ms. Nino talks about a 99 corridor, it is the 8 Valley counties from Kern to San Joaquin. One of the advantages of the San Joaquin Valley Regional Policy Council is it's made up of representative COGs, and all COGs have representatives both from the county and all the cities. So you're talking about 62 cities that are represented, plus the 8 counties. We have branched out what began as a COG transportation forum to water, and we've moved to economic development. In fact, our last trip to Sacramento in meeting with the governor's office and state departments was talking about economic development in addition to transportation projects. So we've kind of, expanded our reach just because of the representation that we have within the council. So I'd be more than happy to talk to our executive director and the other executive directors like Andy Chesley, et cetera, and see about using that forum, because you get everybody involved in that discussion.
Yeah, I think that's a really good way to proceed, and I do agree that bringing in the economic development directors from the various counties is probably a great idea as well to participate in that. So I think if we already have a forum where we already have buy-in from all of the counties and all of the cities through those 8 counties in the valley, I think that's a great place to start. I think there would be a lot of appetite for that. And the meetings are public, so it wouldn't exclude anybody else from participating.
I'll look into that.
Great.
Madam Chair.
Madam Chair, and I'll follow up with that Valley discussion that is starting to, I see that I have another one on my calendar for Friday, and I thought I saw all the board members on that also, so I'll reach out directly to Mr. Yoder on that.
I think that would be a great idea. Thank you.
Madam Chair, as a follow-up, I would also suggest that we go into those meetings with suggestions and ideas. So you sit around asking, and you can look at each other, and you can go in different directions, and everybody can wonder and have another meeting and talk about it, where we actually need to put together a committee, an action committee, to come up with suggestions and good practices and adopt what might already be utilized and adopt what might be different interpretations of the same parameters that we've all been given, which are somewhat flexible in as much as some counties are doing things differently than what we might be doing. So I would suggest, and I am, whether it's an official ad hoc committee or not, I've got Doug Wilhoit from the Stockton Chamber of Commerce. I'm on the board for Stockton Builders Exchange. John Solis, I've mentioned this to him. So, I'm going to put together a little working group and talk about and add it to those discussions with the other organizations. But, I don't know who else here, but I sign the front of paychecks every single week. I deal with businesses. Yesterday I was on the phone with dozens of businesses that I do services with. Dozens. And they're all telling me, we've got a real problem here. You guys need to help us. So you need to do something. So I know that we've all heard from constituents at different levels, but I make a payroll every single week. I sign checks. My business is doing okay. A lot of others are not. So I am going to take an active role in this, and I'm sure it's welcomed by the board, and I would welcome anybody on the board to be part of it.
Great. Thank you.
Thank you, Madam Chair.
So now I'm going to call Dr. Park up to see if there are any other updates in terms of briefing the board on the status. And if it's not you, Dr. Park, if there's someone else that you want to call up.
I'll give you a brief update, but then I think Mr. Birch has more of like a PowerPoint presentation to give you from the EMS side. So public health continues to perform case management. That's actually one of the biggest things we do in an outbreak, tracking people with confirmed COVID-19 and ensuring that they remain isolated until cleared by us. We are also working with partners continually throughout the county, giving guidance and providing public health messaging that is appropriate for sharing widely. We are trying to have an increased presence on social media, and you may see us creating educational videos that will be available via social media outlets. And other than that, we continue to try to do our part to impact any surge by decompressing hospitals, ERs, and bed usage. We are trying to keep up with at-risk populations and maintaining the health of at-risk populations by staying involved in the elderly populations in the long-term care facilities, educating those facilities on maintenance of hygiene and isolation techniques and having proper PPE usage. And we're also involved with the homeless population and the task force that are going on around the county with homelessness. So just trying to help out with those populations that we're doing our best to keep out of the hospitals. But I believe that Dan Birch has a presentation for you.
Thank you.
Thank you.
Thank you, Madam Chair, members of the board, and Dr. Park. So we have a Brief presentation. It's only 12 PowerPoint slides, so I'll try not to bore everybody to death with that. I wanted to be able to update the board on some current statuses and answer some questions that I know all of you may have. And at the end, I can talk about some of the advanced planning that we're also doing that's not covered in the particular slide presentation. So with that, I'll go ahead and see if I can make this work. Okay. Got it. So some of the issues that we are working on in conjunction with public health and the broader healthcare leadership team in San Joaquin County is our office is issuing specific COVID medical direction and taking other actions to direct the pre-hospital care system, which includes partnering with our hospital systems. We're planning and preparing for projected patient surge at the hospitals and long-term care facilities. Our major plan for patient surge is to expand current capacity at those facilities. We believe, and actually I was on a discussion earlier with the Department of Public Health at the state of California, that we believe that the best place for patients is at hospitals. We maintain and report our medical health system situation status on a daily basis, both to our local system and to the state. That includes tracking ICU beds, medical surgical beds, and the availability of ventilators in our system. We stood up and established and are maintaining a medical health logistics base for processing, receiving, and distributing medical supplies. I'll go into a little bit of that further as the presentation goes on. We otherwise are working with our other healthcare leadership team to operationalize all aspects of Emergency Services Function 8, which is medical health emergency operations with the Office of Emergency Services. Medical and health logistics. To date, we have processed 625 requests from healthcare providers and organizations within San Joaquin County through the medical health mutual aid system. We have delivered a total of 553,621 items. These include N95 masks, simple masks that are not respirators, hand sanitizer, gloves, gowns, face shields, and portable hospital beds. The initial supply that we stood up and released was the county's own medical cache of equipment. That went out first as an initial bolus to our system and was followed up with processing requests through the state cache, which ultimately led to the Strategic National Stockpile being released by the federal government. At this time, I'll go on a little bit further. On the next slide. We've allocated personal protective equipment to all 7 acute care hospitals in the county, all four emergency ambulance service providers, our three non-emergency ambulance service providers, 13 fire departments that have requested assistance, and more than 25 long-term care facilities, clinics, hospice organizations, and other healthcare coalition partners that we work with. I need to remind everybody here, as well as at home and who may be watching, that the medical health mutual aid system is the system of last resort to help people who cannot get their supplies from commercially available vendor procurement. The state at different times has been completely depleted of supplies, and they're trying their best to refill that and make those available. But all of the hospitals and healthcare providers still need to work their normal commercial processes and procurements to attempt to first obtain the supplies that they need before looking towards the medical health mutual aid system. We've stood up customer care assistance with some of the long-term care facilities in our community that needed help navigating the mutual aid process. We have people that can work with them on the phone and walk them through that process, and have been doing that. A question came up about procurements. The state of California has opened a site on their website. It's contributions.covid19.california.gov. Any vendor who's looking to either sell or donate supplies to the state of California can register through this website and make those available to the state of California, and then the state of California will make those available to the regions and to the local counties through the mutual aid system and others. There's also been discussions, broader discussions, with the counties being able to obtain a direct access of the vendors that the state has vetted. One of the things that we're seeing, and I see this a lot, is basically phishing scam emails, people saying, I have everything you need, how much money do you have? And it's in times like this, it can be very distressing for a lot of people, and they'll see things like that and they'll grasp onto it, but really they're phishing scams. And we need to be extra cognizant of that as we move forward. One other item that we've been working on for the past several weeks and has continually tried to refine is assisting our pre-hospital care personnel with occupational exposures. Every agency is responsible for their own illness and injury prevention program and their own process for occupational health for their employees. Dr. Schaefer has been very forward-thinking in her direction to the system about how to take protective action and when to use proper protective equipment. We took a position that was different than our neighboring counties early to say to treat every patient as a potential COVID patient or as a potential communicable disease risk and take all necessary precautions. We refined that as the course of the pandemic, but at this point, everybody who encounters a patient in the San Joaquin County EMS system has been directed to apply personal protective equipment during those encounters. We've also issued guidance, and we're looking to refine guidance as we continue, and the state has just issued something last night to us as well on how to conserve personal protective equipment in the pre-hospital setting and in the hospital setting. And as we can work through that, we're making that guidance available to our system partners and recommendations. One of the requests of our agency from the first responders in our community early on in the process was to assist them in knowing when they came into contact with a COVID positive patient. So working with public health in Dr. Park, we created a process where the EMS agency took it upon themselves to obtain the information from patients so we could cross-reference them with electronic patient care records. And if there was a patient contact with a COVID positive patient, we could notify the responsible agencies so they could do their own screening of their own employees. We did that based in part on the fact that there was a caregiver-patient relationship established if we have a medical record that we can reference, and that allows us to share that information. In addition, one of the things that we have done for many years in cooperation with public health is anytime there's a disease outbreak at a long-term care facility in the county, whether it's norovirus or some other disease, we would notify the dispatch agencies to put an alert for a standard 30-day notification for that particular facility to highlight the importance for responders to utilize personal protective equipment when they arrive. We're continuing to do that with our COVID positive patients as well. We have not, as some neighboring counties have, included private residences. Both Dr. Schaefer and I have concerns about that, and if people have questions, we can answer that for you. Over the last weekend, starting on Friday, working with Dave Culberson and his team and the team from OES and Dr. Fadu with the SJH clinics, we created an opportunity for any interested cities, fire districts, or other municipalities or local jurisdictions to contract with San Joaquin General Clinics Occupational Health for their employees for follow-up on COVID exposures. And Dr. Fadu is working through those processes along with Healthcare Services Agency and Administration SJGH to stand that process up. And that would give those people an opportunity, those agencies an opportunity to get direct counseling if their patients or if their employees are exposed, what a true exposure is versus just a contact, and then also a pathway for testing if necessary and is warranted based on a physician's oversight. Now, one of the things that everybody's been asking about, and I'm glad I'm able to share this with you today, our plan for surge has always been to expand hospital capacity. With that, since the beginning of the pandemic, as it stands today, we have expanded current hospital capacity by 64% in San Joaquin County by adding an additional 570 beds by working with our local hospitals in their plans internally as well as the county's plans. The county we had the foresight of purchasing 750 medical beds, and we've had those in storage. So we were immediately able to implement our plan and start deploying those beds to the hospital so they could prepare. Some of our neighboring counties right now, as I've talked to several of my colleagues, are actually trying to relocate some of the logistics that the state has been trying to stand up with alternate care sites to redirect them to their hospitals where they feel they would be better used. But right now, there's a disconnect between some of the local operations and the state on how best to utilize some of those resources. So we have clearly achieved the governor's initial challenge to bring the hospitals to 40% above capacity. We're now, he issued a second challenge to reach 50%, and we're standing above that as well. And we're continuing to work with our hospitals on other expansion opportunities. Based on last night's numbers, we're always, it seems by the time we can report, we're always just about a day behind. So to make it easy to understand versus some of the things that we normally publish with the EOC briefings, we kind of changed the format a little bit. There's a total of 99 licensed ICU beds in San Joaquin County. Currently, only 34 of those beds are in use. There's 199 ventilators that we've accounted for in San Joaquin County. 46% of those are in use. So that gives us our good news. 76% of hospital ventilators are currently available. Each hospital, in discussions with them, does have plans in place to increase their licensed staff and their beds, and we're working with them on that. And at this point, every hospital has created a triage process for screening emergency department patients for COVID-19 and trying to help separate symptomatic and asymptomatic patients at their facilities. Now some of our concerns. Only 30% of the licensed, or only 30% of our licensed ICU beds. Let me go back. I have to go back. I may have misspoke on my numbers here. So this is where it's different. Of staffed ICU beds, which we track every day, we only have 30% of staffed ICU beds currently available. The reason for that is the other beds that are licensed don't have staff to operate them. We may not be able to achieve all of the surge targets that we've created because we may not have the staff available to the hospitals to expand. Although they all have plans to work on that, we have to take into account that if the patient surge does hit, it's also going to hit the healthcare workers, and we'll have fewer staff available. One of the other concerns that we have in our planning is if the patient surge does arrive in the Bay Area or in neighboring systems before arriving in San Joaquin County, San Joaquin County's hospital capacity may be taken up for these patients that arrive before our local patients do. Regional planning. So the state of California Department of Public Health is creating a Region 4, which we're part of Region 4, alternate care site at the Sleep Train Arena in Sacramento. Their goal is to create 400 low acuity hospital beds for COVID-19 positive patients to serve the counties that are of Region 4, which includes Sacramento, Stanislaus, and San Joaquin. There are ongoing discussions regarding the process to transfer patients from our acute care hospitals to Region 4. Those plans are not finalized yet, but they are looking to create a single call center that hospitals could use to transfer patients. The state is providing all of the management, staffing, logistics, and the wraparound social service needs to service that particular alternate care site, which our hospitals will be able to utilize. And a topic that I wanted to have a discussion about as well in the healthcare system, and we've been having that today, both talking about the hospitals, clinics, and other economic issues, is currently ambulance call volume is down 22% from last year at this time. Hospital census, as you've heard, is down, and emergency department visits are down, and all the hospitals have canceled elective surgeries. So their cash flow is way down, while their staffing is way up, and their costs are way up. When the patient surge does arrive, at least on the ambulance provider side and with the hospitals, they may face additional difficulty in cash flows as reimbursements will arrive 90 to 120 days after care is provided to the patients. In addition, as we've discussed, the economic impact on families. The downturn in the economy may result in delayed payments of medical bills as patients and families need to spend limited funds to meet other basic needs besides healthcare payments. These are all things that we have been keeping an eye on that could impact our system. We're already seeing some of the impacts. Falk, Northern California, which services most of the Bay Area, has laid off 300 of their employees, or has noticed to lay off 300 of their employees in their interfacility transfer business because there's no patient volume to sustain them right now. In a conference call I had last night with several of my colleagues statewide, we're seeing the same impacts in different areas of the state, especially amongst smaller providers. And I think Mr. Culberson touched on that today with the loss of our wheelchair vehicles just to take people home, that they're pulling out of the system, and it can impact services overall. There's very little that we can do directly, but one of the actions we did take is we are, as an EMS agency, waiving all of the incurred fines and penalties for response time compliance for emergency ambulance providers at least through April, and we're going to revisit that. We did that with the understanding that the cost savings that would be realized by those agencies would go into maintaining their staffing as long as possible. And that's the agreement that we have with those agencies, is to maintain their contractual contracted staffing levels. So with that, if I could just go into just a couple of more items. That's all for the PowerPoint. Since the beginning of the emergency, the EMS agency, in order to operationalize all of these functions, we've doubled the size of our staff. I went from a staff of 11 to a staff of 23 with the assistants, and I want to give them a thank you to the Departments of Probation, Public Works, HSA, and a shout out to Dennis Bitters at Rip and Fire for letting me have one of his battalion chiefs as a safety officer. When we set up a logistics base, I meant we actually set up a logistics base with trucks that make deliveries, pick up deliveries, and run forklifts. And the one person that I wanted to have on staff was a qualified safety officer to make sure everybody could stay safe at our workplace. And Dennis helped me able to do that. Lastly, a couple of items that have come up that I want to make sure we address. One is the standard of care. There has been discussions early on, questions that have come to us from both physicians and paramedics and others about limiting some of our aggressive medical procedures and interactions on patients. Dr. Schaefer and I have discussed this at length, and we are both in agreement that we are not going to deviate from the standard of care. If a patient has a heart attack and collapses at home, we are going to aggressively treat that patient no matter what. We think that those patients deserve that. But we've had a lot of people asking whether or not we would deviate from that because they were concerned about their own risk of exposure. We believe that if people follow proper procedures, use their personal protective equipment, that the risk of exposure is extremely limited, and we want to give patients the best opportunity for survival that we possibly can. Some future actions that we're working on for planning. We're in discussions on how to create a low acuity alternate transport system, whether that's at a hospital or otherwise, to take patients who are not COVID symptomatic and who do not require high-level acute services, and make sure that we can safely transport them someplace that can get their medical needs met without actually having to go into the hot zone of an emergency department if we can help it as the pandemic may reach us. We're also working with public health and other partners on making sure that we can maintain a shelter in place for our long-term care facility patients. So patients aren't unnecessarily transported to an emergency department for things that they can stay and be treated at their own long-term care facility with. And then we're also working on other advanced directives. But that's my report for today, and I'm available to answer any questions that you may have.
Thank you. Any questions? Supervisor Elliott.
Thank you. Now, the alternate care sites that you mentioned earlier, did I understand that correctly, that the lower level of criticality of patients would be sent there?
So the Region 4 alternate care site that's being set up at the Stockton Arena would not take patients directly from the field. They would be a place to send COVID positive patients that don't require the acute care higher level hospitalization at a hospital, and be able to take those patients that could be managed at a lower acuity alternate care site. But the state's plans right now is that particular location would only be for COVID positive patients.
Okay, so
that was Sleep Train Arena, correct?
Right, you Arco, not Stockton. Okay.
Okay,
To make sure. Thank you.
Sorry, I apologize. Old names come back to life.
Everybody watching and listening can calm down. It's not the Stockton Arena.
It's the Sleep Train Arena in Sacramento. I apologize if I misspoke.
Okay, another question concerned the ag industry. It's come to my attention that they're having a real problem coming up with masks for farm workers, packers, dealership that deals with the agriculture industry to be able to protect those workers as well. Have we had any contact with them or outreach from them or to them through the Farm Bureau or through our agriculture commissioner to try to combat that problem?
I'll have to defer that particular question to our Office of Emergency Services. That's really not part of the purview of the medical health mutual aid system that I would be involved in. I do know in discussions, and I've heard from a lot of people, and they've shared that same concern with me, and we've referred them back to the Office of Emergency Services for those questions. Anyone who needs personal protective equipment that can't otherwise obtain it, if they're not part of the medical health mutual aid system, needs to be reaching out to the Office of Emergency Services with those questions.
Thank you.
Supervisor Wynn.
Thank you, Madam Chair. We've heard in regards, as Supervisor Elliott talked about, the lack of personal protective equipment, especially in some of our hospitals, et cetera. And looking at the numbers in your presentation, I mean, it appears that we have a lot of protective equipment available for medical use. How are we doing in regards to replenishing those supplies as this pandemic continues?
So one of the actions that we took as a county about 2 weeks ago is we went ahead and put our own purchase order in through the requisition process just to buy supplies to replenish our own cache of stock for the departments that are within healthcare services, including EMS, that would be able to forward deploy that out for needs. The state really has taken this mission on to try to find the PPE and then make it available either directly to hospitals through cost sharing or arrangements, or otherwise through the medical mutual aid system. So we're continuing to do that. I just on email earlier, we're getting notices of new supplies coming in all the time. What's currently happening is we're trying to work with the hospitals. The initial guidance we were given is not to allow anybody to have more than a 2-week supply of supplies. So we have a formula for burn rates on their usage of PPE that all the hospitals and other providers would have to submit, so we could calculate what a 2-week supply was. And then the state asked us to cap, not to provide more than a 2-week supply to any particular facility. And we're still trying to manage according to those guidelines as best that we can. But we also are trying to get guidance out there. For example, a lot of the requests that we got in, everybody wants a medium N95 respirator. And that covers about 70% of the people. But we also know that of that 70%, there's a percentage that can wear a large N95 mask and a small N95 mask. And we've actually asked healthcare facilities to start refit testing their employees, because we actually have large and small that nobody wants because they got everybody measured as a medium. So if we can maximize how we can utilize that personal protective equipment, we can actually make more of it available.
Okay, so are you comfortable that based upon what we have and what you anticipate being supplied in the future, that we're in pretty good shape in regards to adequately maintaining our level of equipment as needed?
In our discussions with the hospitals, and that's been our priority focus is the hospitals. They all have reported, I mean, there's a few things, goggles and masks were hard to come by in the early days. When it comes to the N95 respirators, everybody has the supply that they need for their current burn rates. The concern, and David Culberson and I had this conversation last week, the concern is as patients increase, those burn rates also increase. And I cannot guarantee that we'll be able to keep up with the demand. So one of the things that we are working on with our healthcare community is being able to issue guidance on strategies as recommended by the Centers for Disease Control on how to conserve PPE as supplies diminish. I had one hospital report that all of the filters, so we also have, a lot of the hospitals have air purifying respirators that they wear, especially when dealing with a known COVID positive patient or for healthcare workers who cannot properly fit test on an N95 mask. Those filters and the batteries that come with them are hard to come by. And some hospital, at least one hospital has reported that some of their filter stock was stolen and taken away from them. Those are supplies that aren't even available within the state cash for us right now to even replenish. And the backlog from 3M for that is, as you can imagine, fairly long.
Okay, you had talked about the ventilators and the capacity, but the lack of staffing for some of this equipment. I know the governor's working on this program for recruitment of retired medical health professionals, et cetera, and I know that, for example, I know New York has a number like 85,000 volunteers that are willing to go to New York to help them with their crisis. So that's one aspect of it, the staffing part, and I guess, are we working independently of the state, or are we working in cooperation with the state in regards to getting the number of individuals to staff these particular types of equipment beds?
We would work directly with the state to bring in additional resources. The state essentially, we had an existing disaster healthcare volunteer system in the state of California. Actually, it's a national system. That's really been replaced by the Health Corps mission that the governor has stood up at a state level. And I believe the last report, there's over 70,000 licensed healthcare professionals, I think, that had registered for that. If a facility wanted to have access to those personnel, they could put a resource request into our agency. We would work through Region 4 in the state of California to fill those requests based with the volunteers that are currently available. In our discussions currently with the hospitals, what they're seeing right now is it's kind of a calm before the storm. A lot of the hospitals are actually furloughing or laying off employees because there's no volume in them right now. And so to save capital, they don't need employees. So the question is, can we ramp back up when and if the patient surge does arrive in the county and have enough staffing? The hospital systems that we've talked to all have plans for how to expand their own staff with their own employees and bring people in from non-essential services to cover direct patient care. I think those will be the plans that they'll want to utilize first before they look to volunteers to come in and assist with their hospitals. There's at least one hospital in the county that we're working with that we've put into contact directly with the state to talk to the state directly about some of their opportunities for partnership and sharing of staff. Those discussions are ongoing, and if that comes to fruition, I think we can even expand additional space at our hospitals here locally.
So what you're saying is Plan 1 is locally, and then Plan 2 is the state, as far as filling these vacancies with staff.
Yes, sir.
The other interesting, I think the governor sent, was it 500 ventilators out of state to other states that had a much higher rate in a crisis. So my question is, that's fine, and I appreciate his efforts, but how are we in regards, I saw the numbers, are we in pretty good shape in regards to ventilators for a potential surge?
I think that's probably our best indicator right now, is that we do have quite a few ventilators that are not in use and are currently available. And I know all the hospitals are working to bring back to life some of their their equipment that they may have been outdated and in their biomed departments may not have wanted to maintain because they weren't necessary. So I think all the hospitals are working diligently to bring as many of those online as they possibly can. I think we're going to be okay for the moment, obviously, for ventilator use. But until we know exactly how many intensive care patients that we're actually going to have, it's hard for us to predict whether or not we're going to have enough ventilators. But I think we're in very good position right now as we stand, much better than a lot of systems.
I assume, obviously, you're working with Dr. Park and OES, et cetera, but somewhere along the way, and maybe in this presentation today, that there is maybe a revision in regards to when, we expect the surge or the apex to hit, because we were last meeting, it was May 11th. I know that's been revised, but I think I'm sure all the supervisors had similar questions or contacts. Is the public really wants to know? Okay, so when's this going to hit? And I know that this is a very imperfect science as far as it almost changes daily, but they want to know, as far as their lives. And as Supervisor Patty talked about, the disruptions, obviously, of losing jobs, et cetera. And for business owners, to anticipate, whether they can sustain maybe a skeleton workforce to get through this and then immediately ramp up when we get the green light. And I guess that's one of the things that I think has been frustrating for a lot of people is they don't have the information to make plans, albeit they know they may have to adjust them sometime in the future. But I think, certainly the information in regards to beds and ventilators and those types of things, I think are important, because without any information or numbers at all, people they wonder, what are we doing, we as a county collectively? And so I appreciate certainly that presentation. And I think, as much information as we can get out there as far as how we're planning and our expectations, and that it's okay. And I know nobody can say for sure we're good. We're going to be, fine, because, the future is unknown. But I think as long as we continue to have these meetings and certainly presentations like yours and Dr. Park, et cetera, I think the public watching this, or certainly will report on this, is helpful, because they feel like it's under control as best as we can do that. So I appreciate certainly some of the information you provided here this afternoon now.
Thank you, sir.
Thank you, Supervisor Patty.
Thank you, Madam Chair. A couple quick questions for you. You had mentioned in one of your slides that you've got some testing for first responders. And do I understand correctly that you guys are working that out, the process out, and the availability? Can you kind of give me a little more information? I've had 2 agencies contact me about what's available for testing for them.
Thank you, Supervisor Patty, for that question. My office actually is working on a policy memorandum to send out to all the first responder agencies this morning. I'm not sure if it has gone out yet. That would give the contact information for Dr. Fadu in the clinics so they could reach out for them. So one of the problems that we've had with testing is just the lack of, not just in San Joaquin, but nationally. So I think, and there's others who can talk about the Verily project that we're standing up for community-based testing, which will rely on commercial laboratories for processing. The good news is that San Joaquin General Hospital's internal lab now is going to be able to stand up their processing, and we have the public health lab here. So for patients that would go through the occupational health clinic that are healthcare workers, because one of the things we want to do is keep healthcare workers on the job. Whether you're a pre-hospital healthcare worker, or whether you're a hospital healthcare worker, or whether you're a long-term care facility healthcare worker, we want to keep you safe and able to do your job and care for patients. Part of the way we do that is having true occupational medicine physicians who can assist those individuals with screening for potential exposures, potential signs and symptoms of COVID, and then guide them through their course of treatment and refer them back to their primary care physicians or to hospitals as necessary. One of the keys to that is being able to test those individuals if they meet the testing guidelines. And so by having access at both San Joaquin General Hospital's lab and at the public health lab for somebody who's a healthcare worker who's truly exposed, we can expedite potentially getting those patients a test result faster. And that's why we didn't want to just create a process that created testing. We wanted to create a process that created true occupational health guidance for employees and employers to keep these people in the workforce.
So that information is sent out. You mentioned this morning that it's going out to agencies of where to go.
Since I stood up, I don't know whether or not they've actually got the memo out, but it's finalized and ready to be sent. I just don't know if it went out yet.
Okay, so the testing will be available, and their information that they're looking for, they were calling my office asking for, that's in process.
Yeah, and our goal is to have them actually contract with the occupational health clinic so they can provide a full service approach to those providers that are interested.
Excellent. Next question I have, and this may be a Dr. Park answer, I'm unsure, but how are we doing as it relates to information sharing, again, with agencies and with the public? I know that we've very carefully rolled out, and we've been very cautious based on guidelines recommended perhaps by county council in respect to HIPAA and laws and privacies and such. Other counties have been forthright and shared information, but we've now gotten to that threshold or the crest of where we feel comfortable releasing information to the public. How are we doing in comparison to the information that's being sought and versus what we are releasing?
I think it's always been the goal, it's been my goal, and I think it's been the goal of everybody in healthcare in the county to provide as much information as often and as efficiently as we possibly can. There's been some discussions internally about that, but I think I will let Mr. Diederich maybe answer that a little bit more closely. We had a healthcare leadership meeting earlier today, and I think he may have some additional information to share.
Excellent.
Thank you, Dan. Yeah, I'm glad, as you can see today, there's been a substantial amount of planning taking place within EMS, public health, and the larger healthcare services and with our hospital partners. Not all of that can immediately become public, but we are working, and as you can see today, I'm very glad that we are making a lot more of it public. We have to go through a HIPAA-compliant process, and I know there was some hiccups along that way of us being able to de-identify or get that out compliantly. I think we're in a process where we can do that, but I want to make a distinction along a continuum of data versus information versus intelligence. And we have a lot of data, and data is, individual facts. But taking data and making that into information and making that information actionable is really what we want to do. And as you know, we released a model with public health last week, and I think that is really the intelligence people needed. Where do we stand as far as the apex of the wave, when that wave is as far as it being pushed out? We're continuing to refine that model, and that's really what we've been working towards, is getting that actionable intelligence. I know some of the cities have really been clamoring for city-level detail. We are at a point where we can compliantly release that. We want to increase the cadence of that release, but we did that again on Friday in a public fashion, and then I wouldn't say it was disinformation, but some of the media took that, and now they don't really look at some of the caveats there. The city-level detail information we have is where their mail is sent. So we have numerous instances of somebody's mail might be going to Manteca. They might actually be in a long-term care facility in another location. It is also not any indication of, I saw in the media that say there's a 1 in 2,300 chance of somebody living in Lathrop acquiring the disease. This information has nothing to do where they acquired the disease. A lot of the initial people that were COVID positives were on cruise ships or were travelers, or maybe even commuted to the Bay Area. They reside here, their mailing address is here. It's kind of analogous to you could look at prevalence rates for heart disease in a certain location. Well, if that location is a retirement community, they probably have a higher prevalence rate of heart disease. But that there's no causation versus this actual statistic. One of our cautions was really we don't want to be out there and having people think, hey, we are masking the number of positives if it's in a city under a certain threshold, and you might have seen in that release that certain communities had an asterisk, meaning it's under 5. Well, under 5 could be 0, 1, 2, 3, or 4. I live in the city of Ripon, and let's say if we had unmasked that, and maybe there's 1. I'm not saying there's 1 or 0 or 4, 2 or 3 or 4. But is that a distinction? Well, somebody could say, well, I have a 1 in 16,000 chance of acquiring COVID in Ripon versus in Lathrop. That's not the message we want to get out there. There's widespread transmission throughout the community of COVID. That's the message we have to get out. And all of these extreme measures of social distancing, closing the schools, the critical infrastructure, that is all mitigating and reducing, and hopefully we will have enough staffed hospital beds, ICU beds, ventilators to be well under that apex. The model that was shared last week really was a baseline model. I know the federal government's come out with their baseline model. And they said between 100,000 and 240,000 deaths. Well, if I just did the simple math, that would be about 550 deaths in our county. I don't think we're going to be anywhere near that, but the first iteration of that model had a very high apex, and if you just ran with that model and look at the footnotes, that was the unmitigated model. The model that we put out on Friday started to basically be refed with additional inputs, and we're trying to continue to refine that rather than taking some assumptions. We're looking at local data as far as the number of individuals that are hospitalized with COVID that are in an ICU bed or in on a vent, as well as their average length of stay, to really look at and continue with iterations, refine that model to make sure that we are actually going to, as the supervisor are asking, reassure the public that indeed we have the capacity for when that wave comes. So I know I have some other comments, but I think that hopefully addresses some of the data that we're looking at. And it's really going from a high volume of data to information and actionable information. And a good analogy in a healthcare space is each patient has a height and a weight. Well, that's data. It's irrefutable. It's fact. But you can basically take that and make that an information because you can make a calculation for the body mass index. Well, that will then further inform a clinical decision. And all this information, what we're wanting to do is make guidance for clinical decisions. So with the BMI, a physician can basically, are they eligible for this surgery? What's their course of treatment? That's really where we need to get to. And that is the intelligence we want to acquire and then be able to share compliantly.
Thank you. And what was the 12th thing you said?
I haven't even gone through half my page. So.
A lot of information. I appreciate that. Some of the things that have been asked and have come to me to ask is if we can identify where hot spots are. So I'm not sure. Again, we're looking at demographics and location is what is being asked for. And I know we as a board have talked about, and the governor, when he did a press conference last week, he shared that when his medical director got up, they said the number one most important thing is share the information. When you listen to Dr. Fauci, you listen to the governors and people that are getting mass exposure, they're all talking about share the information. So I want to make sure that if it's being asked of us, we are providing it. I think we're well past that 100-person threshold that was initially talked about as being that the trigger of when we'd start sharing more information. So let's not keep things too close to our vest. Let's share with the communities and with our first responders the information they're looking for.
And I think we're at a point where we can do that. I mentioned with HIPAA laws, there's two ways to de-identify. One of those is to strip demographics. The first one's the name. The second one is a geographic, smaller than a state. So that path is out. The other way is the way we went with our epidemiology team and making sure that the way we're releasing information cannot be re-identified, and that is indeed why we're masking. But it's also going to beg the question, we released the city level data. We released some demographics, male, female, and age categories. Are people going to push back? I know we have a couple small cities. Escalon, I think, is about 7,000 people. Mountain House Unincorporated, more than twice that size. Are people going to be clamoring for information about Mountain House? Are they going to be clamoring for then some of the racial demographics? Mountain House, I understand, is about 43% Asian American. Are they going to start asking for that information? I don't know if that information is really going to be proper guidance or not, but I have some concerns that if we get to that level and that they want more and more detail, is it really going to inform clinical medical decisions, or is it going to be conflated into something else? Because let's say there's a hot spot in Mountain House, not that I'm saying there is, but let's say that was released, and then people backtrack and say, well, 43% are Asian Americans, therefore, not to be curt here, is it a Chinese pandemic? That's what I want to avoid.
I think those assumptions are ridiculous. We're all Americans. We're all living in the state. We're all living in a county. Nobody's going to deduct and make it a prejudicial deduction and conclusion that there's a person or a type that's spreading it. We know that this is indiscriminate, and it's going anywhere and randomly to whether it be children, middle age, or seniors. So let's not.
I apologize for that. I'm just saying it's going to. There's going to be more demand for information.
I would say, as has been suggested by the governor's medical director, share the information.
And we're working towards that, and I'll work with the health officer to start doing that on hopefully a daily cadence.
Excellent. Thank you.
Supervisor Villapudua?
Glad to be of service.
Thank you. I have just a couple questions. We keep hearing from healthcare workers that they're being told to reuse supplies, they're rationing gloves, they aren't able to use maybe a higher level mask that they've personally provided. It's difficult for us to answer any of those concerns or questions because we're not the experts and we're not managing the system. But the general consensus seems to be healthcare workers have a perception that there is not enough supply. There are not enough. And so they are being asked to compromise their own safety and the safety of their patients in an effort to conserve. But then we hear from you that as of right now, we do have the supply. So I want to get a more definitive answer for our healthcare workforce in terms of what they're being told, which guidance they should be following, and why is this guidance, what's the ultimate goal? Are we conserving now because we are, wanting to keep a 2-week stockpile, or is the plan to continually restock so that we are following the same recommendations?
That's an excellent question. I'll deal with it in maybe a little high-level overview, and then I think Mr. Culver's can talk about some of the items that he's specifically doing as a hospital administrator on this subject. We have issued guidance. Our first guidance is that everybody should use their proper level of PPE for the patient that they are caring for. And that has always been our medical direction to both the pre-hospital and our recommendations to the hospitals. With that, because there has been a rush on personal protective equipment, and we know the supply chain has been disrupted, using the recommendations for the Centers for Disease Control, we have issued those recommendations from CDC to the pre-hospital, and I know the hospitals are receiving the exact same recommendations from the state on how to conserve and properly use PPE and strategies to take if there is a reduction in the availability of PPE. At this time, I don't believe that any of our 7 acute care hospitals lacks the PPE to safely treat patients. I honestly believe that they all have the PPE that they need, either from their own systems or what the medical health mutual aid system has been able to provide to them. But with that, David, maybe you want to speak directly to how you're managing that within the hospital?
Chair Miller, we take a look at the supplies of PPE twice a day, first thing in the morning and then later on in the afternoon. It's updated. There's actually a CDC burn rate model that we started using this week. We had our own through our PeopleSoft system. One of the benefits that PeopleSoft does is daily arrivals, stock, and then daily issues. And so we're taking a look at the burn rate relative to our supplies. And Dan's correct. As of right now, we're in great shape in general. Now, there are some things like, for example, I was looking at here just a minute ago here, you probably have seen healthcare workers in the blue Buffont hats kind of the blue bouffant hats that are typically worn in surgery, as well as shoe covers. And as of yesterday evening, we look like we had maybe a 3 or 4 day supply. We're anticipating a big delivery today of both of those items. Last week, 2 weeks ago, we had a shortage of the isolation gowns, yellow gowns that you would wear into either a COVID positive room or a person under investigation, a PUI room, and we were down to a very, very small supply of those. But we got a big delivery last week. So clearly up and down. One of the things we're seeing is that the vendors, and Dan, Mr. Birch mentioned this, if the vendors believe they've given you either an adequate supply or enough to get you through a few days, they're going to redirect delivery of an incoming supply to someone else that's very short. So that is one of the concerns we do have. There is one of the things that we don't want to get to, but we will be able to here if necessary at our hospital is, I mentioned to you last week that we received donation of 2 of the ultraviolet processing units here. The CDC has come out with some guidelines. There was a call this morning with California Department of Healthcare Services talking about actually reuse of and re-sterilization using either a sterilization method in the sterilizers, steam sterilizers, or in the ultraviolet method here. So that's something that we want to roll out, but we are planning in the event that we need to do that. We do have that resource available. So that would be something maybe several weeks from now in the event the supply chain still isn't delivering all of the items. I think one of the things we're seeing, quite honestly, is behavior now. And again, I sent a letter out to all my employees on Friday afternoon saying currently we do have an adequate supply of N95s, but I think there's this concern that, well, that's now, but what about the future? We keep hearing of the curve not bending, so we better be careful. One of the things we have to keep in mind is, and we saw this, we talk about this, if you are issued an N95, and you want to wear that all day long, and if that N95 mask becomes contaminated, then you potentially, and your mask, become a vector and could possibly be transferring it throughout other patients. And that's something that basic infection control practices we don't want to do. So we're doing an awful lot of communication to staff, and really trying to identify, I owe Mr. Schaefer a call or an email this afternoon just to find out what specifics is he seeing. We talked to the NICU staff earlier, late last week, early this week. I'm well aware of their concerns, but it's something that we're monitoring very, very closely.
Okay, thank you. And then the other question I have is your statement that all of the facilities are supposed to first exhaust their own supply chain before they come to you or the state or anyone else. But what we keep hearing is that it's a free-for-all and everybody's bidding against one another. Nobody can actually lock anything down. So is that being overblown? And is there still the ability to utilize your own supply chain and get the needed PPEs that healthcare facilities and long-term care facilities need? Or is this just to check the box and then they're all going to come to you eventually anyways?
I hate to say this, but it's both, right? Both things can be true. We need everybody, the hospitals are in better position. They have professional procurement departments. The county has a great purchasing department. They know how to look for multiple sources to obtain supplies, and they're doing that. The people that are struggling are the smaller providers who may have only been using one vendor and they don't know how to find a second one or a third one or a fourth one. And the distributor they may have been using may not have been that large and may not be able to actually get the orders that they need from the manufacturers. So what's one of the things I really hope the state, and I have a conference call later with some of my colleagues and Director Duncan from the State EMS Authority this week, and we want to make sure we bring this to his attention because he's working directly and advising Secretary Galley and the governor on these issues, is if the state could make their vetted procurement list available to the counties, that would assist all of us in being able to provide guidance for people to adequately use the commercial supply chain. And so if that's something that the board members collectively or individually can help share that message with the state, that would be a huge benefit to the counties. If the list that they've stood up with vendors that they have vetted that are available to the state, if they could make that available to the counties, that would be a huge benefit to us. And hopefully that's something that can occur.
Dan, can you also comment on your customer care line and how EMS is helping out long-term care facilities enter their mutual aid requests?
Sure. So one of the things when we set up it was a very frustrating and challenging process to set up our logistics base. Our first priority was getting the supplies that we needed to the frontline healthcare workers, which was the hospitals initially. And then we expanded from there. The long-term care facilities that we normally had worked with and had partnerships with and had been part of our healthcare coalition through our emergency preparedness grant knew and understood and had training for this event. And they didn't require a lot of guidance in order to fit into the process. What we discovered is the vast majority of those agencies never participated in any of our drills or trainings or planning projects. So we basically created a customer care line that can walk those facilities over the phone, and we'll actually do the entry for them on computers in our office so they can get their orders processed through the medical mutual aid system to assist them, because there is a level of sophistication that's required to navigate the emergency procedures that we have in place, and we're trying to be as customer forward as we can with that.
That's good to hear. I know we've, in the past, we've provided this type of assistance to other counties that have experienced wildfires and other natural disasters, because we do have a level of expertise here in this county. So it's good to know that we're also applying that to some of the smaller folks here in our own county.
And if I could, I mentioned some of the departments that have enhanced our staffing, is what I call the extra people I have, is enhanced, because they really have enhanced our operations. But I would like to thank Mr. Cruz and his staff at ISD. They've done a phenomenal job of, in a very short period of time, of helping us expand the IT services that are necessary to maintain this logistics base and be able to bring all of that additional staff into our office and make them as efficient and as productive as they are. Can't think highly enough of him and his staff and the other departments that are assisting us in this process.
Great, thank you. Mr. Dietrich, I have a quick question for you before you two step down. We heard a lot of public comments, and I get a lot of information as well about concerns with behavioral health services. Staffing, where are they going to be? How are they going to continue to provide services? There's an increased need. Can you give us a little bit of an overview on what's happening with BHS and those HR issues? I'm going to ask our HR director to weigh in as well.
And I think that those two, there are some of the HR issues, because I know there is reduced demand. Preparation for the surge. Dan mentioned ISD. We also have Don Johnston, our CIO. We did a lot of preparation in both our behavioral health and public health IT data centers to basically do the prep work to have a lot of people working from home. We have at least 200 plus people working from home now. But it kind of comes down to, we've had a reduction in demand. So specifically on the youth side, a lot of the youth will not do telemedicine visits they want to do in face. We've had some diminishment of our workforce capacity because of people calling in or needing to be off because of child care issues with schools being closed. I know we are working to be flexible as best we can with staff, especially the essential healthcare workers. I did make sure that our BHS director and our HR leadership over there were aware of the comments that were made this morning, because indeed there is some additional flexibilities we'd like to get there. However, we are facing a substantially reduced demand. But as Dan mentioned, we're all essential workers, and even though I might not be doing face-to-face services with behavioral health consumers, we will have demands within EMS, eventually, hopefully there'll be some updates on Emergency Services Function 6, which is hotel and shelter, because we're going to have to provide services there for food delivery and also probably doing behavioral assessments there. So there'll be some alternative uses for our staff, but indeed, we've had some reductions in demand. We have a lot additional psychiatrists working from home. But when I mentioned we had over 200 people able to work from home, that leads to a little bit of concerns about security. Are these endpoints at their home as secure as the endpoints we have at work, as well as just the bandwidth? So it's one thing to be remote and be doing office type work. It's something else when in that same bandwidth pipe, I'm doing telemedicine. So I have only so much capacity. I know Johnson is working with ISD to expand the capacity of that pipe over BHS, but we'll probably never be in a position where all of our people could be working from home, just pragmatically as far as technology as well as the service delivery demand.
Great, thank you. Supervisor Wynn?
Along those lines, just a question in regards to volunteers, because other communities have, or even states, have asked for psychiatrists, psychologists who have their own practice to volunteer their time to help with some of the demand, I guess. And obviously these are in places that have a much higher propensity for patients and deaths and those types of things. But there's the other thing that they start talking about, especially since we're getting so many individuals laid off or fired or whatever, is, as we talked about earlier at the beginning of our session, in regards to domestic violence and those types of things. Do we have any idea? Because I think in New York they had almost 9,000 healthcare psychiatrists who volunteered their time. It was telephonic. It wasn't obviously, meeting. I think they may evolve to that. But my question is, have we reached out to the mental health community to see if there'd be those willing to supplement in the event that we have an overflow or an excess for our own behavioral health department to provide some assistance?
I don't think specifically for psychiatrists or behavioralists. I know Dan could probably talk a little bit more on the medical side. Retired doctors, retired nurses, or other paraprofessionals, or people that at the end of their training, pre-licensure. But in behavioral health, I think we're meeting the demand that is presenting right now, and it's a reduced demand. But it also comes down to just technology. We like to do things telephonically, and I mightn't have to get to this situation where they might be at home, and rather coming back through our data center, it's over the internet. But as I also heard, the internet's rather congested with people watching Netflix, if you were right now. So it might end up having to be over the phone. And a lot of these are probably services that we should be offering and are offering, ultimately might not be billable. But I know we've fielded several queries from the Office of Ed, and we're working to partner there because indeed the children that are off of school, are they facing traumas that we can get out in front of such that it doesn't decompensate into something more severe?
Well, I think one of the things that this crisis has shown us is throughout the country, probably throughout the world, there's been a lot who have volunteered their expertise, their experience, and I guess sometimes, maybe you have to ask the question of those who would be available and maybe would really like to step up and help, but nobody's, asked them. And I guess it seems to me that we would offer those possibilities for those who are kind of waiting in the wings, just asking for an invitation to participate.
And there's a structure for healthcare volunteers, and maybe Dan could speak a little bit more. We've used those more in the regional setting, like going to Katrina or the Butte fires, but there is a process that has some indemnification and some sign up. So I know, is the Healthcare Coalition, is that?
Well, right now the governor is requesting that everybody who wants to volunteer their services register with the Health Corps site that they have stood up. The way the medical mutual aid system would work is if a healthcare provider in our county needed assistance, they would reach out to us And then we could arrange for staffing, either volunteer or otherwise, if it's available, to be deployed to their particular, for their need. And that's really the way the process is designed. To stand up our own volunteer system outside of that process, it just becomes very time consuming for those of us on the ground that would have to actually implement it. So it actually makes our jobs harder in many ways. I understand that people really want to volunteer and serve right now. The best thing that they could do for our local community and for the state is to register with the Health Corps site if they're available to volunteer, and let the system utilize their expertise where it's needed the most.
Good, thank you. I don't know which one, or maybe it's not either one of you, but who's putting out the statistics, the graphs, the charts, the numbers? I know public health, I understand that, but you've provided us with the information. So is this information that's been disseminated on a daily basis, is this coming from the information group, or is this from you? Or, I mean, how are we assembling this information that we provide to either us or the public?
On the healthcare and the medical side, there's really two tracks. Our office is providing information on a daily basis through the Emergency Operations Center daily briefings on current status at the hospitals and our medical system. Public Health and Dr. Park are providing the guidance on the number of cases in the community, and the projection models that she has available for release. So it's really a two-track approach. We try to coordinate internally as best we can to make sure that we have a coordinated message, but it really is two separate sources of information.
And if I could add to that, a lot of it is being fed into OES, and we have a joint information center right now, and that's really a large part of how the information is redistributed. I know we've taken some concerns about lack of timely information or enough information, as well as we had a leadership amongst our healthcare services leadership this morning before the board meeting, and we're talking amongst ourselves and really wanting to work with OES, but also understanding that it's a countywide issue, but it's also primarily a healthcare issue, and the communicable disease and some of those available to exercise authorities under the health officer. And to a degree, there might be a perception of a leadership vacuum, and we basically made a determination that we want to have our health officer basically be the front and center and be the leading as part of the county and OES as in the wider county, and be the face of this. And she mentioned we're doing some more of the social media and some videos, but I really want to increase the cadence and really be supportive of the health officer, and have the health officer really be, I guess, analogous to the incident commander in an ICS type process. Obviously, OES has a role there, but I think we need to, myself, other leadership within healthcare services, but also primarily the health officer, really use this as a bully pulpit, because I know there's other areas that we need to stand up and other emergency services functions within the county, and how do we support that, and how do we push them along to get some things implemented a little bit earlier. But I really want to have, I know I talked to some supervisors in the past few days about who's leading this, and I kind of demurred in that conversation, but I think at this point I really want to promote that the health officer needs to lead this effort, and I'm going to do everything for the agency to support her in that, and hopefully change the perception that there's not true leadership being assigned to this.
I understand that. I guess, and maybe dealing with the incident command system for a number of years, I'm sure the sheriff has had the same experience. I appreciate Dr. Park, and I certainly appreciate, her expertise and her decisions. However, we're not talking about a fire, or a short-term event. We're talking about a long-term. And I guess because you have Officer of Emergency Services, you have EMS, you have Public Health, you have Public Works, you have a whole bunch of agencies participating in this. It just seems like sometimes it is better, because Dr. Park has a tremendous load on her shoulders, and to coordinate with all these departments, I don't know if it's happening or not happening, but I think sometimes it's better to have one person who maybe not have the technical expertise that all of you have in this, but kind of a repository. I know back in the atmospheric rivers or storms that we had back in 2017, that was when the chair, which I was, became the director of this. I know that was overwhelming to some extent, trying to do your regular supervisor job, chair job, and that. However, the one thing that I did experience, which I appreciated, was with our EOC and all the agencies, it was informational in regards to everybody, not only the state, but certainly the county and the cities, to come together. And through Michael, I got a lot of questions, et cetera. But my point is, in this particular situation, it seems like there should be one person that is kind of the person that people understand is in charge, and they can go to that person who can then lead them to somebody else. Because when you talk about director to director, I mean, I know our departments work very collaboratively with each other, but sometimes there needs to be, I guess for lack of a better term, one boss that ultimately has authority, whether it be from the CA's office or the Board of Supervisors. It doesn't matter to me, but it would seem that would be a more of an overseer, facilitator. You know, some people use for that the term czar, but the reality is it is a person who each one of us, for example, could go to, or the CEO or whoever. So again, I understand and I appreciate that, but I just sometimes think that there needs to be a visible head of that, and Dr. Park does a great job, but there's so many other departments that are engaged simultaneously.
Correct, and I think it is maybe a little bit far when I say an incident commander, but we need a leader, and really a leader is somebody that speaks, and when people listen to them, it inspires confidence, and they have a gravitas in the message. That's really where I mentioned a bully pulpit, us communicating more broadly to the community about why we're doing these efforts, and to reassure the community that we're going to get through this. That's really what I'm meaning, not so much that they're going to be the incident commander and in charge of all of the operations. That's really going to fall to the rest of the county and the staff to really coordinate amongst ourselves, but I really need, to a degree, a face, a physician face, because this is a health pandemic, and really having inspiring confidence that indeed what the county is doing collectively is working, and that she can calm fears and indeed be more public in her presentations.
Well, I would agree with that, but I would say that the President of the United States doesn't have any health background, but I see him every day. I see Governor Cuomo every morning, and he doesn't have any health background, but he is the visible representative of both the state or the nation. And I guess my point is this person doesn't have to have certainly the expertise, and nobody can have the expertise of all your different departments, but at least they have the ability to oversee and to coordinate, and for whether it be Mr. Birch or Ms. Lima or whatever, or Ms. Cunningham, they can go to that person and say, you know, this is the problem, come together, and then somebody makes a decision, because it's hard to make decisions for another department when you're not in charge, and that becomes problematic. So again, just an observation. I appreciate what you all do, but sometimes there needs to be somebody who kind of oversees the entire operation. So just a comment. So anyway, but the other question is, I've looked at a variety of counties, and they have a lot of information, and I don't know, maybe we're rolling it out, or maybe I missed it. But for example, it's statistics, hospitalizations, the medical, numbers that you provided, and then testing, and those seem to be really critical for the people to know how many tests have been made, how many positive, how many negative, how can they be acquired, how can I get one? And I know that information's out, but again, I think we talked about, as Supervisor Patty talks about, and as governor's press conferences, information is invaluable in these situations, and I think I appreciate that we're ramping it up, because there's kind of been a lag, which I think is helpful for the community to become more confident that you all know what you're doing, and we're gonna get through this. So.
And I appreciate the word. Oh, sorry.
No, I was going to say one last comment. We lose sight, and maybe this is part of the messaging. The people who have the most control over the situation are us as individuals. We're the ones that can stay at home. We're the ones that can protect ourselves. We're the ones that can do anything. And I'm sure all of you get emails from people who complain about the stay-at-home policy and this and that, and they believe that we've infringed upon their constitutional rights, et cetera. I get it. However, I think, to be cavalier, so to speak, and go out there and say, I can do what I want to and I don't have to abide by your rules. If that person becomes infected, then they affect a lot of people along the way. And that's the sad part of it, because if you ignore what everybody, all of you, the experts, are trying to communicate and say, I don't believe you, I'm going to do my thing, and then you go out and get sick, a lot of people will be affected, even those, especially the first responders, and then, our first line health professionals. They're going to have to contact that individual who's been diagnosed with COVID-19. That's not fair, and I think we people, residents, need to take personal responsibility, because we control that curve. If we do what we're supposed to do and protect ourselves individually, then the whole community benefits.
If I may, I agree with you on sharing as much information as we possibly can, and I'd like to see us improve our efforts with that. And ultimately, I'd like everybody to basically say this is all about nothing, because if that's the case, it means all of our mitigation worked, and people staying home prevented a pandemic. I mean, ultimately, if we succeed, nothing happens, and that's the ultimate goal. And you're absolutely right, Supervisor Nguyen, this is an individual responsibility that everybody themselves can control, and we're trying to get that message out. I'd like to expand our efforts to get that message out as best we can, and I appreciate the support of the board to do that.
And I agree with Dan Birch. We need to get more information out, and I like to use the term information rather than data. And hopefully, we will be having a third iteration of the Bayesian model that's going to be a bit more fine-tuned and hopefully more relevant of where we're actually at in the county with our own data, and hopefully bring that back next Tuesday to you. And my goal and my desire is really that we're going to be much under the capacity of our healthcare delivery network. And as Dan mentioned, hopefully we come out of this with a lot less morbidity and mortality because of some of the extreme measures.
Thank you.
Yeah, and I would say that I appreciate that we're on a dual track, but we do need to, for the public, we need to have a place where we can all direct them, whether that's public health, doesn't matter, but this information about here's our capacity on the hospitals, here's our capacity for the ICU beds, here's our capacity on ventilators, here's what we're currently projecting. That all needs to be in one place so the public can get to it in the most it needs to just be digestible for people. And we all need to know, where do we point people? If they say to us, I'm looking for this information, I can't find it, we need to be able to be very confident and say, you need to visit San Joaquin Public Health. That's where you need to go, and there will be a banner there that says COVID-19, or wherever it is, we need to be very clear so that the public can find it in one place. And we do appreciate what everyone is doing, and I know that it's. I read somewhere they said if we do our jobs well, then people will say we overreacted. If we do our jobs well. And if we don't, people are going to say, you didn't prepare. You didn't prepare us and you dropped the ball, and now we're a mess. So that's my goal, is for people to say, we overreacted here in San Joaquin County, and we don't see that tremendous spike that they're seeing in New York and New Orleans and a whole bunch of other cities all across the country. So. Okay, are there any other questions for Mr. Diedrich or Mr. Birch? Okay, then thank you. Then I want to call up, and I'm not sure if it's going to be Adam Cheshire or it's going to be Chris Woods, but just very briefly on this Project Room Key, I think we should get an update on where we're at and how that's looking for everybody.
Good afternoon. Thank you. So just a brief update on Project Room Key. There is a very strong working draft of a lease agreement that was shared with a select few folks. Want to cite and thank County Council staff for their essential assistance in getting that ready to go. So I know that some of those conversations are ongoing. Assistant Director of General Services David Tolliver is taking the lead on those. I'm not fully up to speed on all of those. Mr. Tolliver's not here today, but certainly I'm sure is happy to answer any questions offline. There will be a tour of the facility that we are contemplating for this agreement later today. Director of HSA, Chris Woods, will be there. And so the hope is that once that's happened, there'll be a positive inspection, and we'll be able to move forward relatively quickly, assuming some of these other details will be worked out. We have a pretty strong budget in place. There are still some big key aspects to be determined, such as, for example, staffing for the medical monitoring. Those things are being worked on right now. They are going, I think, as quickly as can be reasonably considered, considering the incredible scope and complexity of this effort and sort of frankly, the risk that it does represent for the county and a large number of other folks that are involved, including the cities and CBOs. And, there's so many different folks tangentially involved in this project, and it is huge. It's sort of mind-boggling in terms of what we're getting into here, but also, again, the sense of urgency couldn't be clearer. Additionally, I want to mention this will be related to Project Room Key and hopefully will be resolved relatively soon. Again, the director of HSA, Woods, was able to provide me with a copy of a request for funding that was provided or created, shall we say, by one of his colleagues in another county that I am adapting right now to use for our own request from San Joaquin County to ask for this $50 million set aside that was made available by the state through SB 89. So again, working through that, trying to get that done as quickly as possible, because we understand that these are not formula funds. These are funds that are being provided based on request, and so the sooner we can get that request in, the better. So I am right now, contemplating what the ask is going to be and how strong I can make that and how clear I can make the idea that we have obligated the funds that we have available to us right now, and based on the budget that we're modeling, it's pretty unlikely that we're going to have all of the funds we need available through just that one source, and so seeking that additional source is going to be essential. So with that brief update, I'm happy to answer any questions.
So about how many people are we talking about housing, or we will have the capacity to house?
My understanding is the facility that we are examining right now has the availability for up to 140 units. It is not necessarily that we will be, initiating all 140 of those units up front. We'll be engaging the owner on those units as needed.
And can you just again reiterate who will be eligible for this particular program in terms of who will we be housing?
Mm-hmm. And so what we're doing is following FEMA's guidelines, and those guidelines stating very clearly who can be served, and therefore the cost can be reimbursed for those services. It is folks who have tested positive. It's very broad, by the way, and essentially in three categories: folks who have tested positive, folks who have not tested positive but have been exposed, and folks who have not tested positive and we do not know that have been exposed, but are in a high-risk category, such as folks 55 and older, folks experiencing comorbidities, et cetera. So again, very broad, and it falls into those three categories.
Okay, great. So it's not designed to serve as a pressure valve to reduce the numbers of folks, just on a general basis, currently in existing shelters.
Correct. There are some pretty specific parameters. For example, also cited are folks that need hospitalization would not be considered eligible for this sort of a program for obvious reasons. But it is clearly elucidated in the information that we have.
Okay, great. Any other questions? Supervisor Patty.
Thank you, Madam Chair. What are we going to be paying per day, week, month? How's that working out per room?
If I may check my notes here, because I believe that we are currently, and again, this agreement has not been finalized yet, we're currently contemplating $65 per day per room.
And that's a lease for how long, what period of time?
Up to 90 days at this point.
90 days. And we have funding coming in for what percentage of that cost?
You know, I'm not sure. I couldn't tell you that.
Okay, so we have $65 a day times 150 rooms?
140 as contemplated right now.
140.
Up to.
Up to. Okay, got it. And it's a single location?
Yes.
Excellent. And did we, I know the last time we were here, we talked about the possibility of maybe doing a lease purchase. If we added some extra funding and pooled resources together, we might actually end up owning a facility for long-term utilization. Any examination and pursuit of that?
So it's an excellent question. There is an option in the lease. Again, the lease has not been finalized, so things may change. But I can tell you that, you know, based on those conversations we had last week and other conversations that are ongoing around the idea that we can do both COVID response and, let's say, permanent supportive housing for the homeless with a single facility and a single payment, that would be the ideal, and that is absolutely something that's being considered.
So in this negotiation with the property owner, have we discussed what a sale price would be, and then if we're leasing it, offset that against the sale price?
Yeah, I'm not aware of that. I don't know.
So there are terms in the agreement that speak to an appraisal of the property at the time of that discussion, but I don't believe those discussions for the purchase have occurred, and I think this is very preliminary in terms of the negotiations for the property. It's quickly developing as we speak.
Okay, I would just throw out there, and I'm not part of this negotiation for you guys, but let's say the property is worth $800,000 and we're doing $65 a day times 140 rooms. I'm just throwing out numbers randomly. Let's say we came up with $420,000 paid to that facility, and if we negotiate, that would be as utilized as a down payment for the purchase, and we kick in another $380,000 or whatever the math is, we could end up owning the facility. And again, those are very random numbers I was just throwing out. But
I like your numbers, actually. Let's go with those.
They're good numbers.
Right.
Yeah.
It'd be nice if they were true, but I'm just real.
No, and it's a discussion going on in every county throughout the state in regards to trying to transition these types of properties into ownership by counties for this effort, and we'll stay on top of that.
All right, and I know also in prior discussions, Behavioral Health Department, in some of the meetings I've had with them, they sure would love to have some rooms dedicated that they could utilize. This is well beyond what we would use them for in the immediate need. So I think we can have multiple purposes going on at a good location, and have that be as a step in a stage of process when dealing with the homeless population, those that are in need, so those that might need transitional housing. And this is a good opportunity to maybe bring some of these ideas all together jointly.
Supervisor, certainly for those of us that have been working on this issue for years and years now, the idea that it's going to go away after COVID is done, I mean, obviously, we know that we're going to continue to need that capacity going forward. Things have not changed, and in fact, it's pretty likely that they'll get worse based on the impacts of this crisis. So anything that we can do, any conversations that we can have or that this group can lead around those kinds of possibilities and, double dipping, shall we say, or sort of killing two birds with one stone, to use a phrase, those would
dipping is not a good phrase.
Sorry, we'll say killing two birds.
Not a good phrase.
That would be absolutely critical to our ability to respond going forward after this crisis is over.
And I do want to add that the state was very clear with us in the beginning that this effort was not a solution to homelessness. It was to expand isolation capacity. However, there are conversations that are revolving around purchasing property.
Excellent. Appreciate that and worth pursuing. So look forward to the conclusion of where that goes. Thank you.
Thank you. Thank you both.
Thank you.
Appreciate the update. Next, I'm going to ask either Marcia Cunningham or Shelley Lima to come up. Just to let us know if there's any updates from an OES standpoint.
This is Shelley Lima from OES. A couple of things I wanted to share. We do have a one-stop place that we'd like to let citizens know that they can go to get the information that's been shared. sjready.org is our branded site. We are working very hard to keep that information current and up to date. all the time. We have, our team ensures that that the information that they're provided is placed on that site immediately. If you note that it's missing something or a link isn't working, we have people on standby in the EOC to work on that. We have a full joint information center that's dedicated to making sure that information is current, as well as pushing out information to our local media and other social media accesses and other departments. One thing that you can do to help us, though, in reaching out to your constituents, you probably have messaging capabilities. Continue to share the information that we're trying to put out. The more people sharing good information will help us to get out the right information to those folks. We also answer all emails that come through that system as quickly as we possibly can. In some cases, it's within minutes, even if the email comes in at 10 o'clock at night. We have received a number of people that are just surprised that we even responded to their emails. If we don't know the answer, we reach out to council or to our partners at Public Health or HSA and Healthcare Services if we need those answers. The other thing that I wanted to share is I've been working with the City of Stockton and Mayor Tubbs. You've probably heard of the Verily COVID testing that is coming to Stockton. Mayor Tubbs has worked closely with the state to get this, to bring this to our community to help to increase the number of tests that we're able to do for our community. These tests will help to inform our health systems, clinicians, and individuals on patients that could be out there that may not be sick enough to go to the hospital. The information will inform us on implementing policies and how other ways that we could limit further spreading. So when Mayor Tubbs was notified that this was going to come to Stockton, he reached out to his city emergency operations center, who immediately discovered they didn't have the staff capability to handle it. So they've sent that up to our OES agency for mutual aid, and we had our members from Healthcare Services step up and into that program and just grasp it and run with it, basically. As we speak right now, they're setting up the parking lot and the area for the testing. We have approximately 30 people that will be able to work, at least that didn't have jobs or that were considered non-essential at the time, that'll be able to come back to work. We're bringing back those people, and they're setting up and learning how to use all of the printer systems from Verily. We're set to go live tomorrow morning at 8 o'clock. Testing is available through the Verily website, and the press release and notification and information on how to access that will be going out this afternoon. We wanted to make sure it was live before we sent that out. Also, we'll have the capability of conducting COVID testing for adults, approximately 200 people a day for the coming weeks, and depending on the need, we could ramp up to a little bit more than that. We're planning to be open Monday through Saturday with only one day off, and running those tests from between 8 o'clock in the morning until roughly 5 o'clock in the evening. Depending on how that is accepted or the impact of that, we'll make changes as the time is needed. One question that we get from a lot of people is the test results and how long they take. Could be a couple of days for folks to get those results, but it's all handled through the Verily company. It's not an impact to our staff who are already testing for some county employees and other patients at the healthcare clinic. So this is over and above that impact. The only impact to us is the logistics piece and setting that up. The new technologies will be coming soon, hopefully, for our private companies that are evaluating those tests and putting out the word, but that will all be done through Verily, through email or phone contact back with those patients to let them know of their results, and then provide them with information on what they should do to care for themselves and as they go forward. So I can answer any other questions that you might have.
Can you just real briefly describe what is the criteria for Verily? And so if you go online, what is it that they're looking for in terms of who should go, who should be tested, or who can be tested?
Most of the criteria, it's an algorithm that's on the site, so you would enter your information, you would log in, create a password and a user account, and answer the questions as they come up. The questions would be about your breathing, about your symptomology, and things like that. And then based on the answers to those questions, typically these are folks that might be, is that the right word, Dr. Park? I'm not the medical person. These are folks that may not be experiencing all of the symptoms, but just need to know if they may have been exposed or may have COVID and are carrying. Because if they find out that they're carrying it, they can stay home and expose themselves even better to make sure they're not spreading it. So the algorithm answers all the questions, or the person answers the questions, and the algorithm will spit out a date and time for them to come to the clinic or the testing site to be tested.
Great. So, Dr. Park, will we see another video from you? It was very well received. People loved it. They really liked watching you explain things, and so I'm wondering if we're going to get another video with you explaining this new testing that's available.
Thank you. That's a great idea. We actually have a few ideas in mind for our upcoming videos, but Shelley and I have not talked about doing a Verily video. It might be a good idea. And we're thinking about using various people to show the face of OES and public health and EMS in these videos so that people can see everyone with their boots on the ground with this. But that's a good idea.
It's great. People really like to watch those. I mean, they're short, to the point, full of information. The public loves those. So I strongly recommend that we continue doing those and posting them. So thank you. Supervisor Elliott?
Thank you. And now just a question on this process here of getting registered and all that. So if the people who are requesting the tests are asymptomatic, does that mean that anyone can get tested, or will some people actually be declined based on their answers?
They have to answer honestly their symptoms and their history of exposure, travel to geographic regions, and the system will carry it through to a yes or a no answer.
Okay, so not everyone, just because they sign up, will get a test.
That's right. They have to do an online screen first.
Okay. Well, I'm really glad to see this activity coming through, and I'd just like to commend all the folks that have been working on this to take charge of it and provide the county leadership to get this thing rolling. Particularly the folks from OES, Dr. Fadu was involved with that, Director Diedrich. We've had discussions with those for several days just out of my office. So thank you to everybody who's been involved in doing this, because it's certainly an area of community concern. The ability to have testing and know what the status is. Thank you.
So one last question. Are we, the cost of staffing this, standing it up and running it, are these reimbursable costs under our FEMA guideline to be reimbursed? Or, I'm assuming we're paying for it up front because they're our employees, but is there potentially an opportunity for reimbursement?
There is. Everything that we are doing in standing this up and all of the work that's gone into purchasing supplies and things that we need as far as the logistics piece, we don't have to pay for the PPE or the test kits. I should throw that out. That's part of the Verily service. But all of the groundwork that's going into this, we are logging this information, and this is all part of our final FEMA claim that we'll put through, and ultimately the state claim. So assuming we do all of our paperwork correctly, we are hoping to get back a very good amount of what we've put into this. And that's going to be the question, making sure that people are doing the paperwork. So we're on them a lot more than they want us to be. We talk to people almost every single day, asking them to report numbers and get information to us. And incidentally, I do have those numbers every day. So I have a current amount if you're curious as to what this disaster, I have to say, has cost our county to date. This is not including the Department of Probation or the Sheriff's Department or County Administrator's Office, or the City of Ripon. So the number is $5,229,424 to date. It's hopefully we'll be reimbursed a very good chunk of that. Where FEMA has already told us that we'll have the 75% of the allowable costs, and they're talking about potentially giving us a little bit of that up front, which we're working on to put out the correct numbers so we can get the full amount that's eligible.
Okay, thank you. Any other questions? Thank you very much. Mr. Diedrich?
I just would like to take this opportunity. It's National Public Health Week this week. So I just wanted to thank all of our staff at Public Health. I know a lot of them are working 10, 12, 14-hour days, many of us 7 days a week. So just really want to recognize them for their effort this week and throughout the entire year. Thank you.
Thank you. Supervisor Patty?
So Dietrich, quick question. Give us a little snapshot on the staffing level and the work capacity at the hospitals. I mean, they may have not seen a spike or maximum capacity, but of course they're under extra stress and levels of demand. So if you can maybe share with us a bit during this week of recognition, and as we in the county all truly appreciate our healthcare providers.
Well, I know David Culberson here. He could probably speak specifically to San Joaquin General, but I know Dan Birch's. We have licensed beds in the county, and that's 1,220. We're looking to surge above that initial 1,300. But even the licensed beds, they're not all staffed. And even in the best of times, they're licensed beds not staffed with a reduction in staffing because of COVID. That indeed is going to be a limiting factor. How can we staff that? I know I've had some conversations with some of the CEOs of the hospital about alternative care sites and having actually them being stood up in their parking lots rather than further away to really allow them to take the limited staffing they have and maybe the well-experienced ICU nurse kind of working in a team environment and moving rounds from inpatient to outpatient in the parking lot and doing team level type of nursing care. But we don't have exact numbers on the head counts of nurses, doctors, and allied health professionals throughout the county. But that is indeed a concern. A bed does not necessarily mean a staff bed. And I know David could probably answer more specifically for his hospital and generally.
Yeah, I'm looking to get a snapshot on what the morale is and what, given the heightened level of stress, and there's a concern for PPE, and there's just concerns for their own well-being. Can you give us a snapshot of what the climate is like at the hospital, and maybe the similar situation in adjoining hospital in the neighboring hospitals?
Supervisor Patty, through the chair. Yes, I think there's really the full spectrum that you would expect during a crisis. There's a tremendous willingness to contribute, knowing that we are the only ones that are generally the only ones going to work. We've got public health, we've got behavioral health, we've got hospital staff, we've got sheriff, first responders, and then the rest of the world is either not working or is working from home. So it's a tremendous honor to be doing what we're doing. At the same time, tremendous fear that there is an awful lot of unknown. I've described for you a patient that was like last Thursday or Friday was relatively stable, and then within the next half hour back in the ICU, and I don't know if the patient got intubated, but clearly requiring additional hands-on. Morale is fairly good right now, I think. Having been through a number of these, though we're only into this a couple of weeks, having gone through several large flu outbreaks that can last 3 to 4 months. I'm looking back maybe 3 or 4 times in my career. The first month's bearable, but month 3, month 4 gets a little rough, and those flus have really nothing compared with the stress, with the resources that are required, with the overall, I think, uncertainty of where this thing's going, the way those other flus did over the last 20 to 30 years. But you definitely have dedicated staff. Again, I think one of my goals is to make sure that we are providing them the PPE that they have, that we are answering the questions. How do we handle this? So again, Supervisor Patty, I think really we have. We do have a number of employees that we are granting at home requests, child care being the number one reason that staff are not coming in. We do have a few folks that are ill, whether it's COVID or seasonal related. I don't have the specifics on that, but that clearly is a concern.
Okay. Thank you for that briefing. I was contacted by some citizens asking what we might be able to do to help out. I know that there's not open opportunity to perhaps volunteer, but thinking about it, I reached out to Chris Podesto at Food for Less, and I reached out to Lathrop Manteca Fire and Stockton Fire Departments, and we were thinking about hosting a barbecue on Saturday the 18th, I believe it is, at all of the area hospitals at the same time from, let's say, 11 to 1. Is that something you think that we could pull off and do it in an organized manner and maybe grill food and put it in bags of 10, and somebody maybe can come out from the hospital and we give them food they can bring in just to show our appreciation for all that they're doing?
Supervisor Patty, I appreciate the effort. I'm going to have to defer to Dr. Park on how we can facilitate that, knowing that group gatherings, I assume it's would be somewhat of a challenge here. But we've had a lot. I would love to accept such a donation. I'm sure the other hospitals would be and skilled facilities, police departments, first responders would feel very appreciative of that. I think as long as we follow the public health guidelines that have been issued by the governor and Dr. Park, we could try to work through that. I will say that we've had a number of donations. A sushi place in Stockton. Let's see here. We had the edible. Floral or edible arrangements have been donated. We've had a number of things, and they're very pizza places. Really, staff really appreciates that. Because again, at the end of the day, we do set ourselves apart as this is our role for the community. It's difficult, but it's something that we all chose to do. And as much as none of us maybe saw this in our careers, it's something that we've all thought about, and we're happy to serve.
Okay,
and community contributions of that nature would be very appreciative.
Good. I'll follow up with you to coordinate this, but we're going to look at Saturday the 18th. The Lions Club I contacted; they're willing to do barbecuing, and we'll do it within the structures. We don't want crowds of people coming out. We can just bag up burgers and hot dogs and condiments and such in bags, and somebody can come out and just get a bag, and we can hand it in. They can take it inside to their coworkers, and this would also include fire department, police, and sheriff.
Right.
So it's just a big group support to the community. So
not a big group, but a big group support.
A group effort.
Okay, excellent. Thank you.
Distance, socially well-cooked distance.
Okay, thank you.
Thank you.
Great idea.
Thank you. Last person I'm going to ask to come up is our HR Director, Brandy Hopkins. I just want real quickly for you to address, we're still getting a lot of, as we heard from public comment, a lot of concerns, a lot of questions from county employees. We heard from our assessor this morning. I just want to hear from you in terms of how we're working through all of these issues. It still seems like communication is the sticking point.
Thank you, Chair Miller, members of the board. I agree with you that communication is probably still the sticking point. As we've been before the board on March 24th and then last week, talking to the board about the different changes with federal legislation, that's been something that we've been working really hard to get out. In terms of communicating directly with staff, we have launched a COVID employee website. It launched last night. We will send out the direct communication to all staff today, letting them know that it is out there for them. ISD, I think the board's heard some really great things about ISD today. They have done amazing work because we talked to them on Thursday and it went live last night. So it'll have a lot of information for employees about legislation, about county policy, about the board actions that this board has taken related to employees. It has links to specialized information that they may need, county office closures that employees frequent, those types of things. And we've also created an employee email address specific for employees to send their COVID-related questions to. So whether it's I don't feel that I have the right PPE, or my supervisor's not explaining my schedule to me, it doesn't necessarily mean that HR will be the person that has the most direct knowledge, but we're going to make sure that we are the facilitators to get that direct knowledge and correct and accurate information to our employees.
A great idea. And will there be a way to track when those comments or questions come in and when they're resolved, how they're resolved, so that we know that they have indeed been answered?
There will be. We have 2 dedicated team members in HR who have agreed to monitor the emails. They've also agreed that if there are frequently asked questions, so we're seeing the same type of question over and over again, that we will update with those answers on the overall website as well, so that they're available for every employee to see.
That was going to be my next question. Will we have an FAQ up there so that
there'll be an employee FAQ up later today, and it'll be augmented because we recognize that this is a rapidly changing situation, so it'll be augmented as needed.
Great. Thank you. Any other questions, Ms. Hopkins? Supervisor Elliott.
One more time, where exactly on the website is this going to be?
If you go to the county's COVID page, right down at the bottom, there's a big bar. I think it says COVID-related information for San Joaquin County employees, something similar to that. And you can just click on that, and it'll take you right to another website that's dedicated to our employee population.
Okay, so this is off of the county website, not SJ Ready. Or
right.
Clerk of the Board, is it possible to pull up the COVID website for the county?
And part of the reason, Supervisor Elliott, why we put it on the county's web, because this is for county employee information.
Okay, thank you.
Hopefully we'll be able
And
to
if
show
you're an
you.
employee, will you just enter your, what will you have to enter so that you're verified as an employee, that you have access to the
We
information?
actually are not making it protected the way some counties are. If a member of the public wants to view the site, they could as well.
Okay, thank you.
That way if somebody's at home, they don't have to try to remember anything specific.
Right.
So see, it says
Human Resources Employee.
if you click on that, it'll take you to the employee page. And then this is what the top of the employee page looks like. There are some still parts that we're adding to it, and those will be up later this week. And it is our intention to make sure that this is a live site that has continuous updates for our employees as they become available.
Thank you.
Thank you.
Other questions? Okay.
Thank you.
And thank you very much. Thank you, everyone. As always, lots and lots of good information. Now we're going to move on to our next discussion item, which is to discuss emergency amendments to San Joaquin County Revolving Loan Fund administrative plan due to the ramifications of COVID-19 pandemic, including Governor Newsom's executive orders relating to the shuttering or curtailment of certain public-facing business operations. We're doing this one remotely. I believe we're going to have Steve Landsberger, Economic Development Director, joining us telephonically.
And I believe as of a few moments ago, he was on the phone, so we'll just wait just a minute to see if he dials in.
I guess maybe while we're waiting, did we receive any additional public comments on the last discussion item?
Madam Chair, earlier this morning, we received another comment from someone who had previously commented, just reiterating the need for personal protection equipment for nurses and healthcare workers.
Great.
Very similar to a previous comment.
Okay, good. And that was addressed in the discussion. So thank you very much.
While we're waiting, I have a question for CAO.
Ask away.
Thank you, Madam Chair. Our CAO's office here. I want to get a little clarity on something. When we did a 5% hazardous pay increase for those that are working and on the job, that didn't include supervisors or directors, correct?
So Supervisor Patty, I did include, my intent was to include board members as part of governments, and it did include all the department heads, both elected and appointed department heads. And we're not referring to it as hazard pay, it's a supplemental pay in recognition that they're currently essential employees during the COVID crisis.
I wasn't aware of that. I would have brought that up during when we discussed it. But for me, I think this is our job, and I don't know how the rest of the board feels, but I would be just fine without the 5%. And also, I think directors of departments, they're well paid as it is, and this is their job. So I understand staff and the rank and file that are out there in the county working on behalf. But for me, my suggestion, and if this needs to be put back on the agenda and discussed or something, but this is our responsibility. This is our job. This is what we're elected to do. And when we've chosen directors, and they're compensated very well in San Joaquin County as they should be. They are the best of the best, and we bring them in, and they perform a great job. I think that I'm satisfied that their base salary is adequate. That's what I wanted to bring up during supervisor comments.
So, Madam Chair, board members, would you like me to bring that back to the board with that direction, or where is this board? Because it was my intent to include board members and department directors. And like I said, since we have both appointed and elected department heads, I included all of leadership.
From my standpoint, I already notified the clerk of the board that I didn't intend to take the 5% for myself. We haven't had any reduction in our compensation at all. And so I don't feel the need to take the additional 5%. If the rest of the board would like to see this come back, I'm just fine with that.
I would agree, although I have no problem with the board not taking the increase, but I think the department heads, elected officials, because they're dealing with a crisis in their own departments, having to do a lot of things that they don't normally do. So I would say, if you're talking about not giving any raises, I think the five of us are probably the only ones in the government that really, as Supervisor Patty says, I'm fine with that. I didn't expect it anyway, to be honest with you.
Supervisor Elliott, weigh in?
No, sure. No, I agree. I just don't think it's appropriate for we supervisors to receive an increase in pay based on this.
So am I hearing that there's a consensus that?
Absolutely. I'd like to see department heads get paid. I think
Okay.
they're under a lot of stress and they're dealing with all their employees. I think they deserve the 5%, but us five, I recommend we don't take the pay.
So, Mr. Miles, do I need to bring that back, or can I, especially since the board gave me the authority as part of that recommendation, can I go ahead and implement this direction within my existing authority? And I actually have it right here in front of me. I could read it so you could kind of make an opinion on the, I have it with me.
I think our sheriff would like to say a few words.
Sheriff?
Thank you, Madam Chair. If I'm a betting man, if you asked each one of the directors or elected officials, they would feel the same. We appreciate that you've done this for our staffs. Maybe it's something that CAO might want to put out to everybody else, but everybody took these jobs knowing what they were signing up for. So, but we sure appreciate what you've done for our staff. So, maybe just ask around. If we can put it back towards something else, that'd be great.
I think it's a great idea. Maybe ask our directors if take a survey.
So, I'll let Mark, once he gets back to his chair, he was able to read we come prepared.
I believe that the direction that you gave to Ms. Nino at the last meeting was sufficient for her to make that modification in the policy.
So let me share with you what direction I'm interpreting that you're giving me here today. That we will not provide the 5% to all 5 of you, and I will put out an email to all of our department directors and see where they land, and if it ends up being more, are sending it to me independently, of course, individually, that they want it, and I'll just take the majority. I believe we have roughly both either 26 or 25 both elected department heads and appointed department heads. So I would put it out to both of them.
Excellent. Thank you. I appreciate that.
Both are elected and appointed department heads. Okay.
I think it's a great course of action.
Yeah, I do too.
Thank you for the direction.
Has Mr. Landsberger joined us?
I believe so.
Okay.
Or what else can we discuss?
Mr. Landsberger, can you hear us in the board chambers?
He may need to unmute himself.
My apologies. He thought he was there for a minute, was going to check back in once we were done with the discussion. It sounds like something's on mute, possibly. I believe he can hear us, and we're just unable to hear him right now. And we do have ISD in the back also working on it at the moment.
Madam Chair, do we want to go to County Council's item?
That's what I'm thinking. We'll just move to the next discussion item. Introduce and waive reading of an ordinance amending the San Joaquin County Code of Ordinance, Title 4, Division 10, Chapter 1, Commercial Cannabis Activity, to increase security-related requirements for commercial cannabis businesses. Said ordinance to be adopted on April 21st of this year. Any council?
Board, back in last year now, Sheriff Withrow had stated a desire to the board to participate in a review of the security requirements that had been included in the ordinance for the cannabis businesses, and a view that perhaps his office hadn't been as involved as he would have liked up to that date. And so we worked with his office, Lieutenant Hardy specifically, who did just a fantastic job with the other departments, both County Council, Community Development, and Environmental Health, to work through the security requirements and make sure that we got language into the ordinance that would satisfy the concerns of the Sheriff's Department. So what you see in the proposed amendments, there's some cleanup on a couple definitions, but then there's also additional language and requirements for the details of the security plan, making sure that the security plan is available for the sheriff to review and sign off on beforehand.
There's only two, that's me and Steve.
Before they open. They include details such as who is authorized entry into the premises, where the storage of cannabis and cannabis products will occur, activities to prevent the diversion of theft and loss of cannabis, defines what the security systems have to, what standards they have to meet as far as alarm systems, surveillance systems, both the quality of the camera and the quality and duration of storage of data, having perimeter lighting, 24-hour security personnel, etc. They require that all of the commercial cannabis activities take place in fully enclosed buildings with solid, hard, non-opaque walls. They do allow for in a mixed light cultivation. They allow for a translucent roofing material that will be gets reviewed by the sheriff.
Hang up and redial.
It adds requirements for criminal history check and then background investigation for all of the owners, and requires provision of a current roster of employees to be kept on file with the sheriff's office. And so that summarizes the changes. They are almost exclusively deal with the requirements for the security systems and having that plan and the sheriff's ability to review that plan and determine the adequacy of it before these businesses start operations. To date, there are 3 commercial cannabis license applications that are all for one property that are being reviewed by Community Development Department. They've got the 3 complete land use entitlement applications. There are 4 pre-application conference requests that have been submitted, and those are underway. And then there is one plan that is at the in the process of developing or negotiating the development agreement with the county administrator's office. And there's one proposal that is for a special business plan for a cannabis business. We are requesting that the action of the board today is to introduce and waive reading of the proposed amendments, authorize council to prepare a summary of the ordinance and the clerk to publish the summary, agendize the adoption of these amendments at a regular meeting following introduction and waive reading, and accept staff's report. And that concludes my report. If you have any questions, I'm happy to answer them.
Motion to approve.
Oh, sorry.
Just need a motion to approve, and then we can move it forward.
To approve.
So moved.
Second.
All right, we have a motion. Hang on, we've got one board member wishing to speak. Supervisor Elliott.
Thank you. Just a couple of questions here on what some of these things mean here. So let's see, when it talks about section 4-10011, site plan, and it talks about a licensed site plan and then a security plan. But then it says the site plan submitted to environmental health must be consistent with the site plan provided to the community development department. So why is the site plan different?
So within the community development, within property development realms, a site plan is a different animal than the security plan is. The site plan identifies where the infrastructure is going to be located on the site. It identifies the uses that are on the site. And so the reference that you see there to the site plan submission, that's making that's keeping the site plan for these purposes consistent with the community development site plan.
Right. It just amazed me that they were different in the first place.
Well, there was some. It's more of an issue of clarification as we went through with the sheriff. There was some discussion about whether the site plan was something different than, or there was some ambiguity in the language.
Okay, so this is going to make them the same regardless.
Yes.
Okay. And then on item 4, this is section 4-10013, talking about a fully enclosed building with hard, non-opaque walls. So when we're talking about non-opaque walls, does that mean walls you can see through?
That means walls that you can't see through.
Opaque meant you couldn't see through it.
Opaque means you can see through it.
Means you what?
Opaque means you can see through it. Kind of cloudy.
I think we should check that.
That may be because that's in relationship to the mixed light.
Madam Chair and Mr. Elliott, Supervisor Elliott, what we were looking at is that hard plastic that could be opaque where you can't see through it, but it's still that hard plastic stuff that would be easy for somebody, it's usually got the ribs or something like that, that they use in a lot of greenhouses, and we didn't want that. We wanted to make sure we had secure walls that nobody could easily break through or just kick out or something like that.
Okay, so we are talking about things that you can't see through then.
Yeah, we don't want you to be able to see through it, and we don't want you to be that plastic stuff that you can easily break through.
Something that's like bricks or something like that.
Yes, something solid.
Okay. All right. Thank you.
Okay, any other questions?
And just a final comment on that. While I am still opposed to having this commercial cannabis business in general, I am in support of it, since past history has indicated that it's going to come anyway. I am in support of having as much security as we can on those buildings.
Okay, great. So we have a motion and a second. Cast your votes. That motion is approved 5-0. Did we get any public comments or anything on that? Clerk?
Madam Chair, no, we did not.
Thank you. Okay, we'll give it one more shot here. Can we,
Okay, Madam Chair?
We've
Can
got...
you hear me? This is John Solis.
John.
Yes, we were apparently muted, so we started our presentation and we realized that you couldn't hear us, so we started making connections with everybody, including Tom Patty. But anyway, thank you very much. With me is Stephen Landsberg, and we want to thank you for your continuing support and for the opportunity to make this presentation. It is recommended that the San Joaquin County Board of Supervisors approve emergency amendments to the revolving loan fund administrative plan to avoid defaults of RLF loans in our portfolio due to the coronavirus pandemic crisis. These amendments would streamline our processes for modifying existing loans and provide the support our businesses need to survive this economic crisis caused by this pandemic. It would be making available the working capital these businesses need in a timely manner by eliminating restrictions and requirements temporarily to enable us to support our customers and San Joaquin County businesses. Now, these modifications will be temporary during this COVID-19 pandemic crisis, and they are consistent with the guidelines provided by the Federal Economic Development Administration. So Steve has prepared a presentation so he could walk you through the details of this recommendation.
Great. Thank you very much, Mr. Solis.
Mr. Landsberger, are you on the line and can you hear us in board chambers?
Okay, I can hear you now. Can you hear me?
Yes.
Chair Miller, members of the board. Steve Landsberger here.
Thank you for the opportunity to present today a brief PowerPoint of what John mentioned about some modifications temporarily to our revolving loan fund administrative plan. Next slide, please. So, our presentation, we want to just briefly touch on the reasons. Obviously, we know why we're here, but some of the issues that are being faced by, as Supervisor Patty said earlier today, about our economy being impacted by the COVID-19 pandemic. And what we're hearing from our existing borrowers is that the majority of them who are public-facing are deemed non-essential. And as such, they are either shuttered completely or have curtailed their operations dramatically, which affect their ability to make our revolving loan fund loan payments. And almost every one of our existing loan portfolio has requested temporary relief from their debt payment obligations, and that is why we're here today, to get your authority to make and answer those requests. Next slide, please. Next slide, please. So what we all have heard in recent weeks since this pandemic started is there's been a lot of talk about an approval of a $2.2 trillion federal stimulus package to help existing businesses across the country. And one thing that happened in late March is the Federal Economic Development Administration, who provided the original funding for our revolving loan fund, authorized emergency modifications to local grantees, which we are one, to our administrative plan, which is the guiding document for our revolving loan fund program. The federal government also has provided additional technical assistance, and they've also, as we know, provided some emergency loans and grants to small business, which I'll touch on here in a few moments. Next slide, please.
There's a 20-second delay.
Okay. So I'm looking at the screen. So the PowerPoint may not catch up quite yet, but I'll keep talking here. The revolving loan fund proposed action, as John mentioned, was to temporarily amend our existing administrative plan to relax and suspend certain provisions of that plan to accommodate the needs of our existing borrowers and other companies in San Joaquin County that may need financial assistance to get through this crisis and hopefully come out on the other end able to operate their business. The actions we're proposing today in the board letter provide many options for staff to consider loan payment deferrals, modifications of our existing loans, restructuring of debt to ensure that borrowers can make the required payments and not suffer other default issues. And most importantly, and we ran this through prior to bringing it to the board through the federal government, to create a pool of funds to help with our existing companies that are not currently our borrowers that might need funding to keep their operations viable. And we're calling that the Emergency Business Support Fund, that we are requesting setting aside $600,000 of our loan portfolio to provide small loans, basically working capital loans to companies that are not currently in our portfolio but cannot acquire assistance through the other programs being made available through the federal government or other lenders. Next slide, please. So the benefits that we feel will accrue to our not only our existing borrowers but applicants is we can alleviate potential loan defaults and provide credit protection to not only the business but the individuals who are possibly guaranteeing the various loans we have in our portfolio. That will allow these companies to focus their attention on restarting their business operations once the crisis ends, and we hope that the restructuring and potentially additional capital will help them maintain key personnel that have vast experience in these companies, and would be a tremendous loss to lose that particular business. And for those new borrowers through the EBSF, it will provide immediate cash infusion to help them meet short-term capital needs that they are not able to meet currently with the cash flow restrictions due to being closed or extremely curtailed. Next slide, please. There are other resources that have been made available, and we've all read and heard and seen them advertised. The Small Business Administration has put forth $349 billion for the Paycheck Protection Program. That is a forgivable loan if certain conditions are met, and those loans are made available through local banks, financial institutions, credit unions, and the like. The Economic Injury Disaster Loan Program is a program where you make a direct application to the SBA through their online web portal. Again, it is administered directly through the SBA. I'd like to circle back to the Paycheck Protection Program. Each institution has a certain volume cap assigned to it, and reading the other day, Wells Fargo, with such an incredible demand, has already met their $10 billion Paycheck Protection Program cap, and they've already shut down their window for more applications. And to that point, the federal government is currently considering an augmentation to that program of another $250 billion because they feel like there isn't enough money to meet the need through the Paycheck Protection Program. Also, if you're an existing SBA borrower, the SBA will basically forgive payments for 6 months, so a company will not be worrying about making their required debt service payment during the term of this crisis. There are other activities going on in our county. City of Stockton recently approved funding to augment their micro and small business loan program to help companies impacted by the pandemic. These guidelines are still under development, and we have been communicating with the City of Stockton to try to align programs so that we can provide the maximum assistance not only in the county but within the City of Stockton and their program. I'd also like to point out that the Downtown Stockton Enterprise Loan Fund recently voted to defer payments on their loans for a 60-day period. Next slide, please. There is a action in motion through the CARES Act, which provided most of the stimulus to business. The United States Economic Development Administration has been allocated $1.5 billion, and we have already reached out, essentially seeking more funds to come into our locally administered revolving loan fund to help our small business. Now, they have yet to deploy a method of delivery, but we are closely monitoring that to make sure that we have an opportunity to seek additional funds, because we know that our need will be great as we roll through this crisis and come out the other side. So we don't think that $600,000 is going to be adequate, but we want to put it in place and get the program started, and we can augment funding as we move forward. I would like to also point out, and I think it's very important to point out to the board, is that even though we are asking to relax temporarily some of our underwriting criteria, our intention is to make loans that will be repaid and to ensure that we preserve our capital base. Because if we have significant loan losses, we will not have a revolving loan fund very much longer, because we will have no capital to loan out to other companies. So despite relaxing some of these requirements, procedurally, we still intend to use what's required, which is prudent lending practices, to make sure that we make loans taking into consideration the current times, but looking long-term at what businesses can afford to repay, so we do not have mass default in our portfolio. I'd also like to point out we've been talking to other cities besides Stockton about loan programs that would dovetail with our revolving loan fund, and some cities are even considering establishing their own small revolving loan funds to help just their city businesses. I would also like to point out, and it was brought up earlier by Supervisor Patty, we are aggressively monitoring, national activity in this arena to make sure that we're staying current with what's happening in other states and regions, lending to small business to help our business community throughout this crisis. Because it's very important for us at the Revolving Loan Fund and the Economic Development Association to not only bring new jobs to this county, but to retain those jobs that we currently have in the county. And we are doing everything under our power to make sure that we provide any and every resource to our business community, because they need help, and we're trying to provide that help in any way we possibly can. Next slide, please. So that wraps up my brief PowerPoint presentation. Again, I didn't go through each and every one of the requested temporary deviations from our administrative plan. But again, those are mostly underwriting criteria that we use on a day-to-day basis for federal regulation that the federal government has made available to us to temporarily relax so that we can get money on the street to help our business community and retain jobs in San Joaquin County. So I want to say thank you for your patience in this new effort for us doing this electronically. We appreciate everything you do for the Revolving Loan Fund and the EDA, and we'd be glad to answer any questions. Thank you very much.
Supervisor Patty?
Thank you, Madam Chair. Mr. Landsberger, just a quick follow-up, and I appreciate you were listening to our discussion earlier, and obviously jobs are paramount. We wouldn't exist here in government if it weren't for the private sector, the jobs that people perform on a daily basis. When we take those away and we limit them, when they're curtailed through many manners and issues of justifiable concern, it's of course of all of our concern. So that said, I had mentioned wanting to form a little bit of a committee to come up with suggestions that we could maybe utilize here in San Joaquin County or regionally and promote through CSAC. Do you have any such plan or action going in place, or would you like to join the committee that I'm talking about with Stockton Chamber of Commerce as well as Builders Exchange and other groups and organizations of businesses?
I know I speak for myself, and I'm sure John would say the same, that we'd be more than happy to join that ad hoc committee. But bear in mind that we've also been, monitoring activities throughout the state currently with CalEd, which is the California Association for Local Economic Development, and other agencies and organizations that deal directly with business and economic development. And so, we would love to be part of it, and we appreciate the opportunity to serve on that ad hoc committee. And so things are changing daily, and we wanted to make sure that we brought this to you as soon as possible because, our existing borrowers and potentially other impacted businesses that don't currently borrow from the RLF are calling us for assistance, and we really wanted to put something out there as soon as possible.
Great. And just to close the loop on that, the more people we can involve, in my opinion, and the more information we can share, that would be a consensus, would be identifiable best practices and reasonable measures that we could and should be taking. And the more agencies and organizations that we can share that information with, I think the better. So, my learning from what you guys have already studied and what you're sharing and what we can further exploit and promote, as well as bring back to this board some measurable recommendations, I think would be time well spent. So thank you. I look forward to that discussion, and my office will be getting in touch with you, and we'll do this very soon. Thank you.
Yeah, and just as a point of information, agencies at the federal, the state, and the local level, we're working together to really focus on the resources that are available between us, and it is our objective to make sure that we have access to those state and federal funding so we could bring it into San Joaquin County to reinforce what we're already doing.
Sure, understood.
And as a matter of fact,
Go ahead.
As a matter of fact, we submitted a couple of national emergency grants working in partnership with the state to facilitate the delivery of services and support to not only the business community, but as well as the dislocated workers.
Sure. And John, to that point, relief of loan and an extension of payments, due dates, and getting a little bit of money that might come in that's available, it doesn't supplement and nor replace actual business activity and jobs. And so we really need to make sure that it's working in conjunction. We can receive funding coming in, but if the phone doesn't ring and if services are not performed and if business transactions do not happen, business is still dead in the water, and that means our economy will suffer, and people will lose houses and apartments and struggle taking care of their families and children. So these are of paramount issues and concerns for all of us.
Absolutely, and the sooner we deliver the services to those businesses that are going to open up once this pandemic crisis finishes, the better, because they're going to be in debt and they're going to need a lot of support, including, for example, on-the-job training contracts for those that lost their employees and may have to hire, and every little bit is going to help them.
Agreed.
Thank you. Supervisor Elliott?
Thank you. One clarification here, in several places in the proposed relaxations here, it talks about that this is a temporary measure until such time as private lending returns to normal or private economic situation returns to normal. Who decides when that is? Will that be based on when the emergency declaration is lifted, or will there be some other consideration?
Well, Supervisor Elliott, let me try to answer that question. Obviously, the relaxation of the stay-at-home orders is going to be a big driver in this whole issue of freeing up capital for business. But secondarily, we are hoping that the federal government continues to relax other requirements on banks so that they are going to make capital available. So the temporary deviation is in place for a period of time until the federal EDA, who we report to, says, okay, they determine when, in fact, that timeline is over. We can, and we are in the process of updating our administrative plan. So we can, in fact, request some of these temporary deviations to become permanent. But at this point, we are at the discretion of the federal EDA when, in fact, they determine that you can no longer apply these temporary deviations. They have to become a permanent part of your administrative plan.
Okay, so I take it that'll be something that becomes clearer as time goes on as to when this will, the temporary suspensions will end.
Yes, I probably didn't answer your question very well, but we really don't know on our end what the federal government has determined to be the end date. But I would say that we expect at staff level that at least 6 months before these temporary deviations would be terminated by the federal government. But I think as days and weeks progress, we're going to see more and more information roll out from the various agencies at the federal level. And bear in mind, they've had quite a bit of challenge even issuing paycheck protection loans because of the overwhelming supply, overwhelming demand for those monies, and they weren't quite ready to handle that. So we don't know exactly, and they haven't put that in writing, when that period would end. But when normal lending returns, we've talked to our local financial institutions, and they've had a lot of requests for short-term working capital loans. And, of course, they have a different motivation than the revolving loan fund. They're in business for shareholder wealth and rates of return. We're in business for providing job creation and job retention for this county. So they're a little more reluctant to take on risks for businesses that have been curtailed or shuttered. So that's why we're getting a lot more requests. And I really can't give you, just like any of the previous medical professionals here today, couldn't give you an exact timeline when this crisis would peak. I can't give you an exact date when, in fact, things will return to normal and we'll have normal lending activity.
Yeah. If I can elaborate, some of the businesses were doing very well before this pandemic crisis, and it was this pandemic crisis that caused the problem because they were forced, in some cases, to shut down because they were not considered essential services. So these companies, these businesses will gear up once it's over, and they're going to resume their operations, and they're going to have to secure staff if they've lost their employees to other companies. And it is our intent to support these businesses so they could come back and actually become productive. Otherwise, if that company doesn't open its doors or does not succeed because they're overly in debt, then we're going to lose jobs and we're going to lose companies. And bottom line, that would be a tragedy if these companies that were doing well did not survive.
Well, I agree that we want to try to make this program as flexible as possible so that we can give assistance to local businesses that are either trying to start or trying to continue their business. So I certainly support the plan and didn't expect you to pinpoint a date. I just was trying to get an idea as to how that decision would be made as to the end date. Now, on one of these here, I think it's item number 10, that's being relaxed. The job cost ratio says that currently we require borrowers to create or retain one full-time job for every $75,000 of RLF funding, and we're going to suspend that. But I was just curious, why do we want to suspend that one, especially with this new EBSF loan process? The loan is going to be capped out at $75,000 per recipient, as I understand it. So why would we not want them to create or retain at least one job?
Supervisor Elliott, to answer that question, on the new EBSF, what we're looking to do is to give them some additional time to create that job. We're not going to waive that requirement for the new EBSF. We are just going to provide them additional time to create that job opportunity. So it will still be a requirement because we are evaluated by the federal government on our job creation on a portfolio basis, not on a business-to-business loan basis. So we have I hate to use the word surplus, so we have a surplus of jobs created in our overall history of the revolving loan fund. So we have the ability to relax the time of hiring for these existing borrowers or these EBSF borrowers, and we're still compliant with federal law and regulations. So we just want to give them some more time and not put the onus on day one as we're trying to, unmothball their business and pay other debts and obligations to be required to create a job immediately. So we intend that, even in our modifications, that the jobs that were originally created through our existing loan portfolio, those companies will have to eventually meet those tests, but we are wanting to not make it so burdensome that they can't pay their suppliers, their rent, their mortgage, or other pressing requirements and have the working capital to provide inventory to generate sales. So we want to have some flexibility here, but at the end of the day, they will be required to eventually meet the job creation or retention requirements.
Keep in mind that these are strategic objectives, and while they work very well under normal conditions, at this point, when you have a business under crisis, that would be a requirement that probably would prevent us from following through with a loan. And so waiving these strategic requirements and conditions and terms will facilitate us working with those, for example, our customers that have existing loans and they are in distress and they need some support, to create a barrier that we cannot give them a loan just because they're inconsistent with those strategic objectives and allow them to fail and go bankrupt would not be in the best interest of our community and not what we're intending to do. Right now, they're under crisis. They need some support, and a slight deviation of these strategic objectives will help us give them the money in a timely manner. Because with those strategic objectives, they would become barriers, and we probably would disqualify some of those individuals from actually getting loans through the revolving loan fund.
Okay, I understand, and I agree with the temporary relaxation of some of those specific requirements to give people time to get through the crisis that they're in right now, and eventually be able to meet those goals, but not necessarily have to do it on the first day. So thank you very much.
Any other questions? Okay.
Madam Chair, before the board takes action, Mr. Landsberger or Mr. Solis, can you share with this board what the value of the outstanding loans are before they take action so they know what the value you're potentially going to open these temporary modifications to?
Yes, County Administrator, I'll speak to that question. We currently have approximately $3.2 million of debt on the books in our portfolio. I would say that not all of that would be requiring a modification or a restructuring. I would say probably, give or take, $2 million of that would be seeking some temporary relief, but not the entire portfolio. So that is what we anticipate would be looking to get a modification, a deferment, a forbearance, or some type of a payment relief so they can, soldier through this time and come out ready for the other side of the pandemic.
Thank you.
Thank you. Do we receive any public comments on this?
Madam Chair, we have not received any public comments on this item. I do want to point out, after this item has concluded, Auditor Controller Jay Wilverding would like to address the board.
Okay, great. Thank you. Okay, then. We are being asked to approve the emergency amendments to the RLF administrative plan to authorize the director or his designee to submit the desired temporary amendments to the plan, to authorize temporary changes in the collateral valuation guidelines set forth in the plan's implementation, and to authorize the executive director and revolving loan fund manager, without further action of the board or the RLF board of directors, to approve current or retroactive deferrals, payment moratoria, etc., and to authorize the creation of the 2020 Emergency Business Support Fund, or EBSF, and capitalize it with $600,000 of the RLF's capital base. So I'm looking for a motion.
Second.
Motion and a second received. Please cast your votes. That is approved 5-0. Thank you. Thank you, Mr. Solis and Mr. Landsberger. I know it's always difficult trying to do this by phone, but we appreciate your flexibility.
Thank you very much.
Have a great day. Thank you.
All right, on to the next one.
Okay. Next up, we have a request from our Auditor Controller, Mr. Wilverding.
Good afternoon, Chair Miller and members of the board. Thank you for hearing me out. I tried to run up here before we concluded on the whole topic of payroll discussion. And given all the payroll, what do you want to say, related events we've had going on in the last couple of weeks since this COVID-19 thing has been going on, I just wanted to put a few things on the table so that everybody knows what we're dealing with in my shop as it relates to payroll. We've had quite a number of changes going on with the new law 1602, the decision that was made by the board a couple of weeks ago regarding the additional 40 hours. And we've had some misstarts. Well, I think we heard from our assessor this morning, and now my department is having to unwind those changes. There's also a lot of one-offs that we need to do in order to accommodate employees who are on leave without time in order to manage those so that we don't have anybody short on their paycheck in spite of the fact that they may be away without time. All that's having to be managed literally on a one-off basis. And I heard discussion earlier, which is why I came running up here, about having a survey and having the 5% maybe one-off onesie-twosie, and that would also require manual intervention that we need to do right now. I just wanted to point out, if we could keep things stable in my payroll division for at least till we get through the knothole on this thing, I would greatly appreciate it. And I say that because we've got two staff in payroll that are in and out periodically with child care issues and family health care issues. And I just wanted to say that we're kind of up to our chin right now in the payroll division. Things are going fine, but we want to make sure that I'd like to try to minimize any further changes we have. And as far as the board and the 5% supplemental pay, we all being county employees, were granted that, or at least eligible for that, based on documentation that came from HR that got submitted to my department. And the board, ironically, was not listed as an essential set of employees. So none of you are slated to get the 5%. And I'd be happy to take any questions. I brought my payroll administrator, Lori Roleri, along in case you have any specific detailed questions I'm not able to answer. But I did want to throw that out as an ask because we're getting by, and Lori does a great job, and I want to make sure we continue down that path.
Great, thank you. From my standpoint, I would say, go ahead and survey the department heads, and then you make a decision. It's all or none.
Thank you.
And I think we can keep that pretty straightforward for you. It either all the department heads will get it or none of them will get it. And it looks like we're already taken care of, so that should help. But we appreciate your input.
Okay.
Anybody else? Everybody?
Just a quick question. What's it programmed now for department heads? I mean, are the department heads in the queue, so to speak, as far as so if you pay the department heads, you don't have to go back and fix anything. Is that correct?
Yes, and as a matter of fact, I just found out we loaded all the employees who are going to get the 5% supplement just this afternoon. So they're already in the system.
Thank you. I think we have the sheriff wants to weigh in again. 6 feet away, Mr. Wilberding. Thank you.
You know, we don't want to make it difficult. Maybe if everybody could donate their money specifically, if they take their 5% and donate it or something like that, then might make it easier and not put the workload on somebody else. So.
Yeah. I'm happy leaving that up to the CIO to sort through.
I'll work with the auditor's office, even if I have to go down there and assist in regards to where the department heads' salaries end up. But we are only talking probably less than 25 to 26 max.
Well, also talking a short time.
You are correct. This board gave me authority through the end of May only for this 5%. So hold me to it, Mr. Larry. If you need that additional support, I may be working in the auditor's office.
Okay, thank you. So we're going to move on to Board of Supervisors comments and our committee reports. And this is also the opportunity for any supervisor who wants to highlight a business or an individual from their district that is really going above and beyond during this COVID pandemic. Wish to speak?
I'll start.
Nancy
Lamb from 209 Cares. She's been picking up garbage throughout this whole pandemic, throughout all the neighborhoods and in the neighborhood and the county, and she's done a wonderful job of keeping the streets clean and picking up garbage, and really proud of her.
Great, thank you. Anyone else? Supervisor Patty?
Thank you, Madam Chair. A couple of things I think a little house cleaning here. Question for our CAO. Mr. Bestelaritis was up earlier talking about the HR 6201, and apparently there's some emails and exchanges going on. I'm not cued in on them. Is this something that the board needs to review and maybe agendize and discuss?
So I felt the board gave direction. Mr. Bestelaritis, he was correct relative to the board discussion that took place, I believe, on the 24th, March 24th. I'm trying to remember these dates. We did come with the intention that 6201 would be implemented effective immediately. I believe both our county council and I believe our HR director were very clear what their understanding from the Department of Labor was at that point. When we found out, our county council appeared in my office prior to the end of the day, and I sent out a letter to the department heads to share with them. Please hold off. We do not have authority to implement. We will be going back to the board on March 31st to provide information and receive direction from our Board of Supervisors. So a correspondence went to every single department head that end of day, and exactly as you heard from Mr. Bestelaritis, he took action as a result of, providing leadership to his department, as we all do. So I believe the board has been very clear on the direction, and at this point, my understanding, the only correction we need to make, the majority of the correct is out of his department only. All the other departments, and I believe there might have only been one others, immediately when our HR director called, the same way she did with Mr. Bestelaritis. I was not privy to that conversation. He just chose not to want to provide our HR director the authority. And so when I requested the changes of the auditor's office, the auditor asked me for a written letter of what the change I was asking for. And that's where I provided clarification, that the board gave me direction that HR 6201 would go into effect April 1st. And so I do not believe it needs to come back before this board.
Okay. Is there a gap with his staff that's that a hardship was created? Because there does seem to be conflicting messages earlier versus later.
So this board has given me direction along with, then I reiterated that direction to the department heads. If staff needed to go negative with their leave time, this board gave us authority to do that, and then we would allow any new earned leave time. In fact, I think Mr. Supervisor Nguyen asked me that direct question last board meeting, that they would go negative, and then when this board front loads, whether it's sick leave, vacation, as it's earned by pay period, or at the beginning of the year, however it is generated, they would pay back that time that they went the negative in. But anybody who is qualified for the 6201 regulation and requirements, there were those various bullets that I believe Ms. Hopkins did a very good job in explaining last week, Tuesday. They would still be eligible for the 80 hours starting April 1st. Mr. Bestelarides' concern was about starting March 25th through the 31st.
Correct.
Prior to that time. And we may have a few employees that did not have time. In fact, I just received a report, and I believe it may be 4 or 5 employees that would just go negative, and they would just pay back as they earned it. We're not going to ask them at this point in time to give us a check, and they wouldn't get a full paycheck.
Okay. Thank you. And just in recognition, I was contacted and shared with the Stockton Homeless Shelter and St. Mary's Dining Hall, but Sikhs for Humanity have volunteered, and they're cooking meals 3 times a week to volunteer and bring over and feed homeless. So they kind of lightened up the load for the regular difficult task of feeding people daily. And this organization is volunteers, and we all know very proud members from our community. The Sikh population are just amazing. They volunteer, they help, they're there. They are amazing contributors and a very vital part of our community. And I'm recognizing and very grateful for that contribution.
Thank you. Supervisor Nguyen?
Yes, I'd like to acknowledge and recognize Gina Valdez, Bread of Life, because they aren't able to give out their food. They have assembled a group of volunteers that deliver 3 times a week to make sure that they get. I've had the opportunity to do several of those runs from Antigua to Oakdale, actually, and I will tell you, it's heartening to see some of the individuals that are desperately in need of food, and I've heard from some of the other volunteers where they drop it's a box, large box of food of various items, and one of them was saying that they dropped it there. You just drop it and you leave, ring the doorbell, you don't have any contact. But a young boy came out and yelled to his mother, "We have food." So it's just this time that we see how desperately people can be. So anyway, so Bread of Life and Gina Valdez they're doing an outstanding job maintaining their stockpile of food to those in need.
Thank you. Supervisor Elliott?
Thank you. Rather than choosing one, I'd just like to express my appreciation for the entire county staff, the entire set of county employees who have continued working so hard throughout this whole pandemic incident here, and also just all of the businesses in the county who have done their best to comply with all of these things and try to get us over the hump, get us through the peak. I think it's just been a great community effort to pull together and try to get through all of this. So I'd just like to give my thanks to all of those who have made a great effort.
Thank you. And I want to give a shout out to Trader Joe's in Lincoln Center South. They embraced all of the public health requirements very early and implemented them. They marked off 6-foot spacing for anyone standing in line. They restricted the number of people in their staff. They even monitored the line outside their store. And for quite a while now, if you go there at 8 o'clock in the morning, the line will stretch from the door of Trader Joe's all the way out to Ben Holt and all the way up to Gettysburg, because they're maintaining the 6 feet distance. And they're also very visibly disinfecting every single shopping cart right as people either leave the store or as they bring the carts back up to the store, so that the public sees and is reassured and can tell what a great job they're doing. Their employees are universally helpful. They've implemented some early shopping hours for seniors to get in because they're especially vulnerable. But they are also enforcing nobody's supposed to buy more than 2 of any one item, and any shopping unit is only allowed 1 cart of purchases. So they're really, and they did it early before almost anybody else was doing it, and really set an example. And their employees just have done it with such high spirits and, just really good nature to help the public get through these times and to make sure everybody's finding what they need to find. And there's enough supplies within the store so that all the people coming in to shop, they aren't letting people take a whole cart full of toilet paper or paper towels or whatever. So I want to shout out, that's the kind of business stepping up in our community, and they employ lots of local folks in Trader Joe's, and morale is very high still inside that store, and the shoppers that leave there. So I want to really give them a shout out. And so now I'm going to turn to County Council to announce any closed session.
Board will meet in closed session on the item listed on the agenda. There is possibility of an announcement following closed session.
Okay.
Madam Chair, before you adjourn, I have one more issue that has been sitting on my desk I'd like to just mention real quick. And this could be for a future discussion, but our travel plan, I asked with our airport director, and this is going back weeks, so this is old, and in the near future we may be able to address this. But our travel policy oftentimes prohibits using Stockton Airport because there's, I think, $150 difference. You have to go to the best price ticket. And that's understandable, but if you took into account perhaps parking expenses and you look at the total cost, our local airport, which we could and should support in whatever capacity possible, we may want to take a look at that, and may want to utilize that as a viable option.
We will bring that back for a future board's consideration, at least definitely the analysis.
Yeah, thanks.
Thank you. Okay, we're going to adjourn to closed session now. How long do you anticipate it taking? I'm wondering if we should take a 10-minute break, 15-minute break first,
It's very short. It's very short. 5 to 10 minutes max.
What do you say? You want to get through it?
Right through.
Okay. Let's go straight in. Anybody that has to make a quick stop, we'll make it very, very quick. Does, I know. Out of here till later. Hello, hello. We're back.
We're back from closed session on a 5-0 vote. The board is authorized filing an appeal in the matter of Westland's Water District versus all persons interested in the Superior Court of California, County of Fresno, case number 19CECG03887.
Great. Thank you. We are adjourned until April 14th, next Tuesday, 9 a.m. here for a special board meeting.